watching AIT TV, empowering you. You're watching AIT TV, empowering you. You're watching AIT TV. You're watching AIT TV, empowering you. You're watching AIT TV, empowering you. You're watching AIT TV, empowering you.
Mbarara and Western Uganda. On this 8th Hack-A-Thon, Think Innovation is awarding the best presenter with this brand new laptop. It is a Dell 3340. Thank you very much. My name is Nsamba Isaac Aksam from Think Innovation, your #1 leading computer shop in Mbarara and Western Uganda. On this 8th Hack-A-Thon, Think Innovation is awarding the best presenter with this brand new laptop. It is a Dell 3340. Thank you very much. My name is Nsamba Isaac Aksam from Think Innovation, your #1 leading computer shop in Mbarara and Western Uganda. On this 8th Hack-A-Thon, Think Innovation is awarding the best presenter with this brand new laptop. It is a Dell 3340. Thank you very much.
Yes, thank you very much, you who is watching us live on AIT TV. I am Sankara Biaruhanga, and we are actually coming to you live from Mbarara University of Science and Technology. And you always have to understand that whenever we promise, of course, we get to deliver. We are at the 8th, Medtech Hack-A-Thon, organized by Camtech Uganda and Mbarara University of Science and Technology, all together to have, people or young innovators actually innovate to create solutions for healthcare. And I am telling you, very, very many pretty young people are actually on to hack for healthcare. Just like you could be actually seeing, this is a very, very, important room for every other innovator. And I'm telling you, we can actually have the usually the people getting to enjoy the very, very, very much, have some coffee and all that. I'm telling you, that is always have to be what you have to miss, in case you who is watching us there ever thought that you can ever want to join anything to do with Hack-A-Thon. This is what we mean whenever we talk about such, and this is Mbarara University of Science and Technology thing. It's a thing of innovators. It's a thing of science and technology. You who is watching us live on AIT TV, we are going to be going through several teams that are trying to come out with a number of solutions, and this that you are about to watch is a true manifestation that actually young people could have a say in, on the road to 2062. We are counting 60 years of Uganda having independence, but how about the 100 years? Where shall we be when Uganda celebrates 100 years? 2062 is what I'm talking about. These young people are the same people that are actually going to, have solutions for the same problems that we will have actually had then. Of course, to tell you that the theme of this very Medtech Hack-A-Thon is actually building resilient healthcare system in the era of emerging pandemics, and we're doing that through innovations. I'm telling you, this is what these young people are actually here to be doing. Remember, it actually started on 30th September, which was actually a Friday, with a very, very, good clinical summit, and then later, of course, went for cocktail. We also went now, yesterday was another day for teams, to get introduced to some of these themes and, get to have their own solutions or form teams. And in case they ever wanted to innovate for anything, that was their chance yesterday. And today, these guys formed these teams and they are actually practicing the same solutions that they propose to bring on board. And this is what usually happens. Different teams, around over 30 of them, with each having at least 5 people. And I'm telling you, each one of those is going to be presenting a cool solution for healthcare. I'm telling you, that is actually what usually happens around. By the end of today, we will have a number of them presenting, and of course, judges will have to choose who is the best, who has maybe the best idea, who presented it very well, and all this. Of course, to remind you that the best presenter is actually going to be awarded brand new laptop from, Think Innovations Computers. But also the teams that are going to be winning, around 4 of them are going to move away with cash prizes, and that's why it is actually very, very important usually for such an opportunity. Now, you who is watching us live, I'm going to give you a chance to at least have or feel what is happening actually in the room. You who is watching us from wherever you are watching us and you didn't actually afford to perhaps be around, that's why AETV anyway exists. We're going to start off, I guess, the nearest table. Guys, God loves you so much, and that's why we're starting with you. There are several people watching us live out there. They didn't actually make it here, but we would want to hear from your team. Okay, all gents are pulling the mic to you, and they say God loves us all, but He loves you so much. Yes, you could talk briefly about your team and what you're about to hack for us in this very, very hackathon. Thank you very much. The names.
You're welcome. My name is Victoria Nachito.
Okay.
And we are hacking around the problem of the high cost of healthcare services.
Okay.
Yes. The mere fact that, only 1% of our population is covered under health insurance.
Okay.
The rest of us are at risk of being thrown into extreme poverty.
Yes.
Over high healthcare costs. And my team and I are working towards making sure that we simplify the process of payments for patients, but also to help hospitals to reduce the high unpaid medical bills. Thank you.
That's a very, very serious or critical issue over there. We have economies of the countries, being dragged behind just because of the healthcare that they actually get. Quite a lot of spendings. In fact, next to food, I would say one actually has to plan for life, whether you want it or not. You have actually to spend around medicines and all that. So it's a cool okay, challenges are not cool. Yeah, but it's a very, very huge challenge out there, and we can't wait to hear the solution. Do you mind sharing it? No one is going to steal it. These guys are not going to present. Really? Yeah.
We don't mind sharing.
Okay. Yes.
However,
Yep.
we would love to hear. We would love to have you see us present our solution.
Okay. Thank you very much. I
Yes.
love that. You don't have to go away. You have to keep around to see what solution they are going to be bringing. You know, these guys had a session yesterday about IP patents and all that. So these guys, of course, can be very scared to, you know, share their solution as well as now. But it's a reason for you to actually share with us or keep around and share. I mean, get to see what they actually have for you. Just the names. We could actually move on the names and maybe the courses or where you came from or something. Yes.
I'm Ernest Woji, a biomedical engineering student. I'm very happy to be here hacking. Just
Wow.
wait for what we have to present.
And we're just waiting for you, man. Yes.
Mirumba Nobat,
Mm.
biomedical engineer. Yeah, I'm very happy to be here.
Wow. Thank you very much. And that is the team over there trying to bring us the next big solution around insurance, medical insurance. And I don't know if that is going to be still the solution, but you just have to actually keep around. And that is going to be very, very important for you and me and every other Ugandan that is out there. We are hacking for healthcare. And this is the 8th our Camtech Medtech Hack-A-Thon that you are actually watching live on AETV. Here comes another team. Trust me, I am not going to be sorry, just a minute. Thank you very much. We have colleagues watching us live from all over the world, and they didn't have a chance to come around. They just have actually to have a feel. We're not going to take much of our time, just the challenge, and maybe to introduce the team, just the challenge. We're going to keep the solution for them to watch it at least when the time comes. Thank you very much. Yes.
Okay. My name is Xacha Maureen,
Okay.
and I'm a biomedical student, year 4, and this is my team. This is Eunice, Eunice, that is Cassius, and then Amos. Okay? They're in different disciplines.
Yes.
There's pharmacy, computer engineering, and biomedical engineering.
Wow.
So the problem, we're
Yes.
looking at cancer.
Ah.
When you look at it, that in Uganda, the death rate of cancer is 50%. That means that for every 2 women, 1 is likely to die of breast cancer in Uganda. Now, what we intend to solve is we intend to come up with a system that will be able to detect the early detection of breast cancer. Because the challenge is most times it's detected at stage 3 and stage 4.
When it is too late.
Exactly. So we
Okay.
want to make that better.
Wow. We want to make that better. She sounds like, oh yes, this is actually coming out very, very soon. And I believe, of course, it is going to be coming out. Quite problems are never cool, but that's a huge challenge over there. And we believe we can't wait to hear your solution. We can't wait to see you winning. Thank you very much. Crack on, crack on, crack on. And that is what happens at the Camtech Hack-A-Thon. Always boiling brains every now and then. That is actually what usually happens, and we are here to make sure at least that you don't miss anything within this very, very hackathon. At least I know this hyena, and we have a saying that the hyena you know, or the hyena that knows you, will eat you while at least bringing you closer to your place, so that they are easy, you know, it is easy to find your body and every other thing. Mulunji, right? Yes. Okay. Dr. Mulunji. Wow. Very, very happy to meet you again. This is a long, long, long time comrade, and here he comes. I want to believe, of course, it's a cool, cool solution over there that is coming. Yes. You're going to help us just introduce your team for these people watching us live, and explain the challenge. For the solution, we are going to watch while you're presenting. Thank you.
Yes, so good morning, everyone. This is Jonathan Mulunji. I'm here to be a doctor. Yes, with me is a team. This is Team Moby Worm. And with me is a team of a multidisciplinary team with Imelda as a nurse, then Dr. Jane as a pediatrician, and also Joseph as a biomedical engineer. We're championing a device that is actually with what we have now. It's a prototype, and this is towards preventing hypothermia among the neonates or newborns.
Yes.
Newborns the term newborns comes from that someone has been within 1 to 28 days of life. So we want to prevent hypothermia. So hypothermia, that is low temperatures, and we realize that this is one of the causes of actually infant mortality. So in a country like Uganda, which is also under the developing countries, infant mortality is still high at around 19.7 per 1,000 live births, and we hope that with our device, it will be one of the, and also we have,
Okay. Over there, I'm
yes,
telling you, look at that.
yes, that we shall
You
be
need
able
to look at that. This is
yes, as
first
given
class
as a
prototyping.
yes, as a prototype, which can be able to help us understand better and also prevent the hypothermia, one of the causes of actually neonatal, yes, yeah, hypothermia. To prevent hypothermia, one of the causes of neonatal mortality. So this is to prevent hypothermia or to reduce the chances of a child getting cold, so that in simple terms, to make sure that the child or the newborn is always warm at all times, irrespective of the presence of the mother. But as long as we have this device in place, the baby can always be kept home at all. That down the road can actually reduce on the neonatal mortality.
Wow.
Yes, that is it.
Wow. If you don't mind, maybe another. Okay. Wow. Thank you.
Yeah, so.
Yeah.
Okay. Thank you so much.
Yes.
I'm Dr. Jen, of suffering from this problem. And hypothermia is basically, and actually a study was done and realized that every 1 in 2, that is practically half of the children, when they are at home, they actually got cold, and that is in Uganda. And over still 57% of all children in East Africa get cold as well, whether in home or in hospitals. So this is largely a challenge everywhere in the world, because statistics all over the world, they say 32 to 85% of children in hospitals suffer from that coldness. Well, when they're at home, up to 92%, which is almost 100%, they all get cold. So
that's why you don't have to go away from this live feed. You just have to actually keep around. Did you know that almost 50% of these newborns actually have such a risk? We have a solution built from Barara, and for every other part of the country is going to be gaining all through. We're going to be moving through all teams I told you, and that is going to be for not any other reason but to actually get to hear different challenges that these teams are actually trying to crack, challenges that these teams are trying to solve, and that is why anyway we came to this very hackathon. Here comes another team. Sorry guys, just a little, maybe 1 of your minutes to share around your challenge. These guys, watching us live from wherever they are, and they didn't get a chance to come around.
Yes.
You're going to help us share the challenge. For the solution, I want them to keep around to see you present and get to see what you're actually hacking. Yes, tell us. Thank you very much.
Yes, our main challenge here mainly is we've found a very big challenge of nursing having a very high workload.
Okay, so these people would want to see her. Do you mind standing? Sorry. Okay.
Yes.
Mm.
We're finding a challenge of nurses having a very high workload, in that the hospitals are very big, the patients are so many, the wards are many, and the workload is bringing a big impact of the patients not having to receive the right dosage.
Yeah, they are not attended to.
Yes.
Yeah.
Now, in infusion monitoring is where you put a patient on a drip. So when you put on a patient on a drip, if you're not there at the right time to withdraw that catheter from the patient,
yes,
always blood leaves the patient to the bag, this infusion bag.
Oh yeah.
And that can lead to many adverse effects. So, without finding means of bridging a gap between the nurse and the patient by creating a communication device that will be able to alert the nurses immediately.
Yes.
Once the patient has received the prescribed dosage.
Yes. Wow. We've been smiling, but there's someone, and the explanation was almost close to that.
Wow.
Just because something like that happened at around 1 a.m.
Yes.
and by morning, really, At least maybe it was her time to die, but at least that was actually also a contributor. So
if we had made this earlier, maybe it could have saved her life. Who knows?
very, very much true, and that's why you don't have to miss the solution that this guy is about to present. Let's give you your time, to hack through, crack on, crack on, crack on, crack on. And, well, someone says they need to hear from... okay. Okay, yeah, you could help us link a few statistics to the same challenge in case you have a few statistics. Yes. Okay. Yeah, we could have you take us through a few statistics that you may want to put across to the public. Yes.
So now, one major thing we've seen in the hospitals, yes, mainly the patients, we have lots of patients that end up being anemic.
Yes.
And we have a percentage of over 43.9% of the hospitalized patients having anemia. And then we also have the pregnant mothers being 47%, 40%, the children being 49%, and them having anemia, they end up needing a blood transfusion. Let me say, when they need the blood transfusion, like as you're giving them the blood, yes, and then that problem I've explained happens. You delay to remove the catheter. Always remember, they are weak, they don't have blood. The moment you take long to withdraw that catheter, they will end up dying. Blood will leave them and go back to the patient, to the bag, and hence they will end up dying and losing their lives.
Wow. I'm telling you guys, these are the challenges that you've been looking out for, and the solutions are coming from such teams. We can't wait to hear from you at the time of presenting the solutions. Crack on, guys. I wish you success. Thank you very much. This is still the 8th Camtech Hack-A-Thon, and I'm telling you, we are coming to you live from Bara University of Science and Technology. Young innovators, all kinds of innovators are actually here to hack for healthcare. Different solutions coming out. Here comes another team. Just a minute of you guys. Thank you very much. We are only going to share with these guys watching us live just a challenge that you're cracking on, and I will tell them to wait on at least to watch you present the solution later. But for now, maybe you could just introduce the team and the challenge that you're working on. Thank you.
Thank you.
Yeah, it's okay. Yeah, go ahead. Yeah.
Thank you. I'm Mbavazi Cuthbert, and today, please let
Yeah,
the
sure.
team members introduce themselves.
Thank you all. I'm Mugumi Shaban.
And I'm Mwamusi Isaac.
I'm Joshua Kandwanaho.
Yes, yes.
I'm Habira Mahmoud.
Okay. Now my Twitter guys, you know Joshua Kandwanaho. At least he's he's a legend. Yes. Okay.
Okay, so the problem we have identified and the problem we're working on is elderly home-based care. So we want to improve the quality of care and reduce the need of a caretaker in terms of elderly-based care. So the problem we were attacking is pills, medication. So you find very many of the elderly have so many different pills to take, and they can be very confused about the prescription. So they need someone to be there and tell them when to take them and at what time, when exactly. So, but you find for our young generation, we do not have maybe the time to be there and take care of them and remind them of the prescription. So we decided to come up with an automatic pill dispenser. Yes.
Wow.
That
I can't wait for that. We are going to be getting more details for these guys when it comes to presentation. Can he share with us a few statistics that contribute to this challenge, or that prove really that we might need to get worried about this challenge? A few statistics? Thank you very much. Yes.
Thank you for the opportunity given to me. If you look at the statistics around the world, in 2017, the global population of older population aged 60 years and above was 962 million people. This is expected to rise to 2.1 billion by 2050, with 80% of them living in the developing world, and here in case we are focusing in Uganda, part of Africa as well. Africa, being home to the 10.9% of them, is having inefficient response to that challenge. So for us as innovators, that's why we came up with our innovation to see that even when the parents are bedridden, they are home, they can still take care of themselves,
You
take
could help
their medication. with
help
us
raise
as
it a
well.
bit for my team here to see. Okay.
Yeah.
Okay. Okay. Yeah. That's true. That's why you need to keep around watching you guys.
Yeah.
Okay. Yes. So that is it.
Yes.
Okay. Thank you very much. Crack on, crack on, crack on. We can't wait to see you present, and we hope actually you win. That's a very huge challenge out there. I believe we all have Wazeis at home who actually need the same solution. Thank you very much, Crack on and Success. You are still watching AETV. We are coming to you live from Bara University of Science and Technology. This is the 8th Camtech Hack-A-Thon. We're talking about Medtech Hack-A-Thon. Guys are actually innovating for health. Healthcare is what we are talking about. Here comes another team. There are several usual suspects on this table, and I wonder whether other teams are not worried about this table. Thank you very much, Papa. I think I know you for innovating for health. We are very, very much glad to have you on AETV. These guys would want to see him. Okay, wow, thank you very much. So you're live. We have a few people watching us here. We're not going to interrupt with the session. We want to give you some much time. Okay.
She's the leader for today. She'll do the pitching and the talking. So
okay. Wow. Thank you. Thank you. Thank you. Thank you very much. We just want to borrow a minute to hear out the challenge that you're solving. Don't worry about the solution. I want these guys to keep here to see you present the solution. For now, share with us the challenge. Yes, the names, of course, you could actually also introduce the team. And yes.
Hello, my name is Lona Atimango. I'm going to be presenting our problem for today that has to do with medical errors in the health system and the provision of continuous professional development and medical education that is very haphazard with our current system, and so we are we have a lot of medical errors in the system. Thank you.
Wow, thank you very much. That's another big challenge out there. We could have someone share statistics that actually prove that we may need to get worried about this very one.
Yes, you need the statistics.
Yeah.
Well, studies have shown that at least 1 in 10 of every patient that is present in the hospital has been treated with some medical errors, and that is in developed countries. And it's worse in our low resource settings, and patients don't know that these problems exist, and medical workers fear to bring it out. But we have found that studies have shown that this continuous professional development with up-to-date medical education reduces the risk of these errors. So yeah, we are hoping and looking forward to providing this medical education for these doctors so that we reduce the risk of errors and death among our patients.
Okay, thank you very much. Of course, quite a number of errors happen over there, especially at night.
Yeah.
I lost someone at 1 a.m. and it was related to such.
Yeah,
I understand,
sometimes it's
yes.
not even the doctor's fault. Sometimes maybe the medication hasn't
itself,
worked,
yes.
prescription errors, maybe the guidelines have changed and they do not know about it. Yeah, so we are looking to bridge up that gap between the new information that's coming in and the old system, so that we find a way of harmonizing everything, and everyone in the country and hopefully in the region gets the same information at the same updated time.
Okay.
Yes.
Wow. Thank you very much. We just have to wish you success. Crack on, crack on, crack on. We can't wait to see you present the solution. That will be very, very cool. You who is watching us live on AETV, I told you that's what happens at the Camtech. Innovators get together and have several cool solutions that you may want to hear or see them come to life. Now, here comes another team. We are going to, it's a humble request to share just 1 of your minutes. Share around your challenge. Solution will come in later, but at least you could actually help introduce the team and the problem that you're trying to solve. Thank you.
Okay, thank you. My name is Barrier Angel. I'm part of the Pantipad team, and these are my teammates.
Dominic.
Wow.
Benna.
Okay.
Annette.
Annette. Yes.
Juliet.
Julie.
Juliet.
Yes.
Yes, so our
Wow.
problem was menstrual poverty, which is mainly the lack of access to products used during your menstruation, menstrual products. You can't afford sanitary towels, tampons, menstrual cups, name it. So what we have come up with is a panty pad, which is a panty with a pad sewn in on it. So it solves the problem of girls not being able to afford the sanitary pads because it's reusable. The main thing about it is we are using banana fibers for it, which are readily available and they are cheap, and also they are good absorbent materials.
Wow.
So that's
Oh my, oh my. That's what it means to be at Camtech, and such a solution coming out from such a team. Let's have a few statistics, that really prove that there's actually menstrual poverty.
Yeah. So in 2019,
Yes.
Ministry of Education stated that 1 in every 4 Ugandan girls who started menstruating would drop out of school. Yes. So this is one of the initiatives that we are trying to help these girls stay in school so that they can have something to help them go through their menstruation in a safe way so that they can stay in school.
Wow. I want to believe it will be cheaper.
Yes, it's going to be cheaper than what's already on the market, and also it's a new innovation because no one has put a panty with the pad together. Yeah.
Wow, guys, crack on, crack on. I want these guys to keep on and see you present a little bit more about this solution. We cannot go beyond this far otherwise. Thank you very much for dedicating your time to solving for healthcare. The country needs you. You're the guys that need security. Yeah? Thank you very much, crack on. You who is watching us live, we're still coming to you live from our University of Science and Technology. It is the 8th annual Medtech Hack-A-Thon, and different young people, different innovators get to innovate, get to have several solutions come out. Here comes another team, guys. You're going to allow me borrow just 1 minute of you, share a challenge with these guys that are watching us live, the problem that you are solving, and then we should be able to move just like that. You could introduce your team and we get to that. Thank you.
All right, this is Team Thamos, Edgar, this is Isaac, we have Noeline, we have Edward, we have Jerome and Martha. So this team is trying to tackle the problem of maternal hypothermia. This is an issue that is being affected. This is an issue that is affecting the mothers of our Uganda today, in a way that when they undergo the cesarean sections, their body temperature reduces to below 36 degrees Celsius, which causes too much shivering and discomfort. In turn, it comes up with medical complications such as site infections, wound healing, prolonged wound healing, cardiac arrest, and very many of them that actually in turn lead to the higher mortality rate that we're having right now.
That's a very, very big challenge over there. I don't want to risk to go to the solution as yet. I want these guys to keep on watching to see you present the solution. For now, let's share the extent of how bad it is actually in Uganda. If you could actually pick out a few statistics, that indicate, guys, this is a very big challenge.
Yeah, currently we realize that 30 to 60% of the cases, of the mortality cases, are contributed due to maternal hypothermia.
So you're most likely having so many Ugandans here that lost a mother at birth or something like that, and due to this. Wow. No, I didn't mean wow. This is a very big challenge, and I only request that you keep on to see what these guys are going to be presenting. If you can see the table, it's really hard work here that is going on, and you can't risk to miss to see what these guys are going to be presenting. Thank you very much for allowing to talk to us. I like the vibe, man. I like the vibe. Okay. Wow, thank you very much. You is watching us live on the ETV. We're still coming to you from Barra University of Science and Technology, going through these teams here, young people, joining to see that the healthcare, specifically of the world, is actually improved through innovations that are actually coming from here, made by people of here. Now, sorry, guys, about interrupting you. Just a simple minute for you to explain to my guys here watching just a problem that you're actually solving. You could introduce your team and we head for the challenge. Thank you.
Okay, first of all, my name is Mlopi Morris. I'm a biomedical engineering student at Imbara University of Science and Technology. I have here a team of innovators. She's Liz Akwi, student also. She's Deborah, Ronald, and Daniel. We are here. We are
Yes.
looking at a problem called hypothermia in neonates or infants. This problem is eating up our countries in the low developed settings. You realize the infant warmers we have, most of them are imported from abroad, and they are kind of expensive when it comes to cost. Like you find most students, most children in villages,
Yes.
who are born in the facilities in villages, which can't access this kind of equipment because of the costs and what. They resort to using rudimentary local methods like covering,
Yeah.
wrapping up, which is sometimes when you look at the wrapping up of babies in clothes, you remember this one is a child, the system is still developing, but on top of that you're covering, so you're interrupting with the kind of ventilation of the child. But what causes all this? Because of the high costs of the equipment, these facilities can't really afford them. So we are trying to come up with a low cost infant warmer which can be used in such settings.
We are looking at for my language, I'm going to call them all types of children or babies. We have at least premature, and then we have at least at normal birth, and I don't know, all stages.
Okay, we are looking at children in the range of 1 day to something like two weeks.
Okay.
Okay, we are looking at newborns and the neonates between 1 day or hours to a period of 2 weeks, because these ones are prone to losing the heat because of their body surface area to volume ratio. They are small and they are kind of losing to heat the environment. So they face that challenge of hypothermia.
Such a big challenge. Who on the team could share with us a few statistics that support the same challenge, if you don't mind? Yes? Wow. Okay, thank you very much. We are now about to find out whether actually with this challenge, what is the extent? Thank you.
There are over 2.5 million children who die across the world.
And
the 47% are dying because of hypothermia. So, and here in Uganda, over 200 children die because their temperatures drop from the normal ranges.
Wow. That's a big one over there that we need to worry about, and this guy is about to be presenting a solution that you don't have to miss. You'd have actually to keep around how this is actually going to be a cheaper version, or a more, at least, effective solution to the same problem. Thank you very much. Crack on. Wish you success, you who is watching us live. Do you have any question actually to drop around? You could actually drop it in your comment section, you who is watching us. In case you just joined us, we are live at the 8th Camtech Hack-A-Thon from Bara University of Science and Technology, in which young people gathered to develop solutions for health-related problems. We're talking about healthcare, and that is what usually you have to get to know. In case you ever heard about a word hackathon, that is what happens around. We are going to first switch a little bit. It's okay. It's okay. Wow, sorry guys watching. It's okay. We are going to switch back a little bit to the room, and we are going to be coming back shortly after this. Okay. Yes, thank you very much who is watching us live, and that was a quick update for these innovators. They're going to be, presenting or pitching their solutions very, very shortly. Are you actually ready to hear out these solutions? Quite a number of them, of course, have shared the challenges that they will be, solving, and in a few minutes you're going to be seeing some of these teams present. At the end of the day, at least the best four are going to be awarded cash prizes. The best presenter is moving away with a brand new laptop, and you don't have to miss all this. It's another team, and I can't wait to hear out from them what could be the challenge that they are trying to solve. Is another big one that we can't wait to hear from you guys. Thank you very much. We are not going to go to the solution as yet because we want these guys to keep around and see you present the solution. For now, share with us the challenge that you're solving. You could introduce yourself on the team and we move from that. Thank you very much.
Thank you very much. I'm Kaites Aisha, and I'm with a team of different disciplines. I have people from IT, I have pharmacists, I have people from medicine, and even the ones from from the business side. The challenge we are working on are the stockouts and expiry of drugs in Uganda. We have been facing a lot of stockouts at the different health facilities, mostly those in the lower section, and even when the medical supplies are there at the main warehouse. The main warehouse in Uganda is the National Medical Stores. You find the drugs are there, all the supplies are there, but these lower facilities do not have them. And in the end, we ban these medical supplies because they are expired. And even when people are lacking what to use in the lower facilities. So we are hacking on this problem to make sure that we get a solution that will reduce the spending on expired drugs, and even the health facilities at the lower levels will have the supplies as required.
Wow, that is another big one coming out from could we have on a team someone to share with us quick statistics that support this very challenge? Are we actually solving this challenge at the right time? Is it really that big?
Yeah, it is a very big challenge because we spend almost 1 billion to ban these drugs. And recently we banned over 400,000 COVID vaccine doses because they were expired. And we spent $8 to ban 1 kilogram of expired drugs. Remember, we banned 1,500 metric tons. So a lot of money is spent on banning those drugs that are expired, even when facilities are lacking the medical supplies.
Ah, wow. There's a very, very universal challenge over there, and quite a number of money, of course, getting to be spent on that, while even actually some, groups or citizens do not have, such medicines. And it is a very, very big challenge that you can't actually wait to hear from these guys, the solution that they're going to be sharing very, very shortly. I guess it tackles both health and environment. Do we have any side of environment in this?
Yeah, of course, the banning and the disposal is associated to affecting the environment. We understand when you ban, the smoke will come out, and other factors like in the disposal.
And of course, I guess another big risk, a kid is going to joke around them, someone just going to, there's a picture training of a kid, holding, what is it called, sling, a used sling, and I want to believe there's some huge risks over there. We can't wait to see you present the solution. Thank you very much for allowing to talk to us. You who is watching us live on the UTV, that is what it means to be at the Camtech Hack-A-Thon. I told you, these are the guys that deserve security because they hold our future in terms of, solving such solutions over there. Don't go away, please. And to tell you that, of course, very many solutions are being, hacked at this very place, and we can't always wait to hear out from each and everyone in this very room. I'm telling you. Thank you very much, guys. Nice to meet you guys.
Thank you.
Sorry about making you or interrupting you, but at least bore us with just 1 minute. Share with us the challenge that you're solving. These guys are watching us live from wherever they are. Please.
Okay, my name is Brian Rotomio.
Yes.
We are working on a prototype that we call the medicine auto injector. So this is just a machine that is having the capability. Let's say you are a medical person, and then there is some medicine which is supposed to be delivered, say at midnight, and maybe at that time you would be asleep. So you can actually put the medicine into the system, and you are sure at that very exact time it is going to be auto-injected without actually any human interference. And I think for people who have been within the you give a drop, you wait for 5 minutes, and then some more drops, you wait for a few minutes, and then another more drops until it's done. So for a person who is overloaded with work within so in most cases you'd find that they deliver this medicine at once, yet it's supposed to be delivered drop by drop.
Yes.
Like let's say maybe 5 meals of medicine is supposed to be delivered
Maybe
in
in the
30
morning
minutes
or something. Yes,
Yeah.
yes. Okay.
So that really becomes challenging, and we are looking for a way how we can solve that problems as young innovators. And one thing I really would like to say to the young people outside there is that it's not about complaining to the government. Having now within the country is that the ratio of patients to the medical persons, the
Yes.
ratio of patient to the nurses, patient to the doctors is actually very low. But what do we do? Should we complain on the government every time? The government is not doing enough. The government is not doing enough. As a country, we are not going to move forward. So,
actually a drug. So that's
I'm liking that. I've interacted with a few victims of people of families of people that lost people. I mean, their fellows, just because perhaps they missed out on the oxygen side, maybe because they didn't have power at the facility or something like that. I can't wait to hear out from you the solution that you're bringing on board. But so this is like a biomedic something. I mean,
Yes, yes, yes.
Ah, okay. You're into repairing them, or you want to improve?
We just want to improve the whole system.
Ah,
Yeah, through
what
repair,
what could be a few new features that you're planning to bring on board?
Okay, things to do with maybe maintenance.
Yes.
We're thinking about local and cheaper means of or methods of cleaning the systems, and also probably thinking about a stable. Like you said, you've encountered with patients who have had issues with maybe power challenges. Since these concentrators really work on on electricity.
Ah,
majorly.
okay. So we are most likely going to have some concentrators that perhaps operate on solar. I don't know,
most likely,
maybe
most
or
likely.
something is going to warn someone on phone that maybe there's a challenge here. Run to patient X or something. Quite a number of them. I have interest in that. I am personally developing a system that is supposed at least to at least become a database of all functional concentrators, at least in the land. And whatever gets a challenge, at least you guys could get a notification over there and run to it. Could we have someone on the team explain a few statistics, that depict that this challenge is actually out there and we need to get worried about it? Thank you.
Okay, first of all, on a daily basis, close to 4.2 million children, newborns.
I get for better sound, okay? Yeah.
Close to 4.2 million babies will die due to problems in breathing, due to cases like pneumonia or even failure to breathe due to premature births, and this highlights the need of having a stable supply for oxygen in hospitals, mostly for the newborn babies and the mothers themselves, because sometimes after giving birth, they are weak and they develop conditions which would require a very stable oxygen supply.
Okay, thank you very much. We will need the numbers while you're presenting. There's a number, a daily number of children that die every day due to pneumonia, for example. We need such a number for us to support this very challenge. It's out there, it's happening, and we don't have so many solutions around oxygen for these children. So please, crack on, crack on, crack on. Let's get the numbers and let's get ready for this challenge. I can't wait for this. I will personally be a partner. Thank you very much. You is watching us live on a YouTube. We are still coming to you live from Barai University of Science and Technology. We are at the 8th Medtech Hack-A-Thon, and you know, different teams of young people are actually presenting several challenges that you want to follow and actually understand who is going to have which solution that might change the game for Uganda and the world at large. We will be proceeding to another team, you who is watching us live. Sorry. Yes, thank you very much who is watching us live again. And of course, we get another chance to get into another, you know, serious team. Sorry guys for interrupting you, just 30 seconds of your time, if you don't mind. There's some group of people, you know, watching us live, and they would wish actually to hear out the challenge that you are trying to solve. Don't worry about the solution. These guys are going to keep around to see you present the solution. For now, share with us just the challenge. Maybe to introduce yourself and the team, and then the challenge. Thank you.
Good morning. We are the team on Medical Hub, and we are trying to, the challenge we are trying to battle is the issue of spontaneous disease outbreak with inadequate mass sensitization, which has hindered timely containment of pandemics, and also lack of proper knowledge of first aid emergency, which we have seen that people die before getting to the hospital, or people die due to those small details they do not take in context. So what we try to do is build an application whereby we can get these informations that are required out to the masses. If they get this information, I think it can go a long way to preventing us from getting to a bad state in our medical sector. If you have seen the study we have seen that the way we act whenever a pandemic approaches us determines how it will affect us in terms of mortality rate, economy, or anything. So if we can prepare ourselves the moment in news of a pandemic is approaching, I think we can be able to do something to reduce the way it affects us in our distance.
Wow. Well, I don't want to preempt the solution. For instance, do we have something like prediction or something of maybe pandemics and all that, or you want to take it on generally and prepare for the worst?
I think we are heading into the direction of preparing. Prediction is going to take a lot of thinking, and based now in Africa, I don't think we have what it takes to be working on a prediction something, because we see that people that we are trying to meet don't even understand about this prediction stuff, about how a pandemic works. They still have traditional beliefs that we still hold deep. So we are working on just the prevention case. Let's limit how it affects us, because we have to be realistic. It will affect us because we are not there in our advancement in technology. But we have to understand that let's just help them in the little way we can do. To get across to that stage.
Okay, wow, thank you very much. A little bit of a few statistics over there that you want to share with the people here to, prove that the challenge is actually out there.
Like now we have the survey done by our doctor in Uganda, Dr. Robinson Sebufu, which he did on this COVID-19, where he showed that out of 1,762 participants, 80% were knowledgeable about COVID. Yes, they accepted the fact that there was COVID, but most of them did not understand how to react to COVID. But after the government, the Ministry of Health, released information on steps to happen, you can see that there was an improvement in the spread rate and how it reduced the impact it had to us. So you see the issue, the government released information that they required. But what we are trying to aim down, let's get that information before this kind of thing happens. So the more people are getting to understand this information, I think the more they will understand what they are facing, how to face it, and the required steps to after you have gotten the steps.
Wow. The more people understand what could actually be, about to happen, the more they prepare for this. And the team over there sounds like we need to prepare for these pandemics over there. You don't have to miss to hear out the solution. That is the challenge that they are looking at. Will you be around to see them present this solution? Here comes another usual suspect that one would actually want to think about. Jimmy over there trying to innovate. Always, I at least have lived to see that. Tim, sorry for interrupting you. We're just going to use a few seconds of your time to share with these guys just the challenge that you're trying to come up, that you're trying to solve. Maybe just to mention your name and maybe the team and also the, challenge. Thank you. We have a camera behind, unfortunately. Okay, yeah, thank you.
Okay.
Yes.
My name is Vincent Nemeimana, and this team of beautiful people, we are trying to solve the problem of accessing blood in time, especially for mothers who are delivering, people who have had accidents, and children. Usually when you reach at emergency centers,
don't worry.
we continue. Okay.
Yes.
So when you reach at emergency centers, usually it's hard to find the blood in time, to know where blood is, and also blood donors. You find we have little blood all the time, so we want to find a way of knowing where blood is at the right time in emergencies, and also encouraging people to donate, and we can track them, remind them, give them awareness, and we have constant supply of blood and constant location of where blood is when we need it. That's what this whole team is trying to
Wow,
solve.
it's a timely one, of course, and I'm telling you, it's going to be getting down a few minutes from now. You need to keep around to see what the solution these guys have prepared for you. It is cool solutions within the healthcare. Could we talk statistics?
Yeah, we could talk statistics, and I would love my friend there to share with you how, for example,
yeah, which friend? Which friend?
For a country, for a country to have enough blood,
yes,
1% of the population at least should donate blood. So if you look at Uganda's population of 45 million,
yes,
1% of them would be 55,000 and above, 550 and above, and you find we are getting just 200. So almost a half, we don't have it. So blood donation is low compared to what we should be having. 1% of 45 million, that's the blood we should be having, blood donors, if we are to have enough. And every time, according to Uganda Blood Donation Services, we always have less than 1% of the population donating blood, which puts the country at risk. We always have less blood available for very many people. So statistically, that's it. And most people lose life because of a simple need for blood transfusion. Even in the little that we have, it's hard to track. If I'm looking for blood group A, it's hard to know.
I was coming to that.
If
yes.
it's not in
That's
Imbalala
a bigger
hospital,
challenge, actually.
Where can I find it at this time? You find the person has died, but the blood group actually was maybe at Divine Mercy Hospital, but we didn't know. So we want that system to be able to tell us if there is no such a blood type in Imbalala Hospital, at Divine Mercy actually it is there, so we can quickly pick it and save life.
Wow.
Yeah.
Thank you very much. I can't wait for that. I just hope it will give me freedom, me who is wishing to donate blood, and I'm able to share. Well, he was supposed to give us a little bit of around, more statistics that support the same challenge, in case you have a little bit more statistics that you may want to share with these guys.
So that's the important statistic I can share is that the leading cause of death among mothers who are pregnant is bleeding. Yeah, PPH is the leading cause of death among mothers, and also in children under 5, malaria is the leading cause of death. And this is one of the biggest complications is anemia, which requires blood. And addition to that, in road traffic accidents, bleeding is also a leading cause of death. So those are 3 statistics to point out the need for this solution.
Wow. Thank you very much. Quite bright over there. And crack on, guys. We just hope that together. And please, let's go get this. You who's watching us live, have you ever wondered whether you needed fast? Do you know your blood group anyway? Quite a Another surprising one. It's at least a very, very timely solution from these guys. You have to keep around to see what they have to actually give us. We move on to another team here, and we're going to be, of course, getting to hear out from them a little bit. Just a minute of you to share around. Maybe you could handle. Thank you very much. We only need to have a few seconds of you just to share with us a challenge that you're actually trying to solve here. Don't worry about the solution. These guys are going to keep around watching until you present the solution. For now, the challenge. Maybe you could introduce yourself and the team, and we actually start from there. Thank you.
I'm Changlain Shanisha, and with my team, Safe Ambu.
I'm Joshua Olinga.
I'm Dennis Nareva.
The problem we are working on today is the difficulty in rural areas to access ambulances, especially when expectant mother or postnatal fail to get to healthy care centers, as their only means of transport is a border, which is risky. It is not safe for them because they can have complications within their birth or something like that. So we are majorly coming up with a system whereby we still depend on the borders, but we are having a safe carrier for these mothers that is attached on these borders, such that they can be delivered to the hospitals safely without any inconveniences. Yes, because we discover that the issue is with these in rural areas, it's difficult to get an ambulance, and by which it is very expensive. So we are looking for the means that can be similar, and it is less expensive for them to acquire such safety and such means of transport to the nearest healthy center without them having complications when they are pregnant.
Wow.
Yeah.
That's a very, very, very timely solution over there. For my home people in Chitagwenda, you can relate. This is very, 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 very hard situation over there. And let's talk emergency response. Have you really thought about this? For instance, let's talk the implementation plan. If this is in place, for instance, are you going ahead to think about how this could actually help in emergency response around maybe pregnant mothers or something?
We kind of considered that in such a way that usually in villages there are always border circles.
Okay.
And you have to do a sensitization for them to know. And maybe it can be with means of having reflectors. They always have numbers on which to call. So when they get in touch with people who are in the village, so someone will always know who to call. You get? And even if they are not yet, but they will have to know that maybe within this period of time, I will be expectant. You get? So they will call earlier, and someone will be on a standby to know that I have to pick this person if they call me. That's in case they call me and there is an issue.
Wow.
So maybe.
Okay, yes, you could say something, yes.
So we want to work with what the community already has.
Okay, yes,
so
I understand, yes.
The mothers right now use borders to access hospital. But we just want to ensure that want to use the available means, but improve on it and make it safer throughout the transportation process.
It's very, very important and timely, just like I already said. And you're looking at having this attached to the already existing border. Nothing like some new
this
motorcycle.
Is
Yes.
Doesn't use any fuel.
Yes.
Yeah, you're just going to be required to pay some fee, the same fee you pay for the border. Just that you might be required to add some small price. Because this will not only provide transport, it also comes with some incentives. So we look at providing mamas with the mama kit. We also have vacancy for maybe a health worker, a midwife. She can stay in there with the mother and monitor her throughout the journey.
Okay. Wow. We are going to talk issues of affordability later, or we can actually share them now.
Now we shall talk that later.
Okay, thank you very much. But at least let's have a solution. And trust me, you can never have to think about a very heavy mother over there, and you're again sitting how on a border be in that very sitting posture. And trust me, it is all going to be nasty over there. Crack on, guys. We cannot wait to have your solution presented, and we wish you success, of course. It's a very, very timely solution that I personally like for my people in Chitagwenda, and that is going to be my other, head-on in case such a solution, comes on board. Now here comes another usual suspect. I want to believe it is going to be a very cool one from this corner here. Sorry guys for interruptions. I just need to request for just a minute of you. We have a number of guys watching us live, and one would wish to just hear about your challenge that you're actually solving. Don't worry about the solutions. This guy is going to keep around here to watch when you're presenting it. So currently, just help. Maybe you could introduce yourself on the team and then help share around the problem that you're actually solving. Thank you very much.
Okay, you can get me?
Yes?
Sure.
Yeah.
So I'm called Daniel.
Maybe, a little bit, yes. Okay.
And we are working on Humra Belt. These are my team members. Maybe they can introduce themselves.
Okay.
Mazim Nadra is my name.
Yes, Bagma Blair is my name.
Wow.
Yes.
Okay. So, yes.
So basically, what we are trying to tackle is the menstruation pains faced by all the female workers, or even at general all females that are in the country all over the world. Well, we get to see that menstruation is part of a female's life, it's by nature, right? But then it comes with a lot of pains. When you're menstruating, you feel that discomfort. And one thing that you cannot neglect is that if you look at the numbers, most of the frontline health workers are the nurses, the midwives, and these are females. So the ratio of females to males is quite a lot. But then what we're not looking at, the problem that we're not looking at is that in a month, calculate like 5 days of some nurses to actually be off. So that means we are reducing the output and the way how we are delivering health to our patients. Is that okay? And if you couple it with how the numbers of patients, of nurses and medical health workers to patients, the ratio is very low. So if you have layoffs or times where these nurses or health workers, female health workers in particular, are not giving in their best, that means the general outlook of the system is actually going down. So what do these people do when actually they're cramping? For the nurses and the whole women at large, most of them resort to taking, painkillers, and these become, they're not okay.
Yeah, they have their side effects, yes.
Yeah, some people actually carry around, hot water bottles and move around with them. So that is basically that, in a nutshell, what we are trying to solve.
Wow, thank you very much. And I guess it is timely, and we can't wait to hear around the solution. Maybe we could have someone share to, a little bit of a few statistics that support, that show really that this challenge is actually out there and we need actually to worry about it. Do you have a few statistics? Yes, thank you.
Yeah, with 9 out of 10 nurses being women. Oh, sorry.
Okay.
So with 9 out of 10 nurses being women and almost 2/3, which is 65%, aged under 50. Just the average age of menopause at 51, a significant proportion of nurses have to consider how to manage their period and pains. So we see out of the healthcare system, about 70% of them are nurses. And we have a big, significant number of females that compose the 70%. When we look at also the midwives and also doctors, then it is a huge number that is affected by these menstrual pains, and most of them are under the age of 50.
Okay. Well, it's going to be a quite well. We can only first hear maybe out the solution, and then a few more questions perhaps are going to come around. But at least one would want to go for affordability and comfort itself, just like you had it, because just like you said, at least every other normal woman is actually going through all this. We can't wait for the
Right.
solution.
Thank you very much.
Thank you very much. Crack on, guys. And yes, you who's watching us live, we are not going to solutions for a purpose, because you must hear out from such guys. What do you think would actually solve such a problem? Please keep around and you should be able to see these guys present such a solution over there. We're still at the 8th Camtech Uganda Medtech Hack-A-Thon, and we are telling you that the theme, of course, is building resilient healthcare system in the era of emerging pandemics. And of course, to update you, maybe teams are now being, divided into, different rooms for at least pitch. One would call them pitch preparations, at least in case one has to change a little bit. A few of course, get a better way of, explaining their solution to the teams later. That is actually what is happening now. In case you see a room empty, we are getting to divide these very teams into the different rooms, for such. And today we are going to have most of them present their solutions. And just like the director just put it, of course, the first 4 teams are actually going to be awarded. And like we already told you, the best presenter walks away with a laptop that is ably funded by, or supported or brought in by Think Innovations Computer Shop, that is actually here in Mbarara. And that is more for you not to actually go away. Of course, to inform you that this happens annually, and of course for the last 2 years we actually missed this because of course, the pandemic that hit the world here and there. And of course this comes for the very first time in those 2 years, and trust me, we are actually doing good when it comes to at least the last 3 days that we have seen. Attracted very many key players over here. And if we're to talk communication, the communication side from Mbarara University of Science and Technology in the Public Relations Office is actually the major or key office that enabled us to bring to you this very live. And quite a number of course of updates are going on Twitter, and more and more and more. We have, of course, more people that are actually updating all this. And we are going to be moving on to the next team. You who is watching us live, so that you don't have to miss anything for this very, very day. And in case you have some people that you to move together. Now here comes another team that we need to listen to. Finally I meet you, Jacob, Joshua, but at least you're one of the people in the Bible. And that start with a J. Those names are not so many, Jesus, Jacob, Joshua, James, all those in the Bible. But this time, say hi to the viewer and let's hear out from you. There are quite a number of people watching us live from the solution later in a day. But for now, just introduce your team, share with us about your challenge, the challenge that you're trying to solve. Thank you.
Okay. Well, my name is Satoshi Jacob.
Okay.
Yeah. Basically, the challenge that we are working on is reducing death among pregnant mothers. Yeah, that's what we are trying to solve, because this death will normally result from complications that evolve due to lack of information. Yeah. In this case, we're going to develop an information system that will provide details or what pregnant mothers are supposed to go through. It will provide videos, tutorials to educate these mothers about how to handle their pregnancy and then how to stay safe. Maybe even to identify these health conditions that needs to be taken into consideration before it gets complicated.
Let's talk statistics.
Yeah.
let's talk statistics, a few statistics that support what you just said.
Well, in my team, there's a medical doctor who has surfaced this, and he has experienced this in his hospital where he works. So let me hand over the mic for him to give the
Okay, yeah, thank you very much. Let's hear out a few statistics from you that support the very, very challenge that you are actually trying to solve. Thank you.
Yes, please pardon me.
We are interested in hearing out statistics or proof that this problem that you're trying to solve is actually out there, and we need to actually get worried about it.
Okay.
Thank you.
Let me talk to the believers. Imagine Mary had died when she was pregnant or when she was delivering. Would we have had Jesus to save you?
Certainly no. Obviously no.
That is how serious the issue of maternal death is. According to the WHO statistics, it is stated that every day, every minute, a mother dies due to complications during pregnancy or childbirth. However, despite the different strides which have been taken, the rate of maternal death is still going high. In the recent data released by UNICEF, it has been stated that maternal death in Uganda has increased from 343 to 372 per 100,000 live birth. That tells you how much more. Those are not insignificant numbers, because every mother, the death of a woman counts. It affects the child, it affects the country, it affects her family, and all round. So that is how serious, and that is why we feel it is important and right for us to come in with an intervention which seeks to address the cause of the death from the roots. One of the identified causes is that mothers come to the hospital due to complications. And why do the complications arise? Because they delay. This has been summarized into what they call the 3 delays model. Delay to access information. Mothers get mild conditions, but they don't know what to do. They have no information. So us coming out with this application, we want to extend this information to the mothers wherever they are. Whether you have a smartphone or not, you can access this information, and it is free of charge. Then, when the mothers now get a simple condition, they will be able to recognize it early enough that they seek medical care and medical advice before it has become a complication. What does that mean? We are going to tame down the deaths that are arising from complications, and that is the gap that we are seeking to solve with this, our innovation. Thank you very much.
Wow, thank you very much. We can only wait to hear out from you about the solution that you're actually bringing on the market. I'm telling you, these and more solutions are actually coming out from these innovators at the 8th Hack-A-Thon. And trust me, there's going to be very, very many of them coming around. We are going to be having a number of, teams getting divided into different teams, just like I already told you. And we're going to have, of course, a short one. After that, we are going to at least be showing you what is happening in these different rooms. You who's watching us live. And trust me, we can be able to have these updates every other time. And again, well, of course, behind over there, I told you some coffee is all through to, keep these guys awake and innovating all through. We have teams from NITA Uganda already around, quite a number of partners, of course, a Ministry of ICT. I think we will be having someone from the Ministry of Health. All these dignitaries around here to see that innovators actually get to have solutions for people that may need in healthcare, of course. Like I told you, we are talking about Uganda at 60, but where shall we be at Uganda at 100? Some of these solutions are actually coming out to make sure that the future is actually secure, just like it was in the last, campaigning and sloganeering, if I might say, securing your future. Some of these solutions are actually here to affirm that. Now, you who has always heard about the word Hack-A-Thon and didn't know the very right word or the very right meaning of what actually this means, is to inform you that what you just watched on your TV and what you're actually about to watch is the true definition of Hack-A-Thon. A true definition of having solutions being born from people that you might want to say are on ground. They have faced it, and that's why we had actually the clinical summit, to pull out all these and to affirm. We've seen teams tell you statistics, share with you statistics that show that actually it is true indeed. Such challenges are actually existent in our community, and that is what I am telling you to always have to pay attention to. Some of these, of course, challenges are going to be getting solutions from none other than any other people, but for our own people here in Uganda and our own people that gathered at Mbarara University of Science and Technology. Of course, this is not to say that the people that you just watched are all from Mbarara University of Science and Technology. We have a number of them. From different places of different institutions, all coming together to show you or innovate with different solutions. And like I told you, the next step, we are going to be having these teams, pitching or presenting the solutions. Even you actually could judge from wherever you are which solution you would wish to see out there. And Camtech Uganda is here, of course, to say, no, we are here, guys. Don't worry. Those ideas could actually come to life. And that is all the sole reason we have such. Now, in case you're watching and you're one of the people that could actually fund or, support such innovations, you are always welcome to such platforms. And I'm telling you, you can always have to, come in and support. Just like you can hear in the background, quite a number of people, of course, are getting out to, pitch or try out something. The teams you see coming in, it means they've actually done their part already, and that purpose is actually to make sure that they have a clear pitch that they are going to be pitching for a competition that is actually about to be happening. It is only those that are going to present very well, it is only those that are going to have these challenges, communicated very well, that are going to be actually awarded. Dr. Data over there that you hear in the background, of course, trying to guide different teams. I'm telling you, he actually said if he cannot explain it to a 6-year-old, then certainly you're not going to be knowing it. And that is generally the idea of, behind these teams getting ready to pitch. That's the idea of having them prepared. Like I told you, we started this on Friday with the clinical summit, in which different panelists, of course, dedicated their time to share a few challenges within the healthcare, and later to have a cocktail in the evening, only to lead to yesterday, when actually keynote addresses, so much or so many of them coming on board to be aired out. And that's where actually these students, or actually innovators, have been able to draw their ideas. And today we are about to witness these solutions coming to life, these solutions being presented, and which idea is actually going to make it to the top 3 or the top 4. All that can only be, gotten to be known if you actually keep around, if you actually keep watching a YouTube. We are going to be coming back to show you what is actually happening in different rooms. Please don't go away.
You're watching AYIT TV, empowering you.
Professor? Naida, anything? The business standard is not. So you can, instead of having that there, you can just add, back to this is how this is our target market. We are looking to check the way you the business model. So all of the other information and everything that's necessary, just point us to very some of the Okay, anything?
The first slide is too wordy. I'll make it simple so that the reader does not need to read, but just maximum 4 words, like 1 line.
Okay, thank you, my big team. Next team, please. Ultra. So you can go continuously. Okay, thank you. So we're going to present the ultra-mammography. Now, statistically, there are 2.3 million women that are diagnosed with breast cancer. And in Uganda, a low resource setting, we have a death rate of close to 50%. That means that for every 2 women that have breast cancer, 1 is likely to die. This is mainly due to the fact that there is less diagnosis. And it's usually at stage 3 and stage 4. And the current existing breast cancer screening modalities have MRI, mammography, biopsies, and ultrasound. Now, much as ultrasound is the cheapest, interestingly, it's not used in Uganda. I haven't had it so far. Now, this is mainly due to the quality of the images it produces. And it also poses a difficulty for medical professionals to tell the difference between a fatty tissue and a cancer tumor. So this is where me and my team come in, where we intend to develop a software that is going to be able to interpret these ultrasound images. We chose ultrasound because it's cheap, it's safe, and it's non-invasive. Now, it's going to use, our system is going to use AI to be able to interpret this. That means we are going to get an ultrasound image which already exists. We kind of do an image segmentation and we plot the different pixels that we have divided and form graphs as you can see. And from that, you can see the difference in the graph. And we shall expose such information and data to the system so that we can train it to be able to identify the difference between a fat tissue, a mass tumor, blood vessels, among others. So that's one of it. So the public health impact is this is likely to increase the number of women that go for breast cancer screening, especially below the age of 40, which result into early detection and diagnosis of breast cancer. And that's our business canvas module. We have customers, hospitals, research institutes, and then for the partners, we intend to partner with AI system developers, sonographers, who are the technicians in the ultrasound area. So for the commercial viability, we are targeting about 5% of these facilities. So we collect an annual subscription of 150,000 Uganda shillings, and overall, we shall have a revenue of more than 85 million shillings. And then those are our partners, which we intend to partner with. Thank you. 2 minutes and 50 seconds.
the team, humans like to see. So I would like to see each person depicted in the photo, the name, and not in full caps, the name in normal writing. Full caps are harder to read. And then each person to function in the team. What are you doing? The one is near the other one, so that we see the team composition. And then you can also add some branding, little branding. Maybe you have already an idea of a logo. Not too heavy.
Excuse me, those, give us, please, the noise is too much. Thank you. John?
Yeah, I think for me there was a slide where you talked about ultrasound. Yeah, you are trying to explain your problem here, and then you kind of chose ultrasound. Can you go to the following slide? Yes, exactly. I wanted you to show, because when you were talking, you talked about difficulty in interpreting ultrasound images. So if you had an image of an ultrasound breast with a tumor, and you say the image is the tumor maybe in the center of the between a tumor and the normal eye. I think that would explain it much better.
Professor, anything?
Okay, thank you. It's a great presentation. Let's make sure that we write
Wafula?
Yeah, some just surprised with the statement I mentioned that it will either be not picked. You mentioned that this, what you're proposing, will bring about early numbers. I think you numbers of early detection. That will come up very well. Because sometimes if someone doesn't listen very well, it might be so you must put your face on that and try if there's a way you can say it better. Like, because it's the actual one which is the practice of the solution. So highlight it and then bring it up to the data so it's visible immediately to some patients.
Smaila, you take?
Yeah. I gave this comment earlier. When you say you're going to train your module, your AI module, please give us an idea of where you're going to get this done, because it's not easy data to get. So if you have ideas of where you're going to get it to train your AI module, please share that and tell us.
Thank you, Team Ultra Medtech. You can go and improve from the comments. Next, Paul. Who's next? Next team. Yeah, they are. You told them. This one here. This one. No, this one. Super health. Super health, right? Yes, please.
Just come.
Please. Which one is ready with the computer?
You guys have a computer?
Yeah, how is it going through?
This is
Where did you put the HDMI?
I put for a certain team. They came prepared with all their gadgets.
What does this one have?
It does not include that. I wish I had told them to read it. So, who can get team of mobile hazard?
Local and the team this nurse, oncology nurse. Was it that? Help me with your connectors for now. No, Imelda will handle that. Yeah, you're the good team. Thank you.
Yes.
Yes, please. Do not sleep in front of the cameras. You know the cameras here. So these are things that you have also to be prepared for. Martin, we need your help. Yes, you should start.
Good afternoon. I am Elizabeth, and I'm working with a team that is working on an infant formula. Yes. So in East Africa, the full prevalence of neonatal hypothermia is found to be 57%, and this is because the health facilities access these formulas due to their high cost. Hypothermia is not normally the direct cause of death, but it can lead to conditions that cause the death. So hypothermia is when the temperature drops below 35 degrees. Yes, solution. So the current innovations that exist are quite expensive for the low resource settings, such as health centers. So I want to make a low-cost infant formula with the local materials that we can have, like electric bulbs, the switch, plus electric wires, and lamp holders. So this innovation for the prototype, it utilizes 4 electric bulbs, each of 100 watts rating, and 98 watts are dissipated in form of heat. This makes it to a total of 392 watts in heat. They are surrounded by a reflective material that reflects the heat down to the baby, and the mesh reflects the workers from the bands, and then it's supported by a wooden frame that is movable from one point to another. This is how it's supposed to look like. So, our main market is the developing countries because they want to meet these low-cost innovations, because the current formats are about in a range of 1 million to 10 million, and then they are mainly in the expensive hospitals. So we believe that these ones will be used in low facilities. Yeah, our approximation for the price when we make a real one can be about 350 Uganda shillings, which is a bit cheap, and they are portable, and then they will not be in contact with the baby, so the contamination will be reduced. Thank you.
Still a few minutes, seconds. Tell us what to do. So, you feel the heat when you're okay, good. 2 minutes and 15 seconds.
I think for me, it would be good again to show what is currently being done and why it is not quite enough to provide the kind of work needed for the baby. Yeah.
And make sure the warming, the infrared source, is not blinding. Imagine you are sitting there like you're in the spotlight in the studio. So the visible light should be less than the infrared light.
Snyder? Yes, your slides are very inviting, so your message gets lost in there. Your point of position is not clear. So try and make them less wordy and focus on what's really important about your device and what's unique and what sets it apart. I know you talked about affordability, but is there anything else that should be essential in a baby warmer that you're bringing to the table and you're not speaking about it? Talk also about your innovation, what makes it different. Like you mentioned that there are a couple of baby warmers out there, so I would really like for you to concentrate on like just summarizing the problem and the solution and what makes it unique, and then of course how you go to it. But just try and reduce the text. Professor, you say?
Yeah, I think the mind is very fast different from already here. Just improve on the slides, the text, and the middle of the music. This is a problem, and this is the thing. And if you can put some story, show the design, those things. I think it's spectators. I think she mentioned it and I mentioned it. Presentation. The person who is speaking must be clear. When you say 300, you mentioned 350,000. That's someone has to be able to be very clear on the figures. And then true like the micro mentioned. When if you have to all the lights, yes, they provide the work, but what are the consequences? Excessive light, so you must find a way neutralizing that so that the light doesn't have green negative consequences. And then maybe applicability. If the light is the light only on electricity. You bring the piece. How about places where there's no access to electricity? You can think of packaging it so that it's uses multiple sources of electricity. Maybe solar or something like that. If it's only using electricity, just think about diversifying processes.
Okay, thank you. The next team, I've been told that we need to be fast to go back, so try to be as fast as you can because you really need this feedback to improve on your work. Next team, please.
Team number 5.
And we are never following because
How many are we?
Good afternoon. My name is Victoria Nachuto from Team Uganda. We are a health financing platform. Last year, a story ran in the papers that a hospital named TMR and National Hospital in Kampala had detained a body of a business tycoon by the name Tom Kaya over an unpaid COVID-19 bill of 430 million Uganda shillings. Now, it took the president of Uganda to have this bill cleared. The COVID-19 pandemic exposed a common practice among healthcare providers of detaining patients over unpaid medical bills. Now, this practice is illegal and undignified. However, there are no viable options for healthcare facilities to recover their money in order to provide the care that we all need. This same pandemic also proved to us that at any one moment, any of us can fall sick, be hospitalized or be on that mechanical ventilator. And this means high catastrophic expenses. Additionally, we have no comparison of the prices of different healthcare facilities. So this means that we are at risk of spending much more than we could have. However, we don't need to know that because we are here. We are providing a mobile platform that allows us to fundraise from individuals and institutions into a health fund that allows us to pay hospitals upfront for patient bills so that they can get the care that they need and pay later in installments over time at zero interest and without surprises in the costs. This means that hospitals the high unpaid bills in hospitals are going to reduce significantly, but their incomes are also their revenues are going to improve so that they can run their facilities better and offer better patient satisfaction. Any person will be able to afford quality healthcare services. So this is how it works. We have our app allows patients to sign in, and another portion of this app allows our financial partners to either invest or donate with us. And the other part that allows the patients to make their installment payments. The future is us using data and artificial intelligence in order to develop individualized payment plans that families can afford. Our target market is healthcare facilities, and we charge 20% commission of each bill that we cover. Our users for the start, we are targeting teachers and border men who will subscribe at Uganda shillings 10,000 annually to have their account activated. Diana?
Yeah, so briefly, let's give the feedback to allow others. I think we're behind.
Yeah, I think for me the problem is you portray COVID as one of the problems on which your solution is hinged. But we all know that during the COVID period, even the insurance companies weren't providing any cover. So even if your thing was working, probably wouldn't help anybody in the COVID period. So could you try to diversify your problem during the COVID pandemic?
Okay.
Yeah, for me it's not yet clear how the sourcing of the funding comes and how the money goes back. Because if there's zero interest with the funder and you're charging 20%, where is the win-win between the funder who provides the money and you who links the money to the user? There must be a win-win. Wafula?
Yeah, I will just highlight one thing. The stakeholders accept it, because you're talking about clients and business donors. How do you intend to bring them up? Because before you do this and make it work, you must tell us how you intend to bring them on board so that they accept. So there must be a modality for stakeholder acceptance first before you make it work.
Thank you so much. I think you need to simplify what you're doing so that anyone can understand. Make it simple enough for everyone to understand, because if the components of insurance, there's the loan part, and you're not making it out here. So just try it simple.
Professor?
And what you do is after what the explanation of the problem.
Next team, please.
Teams who have finished, please leave the room.
Yes.
It's only the teams who are still waiting to come in. The rest is leaving.
Where is the next team? Where's your laptop? Or you don't have the laptop? The next team, if you're not ready, another one.
start. Who is presenting?
Okay, let me go.
Good morning, everyone. My name is Mary Anthony Naseje, and I'm here together with my group to present to you a catheter monitor. And the main problem we are addressing, first of all, we know that in hospitals we have a very high number of anemic patients, and research has shown that 43% of the hospitalized patients in Uganda are anemic. 40% of them are pregnant women. Many are in accidents, then 47% of the children are below 5 years. So we find that nurses find a very hard challenge managing these patients. They have a very huge workload in transfusing their blood because the anemic patients need transfusion of blood to their bodies because anemia is when you lack blood. So as they are transfusing the blood, you find that, let me say all this is a ward, and it's only one nurse supposed to monitor all the patients, and he has to move to patient this, patient this, patient this, patient this to check the progress of the infusion. We've seen up here, like this shows the infusion bag. Now let me say like this bag is complete and infusion is done. Like the nurse is not there, let me say it's 1 a.m. at night. The patient will lose blood because the blood pressure of the patient will be higher than the pressure of the bag. Hence he will end up losing blood and it goes back to the catheter, and that will lead to adverse effects. So we want to reduce the workload of the nurses. We are saying that we have the percentage of the ratio of 1 to 1,884 patient, nurse to patient ratio. And that burdens and depresses the nurses. As we can see, like, we have a depressed nurse there. And what is our solution to this problem? We want to bridge communication or create a communication device that is going to immediately alert the nurses once the infusion is complete. What do I mean? The device we are going to make is going to have two systems. First of all, we have a device that is going to be, let me say this is a sketch of the infusion system. This is our infusion bag, this is our device, and then we shall have a central monitoring system in the nurse's rooms. So this device, it consists of the light-dependent resistor sensor, the LED, and then the radio frequency module. The light-dependent resistor will detect whether there is infusion flow. Once the infusion is complete, or in case of anything, it will send signals to the radio frequency module, which consists of the transmitter and the receiver. The transmitter will send signals to the receiver, which will activate the buzzer and the LED in the nurse's monitoring room to tell him that patient bed number this, infusion complete, they need to be discarded, and we shall have our LCD that will display that. Yes, then our value proposition, our product.
Time up.
Okay, so I think for me, the problem and the solution don't entirely match. Your problem is anemia, and in the hospital, if you're anemic and there's no blood in the hospital, your system is usually not going to help any anemic patients in the absence of blood.
I want to just take that and answer. Yeah.
Okay, you're describing too much detail. Just be clear, what is the issue is that the drips have to be monitored. Whatever infused, it's actually not on the blood. The issue you're solving is that the drips, the IVs need to be monitored. Even an IV of saline solution still needs the same to be switched at the time when they are over. So it's not the anemia, it's the device, the drip.
Yes, I think just to narrow down to the real problem. Don't talk about the nurses getting tired because the issue you are addressing is monitoring the infusion process. Whether the nurses are tired or not, just focus on that. Because that's what the gadget is all about, not about addressing the particular nurse or that. So just narrow down to the infusion process.
Thank you.
Specify, don't be specific about only the blood, like you mentioned, I will tell you trips for saline water.
Thank you, Professor.
Okay, thank you very much. Now about the slides. The two columns, just are the slides to make them clear. The slides here, you're having two recording.
Thank you so much. Mine is, I see that I'm not from a medical background, but I know Camtech, like, I don't know, yeah, I don't know if it's the right word to use for your idea, but you're calling it a catheter monitor and then the drip in the image. So I'm like, okay, is it the right word? But yeah, maybe someone from the medical background.
Did you look at their business kind of the one I wanted your business? Sorry? The business, since you're into the business background.
Yes. Yeah, I think you need to clarify how you're going to make money, who's going to actually pay for it.
Okay. So thank you. Next team, take all that they've told you, go back to the next room and improve on work. Next team, please. Yeah, what's their name? Bloodlink. Where is the laptop? Those who are done, go back to the next room, the main room.
When you touch these things,
when you touch it works, I think these things know you. Come and touch again.
that is not true.
The fiber is open. Yeah, there's some wires.
It's coming. Even Dr. Jones, when he touches it, comes up. He started to know me.
Who's presenting? We need to move. Okay,
So good afternoon, we're presenting value. So how many times do you wake up to news each morning that the general hospital is facing a blood shortage? There's someone in the hospital that painfully needs blood and they're all negative. Or there's been an accident somewhere that needs an urgent blood transfusion, but the hospital does not have a blood bank. So this is our current problem, is that blood transfusion services are part and parcel of any resilient healthcare system. And quick access to blood products has the potential to reduce maternal and under 5 mortality, because we know the leading cause of maternal mortality is hemorrhage. However, currently, the Uganda blood transfusion services do not meet the national demand for blood. We need to collect around 450,000 units according to the WHO, but we only collect 300,000 units. So there's a shortage of blood during this emergency. One, because we do not have inadequate donor registration and tracing to follow up with donors and make sure they donate blood more than one time. We lack a central coordinating system to follow up these donors over a certain amount of time, and we do not have enough avenues to donate. And so this brings us to our solution.
Our solution is a digital platform that ensures timely access and increased availability of blood products through advancing donation and enabling fast location of the needed blood products, especially in emergency. BloodLink will have features to advance blood donation, like a database that tracks donors and reminds them of their schedules to donate, and also has a feature of scheduling appointments for donation, in addition to publicizing blood drives and giving people who want to donate the ability to locate these blood drives. There will be a feature of gamification to incentivize people to donate through things like badges, and also giving them the identification which will ensure that their priority lists once they need donation of their relatives. One of the features is that health workers will be able to search for donors in case there's an emergency and there's a particular blood product needed, and also search for blood, and also donors will be able to search for blood drives in case they want to donate blood, and in addition to that, they will be able to find blood drives whenever needed.
So that brings us to the question, how commercially viable is our solution? I'll take you through our customer segment. We intend to work with private hospitals
and also with patients that urgently need and require blood. I'm sure you've all been in a situation whereby maybe you're a caretaker of someone and you need blood, but there's actually no blood to give the patient. So we're going to work with such people, and then also with persons with chronic conditions, such as certain types of cancers, and then also we shall work with donors. Our revenue streams are going to be from annual subscriptions for people that have those chronic conditions. We shall have annual licensing for private hospitals, and for emergency situations, we shall have a one-off subcharge for every blood access that they may need. The key partners shall have Uganda Data Services, which will enable us to give us a local database.
Time up.
Okay, do you want to talk? Yeah. Could you consider a functionality in it where blood donors are mapped and you know each blood donor's status and when they're due? Now, when you have an emergency, you say, okay, in Barara Central Hospital, I need a blood group O negative. And then you type in, you find like an Uber, all the O negatives households, and then you either call the person or you go and pick from the person. Thank you.
I'm just thinking the partnerships with the private hospitals, blood is supposed to be free.
Yes.
So when the hospital starts paying for accessing blood, I would think that they might start selling the blood also to the patient. I don't know. I don't know how to go around.
Professor?
So otherwise, it's a good presentation we need to put it out. And probably need to include the technical feed into the
Wafula?
Yeah, I think it's a good presentation, but just I wanted to bring out the impact of it, because when you go to the distance about the situation, the current level of blood being 350,000 persons, 450,000. So just bring out what the capacity of this innovation will have addressed the accounts, if you can have figures, something like that, to make the impact more.
Yeah, maybe just make your concept different across all the slides, and then try and address the supply side as well. How it's going to make people to actually be willing to donate for others. So bridging the gap between the demand and the supply side.
Yeah, thank you, Tim. Guardian therapy. Today, there's been delaying this morning, so that's why I cannot do the tablet. They were the first on the list. Yeah. The fee was then 100,000 per bag. 100,000? The price.
In the private hospital.
Black market. And the donor who has over 50 donations has not got any alert and any pin anything. If you are not regarding over 50. Someone over 50 is supposed to get like silver or golden pin. That comes to 400. If you make a flight tonight, okay, just need to start presentation.
So this is about the and basically our problem today, we see that in Uganda, it runs about among the top 6 countries in Africa with pirates of disorders, depressive disorders, which was given 4.6, and mental disorders 2.9. 2.9. And according to this newspaper, which was written in May 13th of 2022, it was shown that 14 million Ugandans are suffering from a form of mental disorder, among which the highest is being depression and anxiety. And we also realized that the ratio of the psychiatrists available in Uganda to the ratio of the patients who actually need mental health is 1 to 1,000. So majorly because even with the rising pandemic and everything, you find many people are facing depression in terms of people are losing lives, their loved ones, loss of businesses and everything. So we are having high rates. And so one of our solutions we are having is through creation of this app whereby it is going to be an interface whereby we are targeting people who actually think they might have a depression, or those who actually don't think that they are suffering from depression. So we are having both of them that think they have and those who don't have. So when they log into this app, they have different options. So on the daily assessment, this it has questions which actually capture most of the things, the signs of depression. Those are the most questions. So it rates you on the different depression level or status that you're on, and then it has different other options like relaxing sounds, and then also an option of talking to the counselor. So we want to bring many various psychiatrists, counselors onto board so that you can actually access both all of them onto this, so that you can have many experts, psychiatrists whom you can talk to. So one of the things also it's about having live chats, videos, and people. So like you saw before that, we were talking with, so like you can generally have chats with them. Yeah, or the other last thing, you can have chats with them.
Time up.
Yeah, so I think you can also see by yourself that you're a bit disorganized. You can't find your slides, and that is a problem. And in a way, your solution also got lost in there with the slides. So I think we need to be very clear. The problem is depression. Our solution is an app. This app does 1, 2, 3, and that will make it possible.
And how do you make money out of it?
Anki has asked how do you make money out of it. Don't answer.
No. Also, make sure you're be conform. Where is your
What's the reference using a newspaper? Newspaper is a primary documentary form, procedure. Maybe you need to cover that one up.
Okay, thank you. Wafula?
Yeah, just go back and organize your presentation, but look at one factor. If you're going to rely on your clients or persons who normally it's mental health is out of self-denial. So for someone to initiate a process to interface with you, it's very difficult. So factor that in, that most people who are victims of this mental disorder always believe in, there's some kind of self-denial, so they will not accept that they even have a problem first. So if you make them to be the ones to assist themselves first before they interface with you, maybe find a better way reaching out to them so that you bring them on board and then you help them, other than asking them to come to you. So something like along those lines.
Thank you, Snyder.
So bring out your unique value proposition, because there's a gazillion of such solutions out there. So what are you making? What are you doing that is special? And then just to move the slides of the business campus.
Professor?
Okay. I think we need to organize the presentation, make it a very clear flow. The text, the opening slides is around it, so we make it very, very clear. It's very interesting. Hope to do that.
Thank you. So go back and work on it.
Final team is guardian therapy.
Guardian therapy.
This was the head May 2020. Was this a coincidence or a result of the repercussions? Yes, of the repercussions of the pandemic. Of course, these are the repercussions of the pandemic. Yes, behind every number that we used to see on these headlines, how many are infected, how many have died. There was a family, there were people that depended on those people, and those people were affected mentally. So our problem statement, ideally people faced with mental illness should be able to access timely and affordable mental health services in order for them to raise their abilities, cope with mental stress, to then work productively and fruitfully, and be able to make a contribution to society. But you see, for each pandemic that comes, for each epidemic that comes, where we face deaths, we face people that are disabled, people are locked down, people are affected financially, and they go when they are faced with these problems, they go back home and are stressed, they have anxiety. Most of them end up with domestic violence. So all this contributes to mental health decline, and we as guardian are common solution.
Thank you very much. My name is Martin Andrea. Having learned from the effects of COVID-19 and other pandemics on mental health for people, we came up with a solution to have digital frictionless and instant therapy services online, where we have therapists subscribe for these services and then attend to different people. Over the years, or 1 or 2 years, we did research and put up a site that was collecting data from people, and the insights are interesting. We have had people interface with us through the platform, and we have therapists who respond to their problems. We keep it professional and confidential when people log in and ask their questions. All the therapists on the platform are accredited therapists, and they provide these services. We have also put a clause in our terms and conditions for people who access the site that they allow us to use their information for data, which we are feeding into an artificial intelligence chatbot that is going to have interactions with people from real life experiences and not fabricated data. Then you can take us through.
Okay, so, sorry, I'm busy, but I want to ask, if you already have something, then why are you coming here? Well, the reason is, yes, we had something, creating when we saw this code, people being mentally ill, but then we didn't have a way to generate money off it, because it was literally free. So what we did was actually, from this hackathon, we came up with a solution of creating guardian therapy.
Finish, just so that we can know how more.
Okay, just complete the sentence.
Yeah, guardian therapy on top of the Humra therapy that is already running. So in here, so guardian therapy is guardian therapy is now coming in to make the money off this site that we have already created. In what way? So there is a membership which is free, and here you have creates information on the website and free mental weekly dialogues. There's a basic package. And these are the packages that you're having, the premium package. This is what we're having. So this is what we have gotten from the hackathon, how in production you make money off this service that is running. So literally it is an open source of sorts.
Okay, I think you'll need to work on your time because it is close to 4 minutes. And the first person who started the presentation needs to be audible. Yeah.
Yes, number one, put the systems together. make a screenshot of the website and put it there. Then reduce the wordiness, the wordiness of the second slide. And like this slide, there's the tiny, packages. You can make a little bit of background, the different colors of each package, and the words a bit less words but bigger, so someone easy grasp.
Seems like a great idea, but it has to be communicated with simplicity. So there is a lot of verbiage in there. We miss the point, but the idea seems to be there, but I can't put a finger in it at the moment.
And $1 million is expensive.
Jones, please.
I think my problem for this is similar to what Wafola said, so I will let Wafola repeat it again for this one.
Yeah, I said it to the previous group, but just on this specific one, mental health. You seem to mix mental health and emotional. Because I may be having an emotional problem, but doesn't mean that my mental health is bad. So what are you addressing? Are you addressing people with mental health or with emotional challenges? The two are different. Then two, apart from therapy, okay, there is therapy which is counseling, but there are mental health cases which you require medication. How is that handled? So you need to clarify what are the benefits. You the guys who own this will get some money, but what will the benefit? What will the benefit of the client? It must come out so that when he goes on board, he knows what he expects, what he will benefit from. So the benefits to the client must come out.
Thank you, Professor.
Okay, thank you. I think mine is not far from all the text and the members. Improve on the text, then make sure that your presentation is continuous. Then also specify what they want to see.
Yeah, I'd like to see a slide on the competitive, competitive landscape, how to compare to the competition, because there are similar solutions in the market. And then I know those packages, it's a bit confusing because I know you probably would need like therapists and stuff like that, so you only earn a commission of 30,000. So it has to come out clear, but unless you're also the one offering the services and you're certified therapists to do that. So if it's not that, then that is not your revenue. It's probably inclusive of other.
Thank you, mentors. So for everything that they've told you, the questions they've asked you, everything, just go back, think about it, and make it better. This is practice. But when you come to the judges, you can see your answer.
Appearance.
Appearance?
Your t-shirt.
Oh my God, where's your t-shirt?
Corporate identity is very important.
The first slide, you put that big newspaper and we had some issue about the newspaper. That newspaper also quoted a certain research group in public health. So maybe you can quote that other than the newspaper.
Thank you so much.
Yeah. Thank you so much, our mentors. I think we'll have to.
We need the rest.
We need that. A rest. Yeah, that's true.
Still come to us.
Cameramen, they're watching all the time.
Auntie, you need some more coffee?
Thank you so much, thank you. We need to protect her against the coffee now.
I'm not only taking, I move with coffee. Oh, wow.
Ah, that's why you tasted different. You used your own coffee?
The other one.
The other one.
I put 3 spoons of milk.
Yeah.
I know some people think they're also a little thick because I'm sure
Yes.
A Youth TV, empowering you. You're watching watching a Hit TV, empowering you. You're watching a Hit TV, empowering you. You're watching a Hit TV, empowering you. You're watching a Hit TV, empowering you.
Who is watching us live on a TV? We are actually still on, and we're coming to you live from Barai University of Science and Technology. This is the 8th, annual Camtech Uganda Medtech Hack-A-Thon. It's an event where young people and generally all innovators gather to innovate and develop solutions within healthcare and opportunities, because there you get to be part of the generation that is actually going to be change makers. The next, big innovators of this world are actually coming out from such events. And it is very, very important usually whenever we want to connect just like that. And Empower Youth in Technology, of course, is, another stop center for that. And we, of course, always have to interest ourselves in such opportunities just to bring them closer to you. That's what we always have to do in every other moment of time. Now, to update you where we've actually reached, teams have already, at least practiced pitching. They have received a few, comments. And of course, we will be expecting some good work immediately after lunch, I would say, or actually the next session is actually going to be them pitching, them showing us the solutions they've been able to crack. There's 2 days of them having to sit together, resonate together, ideate, and finally zero down to what they might actually regard as solutions. Of course, to again remind you that why health tech, Camtech itself is actually another big platform here at Mbarara University of Science and Technology that looks at technological solutions in the healthcare or medicine or medical field or sector. And of course, you expect whenever we have to organize such a hackathon, then it is actually about that very cause. For instance, AYIT had ever proposed and actually is planning to have a city hackathon, for instance. Now that you realize will have solutions that actually talk smart cities, solutions that respond to cities that one would actually want to grow to. For instance, Mbarara being proposed to grow into a clean city. We also think it can actually grow into a tech city of Uganda. That is always all part of the solution. And for Camtech side, they said, anyway, let's settle for medicine. We saw a team here around here telling us that, for instance, one of the major expenses of an average Ugandan is actually going to be medical bills, because then we are going to be getting sick at all times. And one still do not have to get to forget that that is our other biggest step, keeping yourself healthy, and that is what we are going to be looking at. Now, coming away from that, we have people in the healthcare system like attendants. We are having, midwives. We're having doctors. All these people are operating in this sector, and they have challenges. Apart from victims, then you're sure they also have challenges that may need solutions. You have people dying now and then. Earlier today, we at least went table per table to explain a little bit on what challenges they were actually looking at, and quite impressive. These guys are, most of them, looking at challenges that are out there in our communities, and one would actually believe that this is a hope that we may need to leverage on, especially when young people are the ones that are at the forefront. One want to believe that, the month of October is where we will use a lot of hashtag Uganda at 60. Again, one would actually want to ask themselves, where will Uganda be in 2062? When we will be actually saying Uganda at 100. Some of these solutions are actually coming to respond and shape such a world, such a Uganda, such a place to be at that time. And I want to believe that these comrades here that are innovating or coming up with solutions are the guys that are going to be, being, the biggest, challengers or biggest, game changers of the times. Now, to move forward, I would like to talk to one of the organizers of this very, very mighty event, an event, that is bringing together a team of innovators, to have different solutions. And you want to always believe Rama has always been in such causes, at least community causes. Whenever you're not going to find him in teaching public speaking to young generation, you're going to find him in Save River Rizi. If you're not finding him there, you're going to find him in causes like Kararan. If you're not finding him there, you're going to find him in such a cause. And we are so glad and delighted to have you on the mic. You could say hi to the viewer and we start from there.
Thank you so much, TV, for hosting me here, and most importantly for giving this event the visibility it deserves.
Yes.
Because we had so many people who applied to take part in this hackathon, the different circumstances, especially the resource constraints. Not everyone could be invited. So a few people were selected to take part in this event. So you going that extra mile to amplify the events as they happen real time is something we appreciate.
Wow, thank you about amplifying the event to reach different audiences. He's been one of the organizers of this event, and particularly quite a very, very vital role he's been playing over there. He's always a team player anyway, know that. But what guided the event anyway to start, and then later we will actually come to how it is going. Yes, thank you.
Thank you so much. What I can say in terms of the planning, this event is the 8th of its kind. So from experience, Camtech Uganda has been able to learn a number of insights from each event that we tend to hold. And one of the other aspects that gives this event leverage are the volunteers who normally come in and they really give in their whole to make this event a success. For example, for me, I don't work with Camtech, but the fact that I'm very passionate about the causes, to do all this that we are doing today, and the past hackathons, I felt it reasonable to come here and I make a contribution. So in terms of planning, we were able to have different committees that were set up to do the planning. Committees to do with the venue setup, committees to do with the communication and visibility of the event, aspects to do with the logistics. You see, we are putting on t-shirts and we are branded, because at the end of the day, we noticed it's a very big event, but you must be able to now single out the different aspects, and then you do based on their competencies. The competencies are derived from the experiences that we have been able to see over the years, how people perform. So you deploy them in those areas where they are able to give and bring in the best.
Okay, wow, bring in the best to the hackathon. And whenever you see, of course, such events happening, you want to believe that there's a lot of background work that is actually being, ran out there. So what was, if you're willing to share around your specific role and how it is actually going, here too, yes.
Thank you so much. In 2019, I worked with a team that was managing the digital visibility of this event on Twitter.
Yes.
So I was called in to volunteer, and I managed the Camtech Uganda Twitter handle.
Yes.
And also this time around, they requested me to come in, and I do that. And that's the role I'm playing now. and I'm using the Camtech Uganda Twitter handle or profile to amplify everything to do with the event as it happens.
Yes.
So from the clinical summit that we had on Friday to yesterday's event, which was the opening, up to this point where the teams have been able to do the trial pitch presentations as they prepare for the semi-finals. I've been able to do all that, but also we are assisted by some other individuals from different media houses who are also coming in to play that role. So that the people who are out there, who are not here physically, they get a sense of what's happening even when they are not here physically. So that's the whole idea. And we think we are trying to do our best up to when the event ends, so that even when you don't get a chance to come here, you feel like you've been catered for in terms of the updates.
Okay, you feel like you're being catered for in terms of updates are his words over there. Rama, the coach, Rama, the everything that you might want to tag around team. Yeah, you know, of course, a team is made up of a coach, and he is the gentleman at least that we know. How is the event going in your evaluation? Are we achieving objectives yet?
Yes, yeah, the event is really going on well. We have 30 teams that have been able to register, and they've all interfaced with the judges to do their trial pitches.
Okay.
The trial pitches were basically aimed at getting that critical feedback on the areas that they need to improve. What do they need to get off their pitches? What do they need to add that they missed out? So that at the end of the day, they are able to strike relevance when it comes to getting into the competitive stage. Because at the end of the day, we want to see the top 4 winners, and that takes some kind of effort when it comes to the mentors to make sure that, because the people we have here in terms of participants come from different backgrounds, and so being able to come in and you cater for the interests of everyone so that they are on the same page is very essential, so that they feel they are being catered for on all those areas where they are maybe lacking. And when it comes to the race of competing, they all feel like, yes, we are getting in fairly and everything is being catered for in a proper manner.
Everything is being catered for in a proper manner. That's Rama for you. If we were to come back as a person, you know, you've been in Mbarara in the events ecosystem, especially community kind of touch. What would you call the relevancy of such?
For me, the relevance of this is that at the end of the day, Camtech is able to come up with all this based on the challenges we are really facing on ground.
Yes.
So they're able to go out there and they get some critical or essential data that informs some of the themes that we come up with every year. So you saw we had the COVID pandemic, and you see this year's theme is about building a resilient healthcare system in the era of emerging pandemics through innovation. You see they are trying to say, from the experiences that we have gone through, how do we challenge all these different participants to come up, and then they think through things that we could innovate, and they help us avoid the situation or what we went through during COVID. So the relevancy when it comes to all this, and also the fact that the people who get to take part, Camtech caters for that diversity. They don't limit. Yesterday you saw Ethan Musingos, the 9-year-old who is the youngest participant here.
Yes.
Also feeling the urge to come here and he also present something.
Yes.
He feels he can be able to make a positive contribution. So that kind of diversity that Camtech caters for when it comes to this hackathon is not something that we have seen in Mbarara, and we hope this can get to grow. And maybe at some point we have a bigger number in terms of participants. Yeah.
Wow. Thank you very much, Rama. Rama has been very, very influential in this, and there is a proposal that Mbarara should actually grow into a green city, but the other one is actually to have it as a tech city for the country. According to how you've been, you know, evaluating the audiences in Mbarara, are we there? Are our people, you know, one of those uptakers of such? Are we able to achieve the 2 dreams, for instance?
Yeah, for me, especially the tech idea, I think it is something that is very achievable.
Yes.
When you look at the innovations that have been able to emerge from MAST through Camtech Uganda and other platforms, I feel really if we keep the pace the way we are running now, we can be able to become that exemplary platform where every other person comes in and they are able to learn the best practices on what we can be able to do, and we become that exemplary city. So I feel we have the structure requirements, maybe in terms of the funding and other resources, is what could be needed to pivot us that area where I would want to be. But it's very possible because in terms of the competencies, the skill set, the passion, and the relevance of all that is being done is already in place.
Oh, thank you very much, Rama, over there. And just like what you see on your screen is actually the chief guest or guest of honor that we've been waiting for. She's here representing the Minister of ICT. And I understand that the minister in her own capacity is here. And what actually that communicates to you is that we are almost getting to the climax of this very event. Finally, is evaluation of the event. Are we getting it right at the end of the day? You believe we will actually get what we intended to get?
Yes. So
Wow.
far we are doing so well. We are performing above 85%, and I think by the end of the day we'll have done excellently well.
Okay, above 80%, and thank you very much, Roma, for allowing to talk to us. For now, I will be taking you back to the command center, Henry, over there, to connect us back to what is actually happening in this very, 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 event. Thank you very much.
Good afternoon, ladies and gentlemen. Good afternoon, ladies and gentlemen. Now that we have the ministers, I'd request we do the anthems. We may rise to give the anthems. The national anthem.
Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tulilinde, tuajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu. Uzalendo pia mshikamano viwe msingi wa umoja wetu, na tulinde uhuru na amani, mila zetu na desturi zetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu.
Thank you so much. Let's take our seats. The Minister for State for ICT, OHTW, Joyce Nabosa Sebogwao. Welcome to Mbarara University of Science and Technology. The Vice Chancellor, Professor Celestino Boer. The Director, Camtech Uganda. The Ambassador, Council Wafula of Uganda to Burundi, welcome. And the Dean, representing the Deans, Dr. Jones Obongoroch from the Faculty of Applied Sciences and Technology. The mentors, hackers, and journalists, I welcome you to the 8th Hack-A-Thon. Without wasting time, Honorable Minister, before you, we have a team of mentors, and these have trained and mentored and tried to see that these people get to the top. May the mentors please rise for recognition before the minister. They are putting on those colors. They are from far and wide, not only Mbarara University. They are from different organizations, which the director will break down. Thank you so much. And then we have innovators. Please stand up for recognition. The innovators are from also far and wide, including students, innovators around town, and many others. We do have the organizers, the teams behind the closed scene. You've passed them by the reception, but those here present, please rise up for recognition. Yes, those are the trainers, I mean the ones behind the hackathon taking place. We have varsity of ideas, and we do not have age limit here. I would like, I don't know if he's present, to present you the youngest hacker, Ethan. Ethan, is he here? He will be coming. Ethan? Oh, is he standing up? Oh, Ethan, please move, run, faster, faster, faster. Yes, yes, the chance to, yes. Now, it's time to shine and go and meet the minister. No, at the front. Yes, Ethan is the youngest hacker, and we look forward to seeing him hacking. And I don't want to mention the oldest, but I think that we don't have age limit here. Before you, I would like to invite the director, Camtech Uganda, Dr. Data Santorino, to give you a debrief of what is going on right here. Dr. Data.
Thank you so much, Angela. Our Honorable Minister, Owechitibwa, Joyce Sebugwaho, our beloved Vice Chancellor, Professor Oboa, our Ambassador to Burundi, represented here by Council Wafula, Deans of all faculties in Mbarara University, mentors, and joyful hackathon participants. Good afternoon. Today, Honorable Minister, marks the 10th anniversary of Camtech Uganda in Uganda. Camtech Uganda is an initiative of Mbarara University and partners. Our journey started in 2012 as a small innovation hub that has grown over the years. From a humble beginning, I would like to recount how we have walked to talk that our President, His Excellency Yoweri Kaguta Museveni, has been preaching for us to all embrace and support. The talk of building a knowledge-based economy and growing the number of local jobs in Uganda. Over the years, we have built a robust innovation ecosystem that has supported hundreds of innovators. Through 3 different stages, we support innovators before they enter our innovation hub, when they are officially admitted into our innovation hub, and also after they have left our innovation hub. Just to give you a glimpse of how much the support before the innovation hub happens, just this year alone, we have worked with 44 different innovator teams before the lab phase. And these 44 different innovator teams, we have supported them, built their capacity, and 15 of them have already gotten funding from different organizations to continue developing their innovative ideas. The teams that have been admitted to the Innovation Hub, we followed up 25 of them. These 25 teams have been quite successful. 10 of them have formed companies that are already doing business in Uganda and directly contributing to the revenue generation that grows this economy. We need to be passionate and grow the number of jobs in this country. We looked at how many jobs we have created over the last 10 years, and the count came to 216 jobs. Honorable Minister, with your support and the support of this country, we are determined to grow this number on a year-to-year basis. We trust the goodwill and the wisdom of our Vice Chancellor, who has supported us with all his top management to be able to achieve what we have been able to achieve. Honorable Minister, the knowledge-based economy that His Excellency, our President, talks about is a knowledge-based economy that is based on protecting and creating markets. Markets not only in Uganda, but markets also globally. How we create and protect these markets is through the generation of intellectual property. And we have been tracking our contribution in generating intellectual property. On our 10th anniversary, Honorable Minister, we have had a total of 11 intellectual property filed. And today I'm glad to report that 2 of this intellectual property have been awarded patents by the World Intellectual Property Organization. What that means is that they are Ugandan-born technologies that have global market protection that we can exploit and use to generate foreign revenue in this country. As you prepare to go to Cabinet, Honorable Minister, tomorrow, please convey this message that in Mbarara University, we are not only creating local patents, but international patents that have been recognized by the World Intellectual Property Organization. This 8th Medical Hackathon is unique because for the first time, the World Intellectual Property Organization has partnered with us as a funder to support this event. And this speaks to how our contribution to intellectual property is being recognized worldwide. For innovations to grow, we do not know it all. We recognize that right from day go, and we set out to create partnerships. Partnerships that support us as an innovation hub, partnerships to support the entire innovation ecosystem, and partnerships for commercialization and technology development. We did the count at our 10th anniversary, and we have developed 63 partnerships across industry, academia, and implementation partners. We are so grateful for all of you in government and our academic leaders represented here by the Vice Chancellor for giving us that enabling environment. This work has attracted both national and international awards for all the innovators that have worked with us. 6 of these recognitions have come nationally, and 8 of these recognitions have come from international organizations all over the world. We thank you for supporting creativity in this country and building the peace and tranquility that we enjoy to enable us think straight and think peacefully to be productive as citizens of this country. We believe with all of your support, we will continue to be more productive. As we think of building science, science is based on creativity, but also is based on evidence. We are laser focused on helping the innovators to build the evidence that goes with paving the way for all the markets that they would like to go to. Over the years, the innovators we have supported have conducted a total of 33 studies to generate the evidence to support the commercialization of the different technologies that they have developed. And these technologies are not only in health, they are also in business and in other fields of science, innovation, and technology. For one to innovate, all the different stages of innovation require that people have food in their table, in their stomachs. They have food and money to conduct the studies. And so fundraising is critical. Over the years, we have been able to bring into this country and to mobilize both internally and externally a total of $15.5 million to support different innovation initiatives in this country. That is the money that has supported all the 216 families that have been able to get employment directly or indirectly through this initiative of Mbarara University and partners. And so at this point, I want to thank all our partners that have walked this journey with us. We did not do it alone. And right from the beginning, we knew we did not know it all. And we positioned ourselves to learn. And it's through our learning that we have been able to achieve this. So the first partner has been the government of Uganda. We are officially an innovation hub supporting the Ministry of ICT. Our home, Mbarara University of Science and Technology and all its leadership. Thank you, Professor Obua. Our partners, the Ministry of ICT and NITA Uganda provides 100 Mbps of internet dedicated to just the Camtech Innovation Hub alone. That amount of internet has supported us collaborate across geographies. The staff and students of Mbarara University. The staff have supported these students in different ways. We have 12 stages through which we take these students who have crossed into our lab through, and the staff play a critical role. We would like to thank our partners from far and wide. Vilgro Kenya is represented here. Can representatives of Vilgro Kenya stand up? It started as Vilgro Kenya and is now Vilgro Africa. They have supported so many of the innovators that have come out of Mbarara University with both mentorship and funding. We are very grateful. We are very grateful with our new partnership with the World Intellectual Property Organization. We work very closely with the Uganda Registration Services Bureau. We work very closely with Empower Youth in Technology. So, Empower Youth in Technology is a company that was spun out by students and alumni of Mbarara University. And now they are able to enable the world to follow this event live. Thank you so much, Empower Youth in Technology. Our service providers, Ajip Motel, Silverback, Cool Events, and all those who have supported us in one way or another, we are so grateful. Thank you so much, and thank you so much, Honorable Minister, for gracing this occasion.
Thank you so much, Dr. Data. OHT, it will be unfair if you deal with something to do with technology and communication and would not recognize the communication houses here present. We do have NTV, Vision Group, represented by TV West and Radio West. We do have influencers of social media. Those ones should stand up for recognition. Influencers of social media. Rama, why are you seated? Now, those are the people making us trend on social media, and they are making the impact of technology felt. Without preempting what the Vice Chancellor is about to say, OHT, allow me to recognize that Mbarara University is also, minus the Camtech Hack-A-Thon, we are fronting so much in technology, but with the support of government, we are able to have the annual innovation exhibition of computer science and engineers of the university. Last year, one of our students was recognized at national level. He developed a soil classification app. Uganda being a backbone, the economy of Uganda embarked on agriculture. This is going far. But somehow innovations die silent now that this boy left the university. Would like you to address that and see how we pick up these students. I think the mentor is here, Mr. Mwavu Rogers. Yes, he's present there, and they were in Dubai exhibiting. Next to you is a gentleman called Dr. John Zobongoroch. He's heading the MRI project that is going to image the brain. We have so many people that get brain injuries and they cannot afford to do an MRI. He's being supported by NIH and the team of other engineers from all over Africa. It's the first of its kind, and it's being assembled at Mbarara University of Science and Technology. That is one of them. And finally, we had an app called the Rep Zero app that is supposed to report rapists in record time. That one is on its silent page in the sense that everyone says rape is common in rural areas, but the rural area people do not afford technology. All that we need to address. Without preempting the Vice Chancellor's speech, allow me to welcome the Vice Chancellor, Professor Celestine Obua, the brain behind our partners in development, and innovations at stake. Thank you so much, Professor, for always branding us big at national and international level. I've reported you.
Honourable Minister, allow me to remove my mask so that my words can come as clear as that of Angel. Honourable Minister of State for Science, Technology and Innovation Ministry, Owekitiibwa Joyce Nabosa Sebugwao, our very important partner who I think was not introduced, the Counsel at the Uganda Embassy in Burundi, Mr. James Wafula. The rest of us who were already introduced, I'm not going to go into that, Honourable Minister, because of time. Mine is a simple job. First is to welcome you to Mbarara University of Science and Technology. Honourable Minister, we know that Mbarara is very near and yet very far away from Kampala. If we had other means of communication, it will take you less than 15 minutes from Kampala to Mbarara University of Science and Technology. But because we are still struggling with development, you have to undergo the strain of sitting on the road for 4 to 5 hours to arrive here. We do not take that for granted. We are grateful for the decision you made to honor our invitation to come and be part of this innovation trend which is taking place in Mbarara, but also to witness it as testament of what your government has given us permission to do, and for you to be able to convey the same message, not only to your colleagues in cabinet, but also to His Excellency the President, being one of his charges that he has put in place to steer this ship where we are passengers in. We want to believe that the President did not make a mistake in appointing you in that position. So we are grateful that you've been able to come and witness what the young brains in Uganda and other neighbors have been able to do and are continuing to do. Honourable Minister, the Director of Camtech Uganda, who is also a senior lecturer in pediatrics at Mbarara University of Science and Technology here, has mentioned many things that I will not now want to take you through, but maybe to highlight a few. When he said, as Mbarara University, we did not go alone, he was right. We have had partners who did not only help us with funding, but also help us crystallize what is it that we think we want to do to improve healthcare in this country. How do we go about it? What should we do? And who should we partner with? How do we make ourselves known worldwide? We have an institution which has a home in Uganda here. In Mbarara here. The Massachusetts General Hospital Global Health Collaborative, which has been working with Mbarara for now close to 12, 15 or so years in Mbarara here. And that's how Camtech came to grow in Uganda. We have partners, other universities, other organizations, and we are now partnering with neighbors. Why is the counsel from the Uganda Embassy in Burundi seated here? Because he has come along with a delegation from Gozi University in Burundi. The rector of the university has been around, is around, but the rector is also a reverend father. So, today is their job to make sure we go to heaven. So I am not surprised that he's not here. I'm very sure that he has been working together with our Archbishop. Probably participated in conducting Mass to people who profess the Catholic faith. But we have a team from Goes University. Could Dr. Levin and the rest from Goes University stand up for recognition, please? You can see that Dr. Levin and so on, because of the color of the t-shirts they're putting on, they are mentors. That is my assumption. So this is a team that has come from Goes University Burundi, partnering with us, mentoring our young people in innovation, science and innovation. Thank you. You can sit down, please. He has already mentioned, Dr. Data has already mentioned other partners. I thought I would highlight those who he may not have mentioned as he was introducing the partners. Dr. Data mentioned the fact that we have been receiving funds from the government of Uganda. Oh, you just come in time when I've just been introducing you. So, Honorable Minister, the man of color that you see sitting here is the rector of Goes University in Burundi. And I was giving excuses for you that you have been saving our souls, but you have come in time. In here, we are the guest of honor is the Honorable Minister of State for Minister of Science, Technology, and Innovation, the STI. ICT. Oh, sorry, ICT. I don't know why I flipped in my mind. ICT, Information Communication Technology in Uganda. Owekitibwa Joyce Nabose Sebogwao, who is our guest of honor. And she drove all the way from Kampala to come, almost as far away as Burundi from here. So, Honorable Minister, I was saying that Dr. Data made reference to funding that we have been receiving from government. You're probably aware that the government, of all the years, Barra University has not been receiving money dedicated for research and innovation. But in this financial year, the government allocated 1 billion shillings towards research and innovation to the university, as opposed to the 30 billion that they have been giving Makere every year. We are grateful for that small gesture. We know that being, of course, a young university compared to Makere and small, that 1 billion, we want to make use of it and showcase that the little money we got, this is what we have done with it. We may want to ask for more money, but it will be a test for us to show government that, yes, you gave us little money, but this is what we have done with the little money. So that tomorrow when we come to ask for more, we have evidence that we can use the money to improve the development of the country. Improve the welfare of Ugandans, the health of Ugandans, productivity of Ugandans in all spheres. And as the public relations officer has mentioned, a week or so ago, we had an agricultural exhibition here, where the Minister for Agriculture was here, the Honorable Frank Tumebazi was here in person, and his comment was that he was more than pleased with what he was seeing, because these were agricultural innovations being exhibited by our students and their partners, the farmers who are around the university. So in this particular innovation that we are going to go through today, they are not only students, they are also those individuals, people from around who have innovative ideas that would want to work with to show that Mbarara as a whole is not an island, it is not an ivory tower, but it is taking the university to the community, or rather bringing the community to the university, for which we are very proud of. We will, however, continue to ask for more funds, because we think after the interest, when we advertised for our faculty to apply for this money which was made available, we saw the applications were overwhelming. That, to me, was an interpretation that there are more people with research ideas and innovation ideas, but we don't have sufficient money to fund, to satisfy them. So even as we try to show that we can ably utilize this money, it would be nice for you to take a message to our Father of the nation, that the seed that your vision that you saw of establishing a university in the middle of nowhere. Honorable Minister, I don't know how many times you've come around this region. After you have passed the periphery of the city, the rest will be animal homes and banana plantations and farms. Meaning, other than the island of the city, 33 years old? Is it 33? 33 years old. Makere is celebrating 100 years today. But we want to sit at the same table with Makere. We want to sit at the same table with them so that we are counted. We do not want to keep on taking the back bench to say, but Makere is sin. No. We are able to sit, we have been able to win grants at the same rate like Makere. And as Dr. Data has told you, the $15 million is talking about if you add other projects where individuals at the university have written grants, then the figure could be a lot more. But only for innovation and technological innovation is the 15 million that Dr. Data is talking about. The university is growing, for which we are proud. As a nation, Uganda should be proud of the establishment of Mbarara University. And Uganda as a whole should thank His Excellency the President for the wisdom of thinking that a university can be born and can flourish in an upcountry setup. Because everybody else shut down the president at that time. A university in the rural, no, forget it, you're wasting money. And that's why even initial academicians like us never wanted to come to Mbarara until the president said, you bring us those Cubans who are willing to go anywhere. When the Cubans came here, and it became possible that indeed you can train people in a university setup in a rural area like this. That is when the likes of me now could think of leaving Makerere and coming to Mbarara. So we thank those people who were brave enough to heed the cry of the president to come to Mbarara to set up what it is today. Honorable Minister, a lot can be said about Mbarara University and its growth. For us, we can say we laud and applaud the support that your government has given us. We are not complaining about that at all. Our complaint is, now that we have grown a little bit, the jacket has become a bit too tight. Can you maybe now give us a bigger jacket, which can accommodate our growth? Because indeed, as a university, we have grown from 43 students today to nearly 6,000 students. That is a very big growth. Second, the university has achieved its name because this university was appropriately christened the University of Science and Technology. So today, other than medicine, the university can say we are now truly a University of Science and Technology. One example is why you are seated here today. The other one is that young man sitting to your right. That now we have a faculty of applied sciences and technology, where now we have programs that are addressing technological problems in the country. And that's why the PRO said, probably in the whole of Africa, it is only in Mbarara that we are developing a magnetic resonance imaging machine, which is going to be of high quality, but minimum requirement in terms of requirements for energy and so on. This technology is going to be applicable in our environment here in Uganda. It is already prepared to be tested at Cure Hospital in Bale. This is where you have children with these children who are born with big heads. He has used the term of hydrocephalus, but children who are born, somehow they have the disorder of the fluids in the brain is not being drained, so the head keeps on swelling. So this requires imaging, and the current imaging equipment that we have is not suitable for children. It is suitable for me, who has already a thick skull, but these young newborn babies don't have that thick skull. And that's what is being developed in Mbarara with support from colleagues from around the world. And it is soon going to be tested in Uganda. That is the kind of technology we want in this country. And if I would ask the PRO to tell us what is the mission statement of the university, but translated, it is getting the taught sciences and apply it in the community for the development of the community. That's what our mission statement is. Anybody can teach science, but this science is meaningless if it is not translated for development in the community. That's what we are about. And we hope that your coming today is going to help us to translate these dreams of ours into reality and ask your colleagues in cabinet, because science and technology is not only the Ministry of Science Technology, it is not only the Ministry of ICT. There are all elements that are involved. Particularly, we have our prime ministry, which is Ministry of Education. But we also know that there are other ministries that we need to talk to. Ministry of Finance. So the Ministry of Finance could begin to examine what is taking place in universities, particularly public universities in Uganda, outside Makerere, for example. What is taking place in Mbarara? If the ministry could come and see what is taking place in Mbarara, they might begin to think that this institution requires slightly more money than what is being given to us. So we have big dreams. But, Honorable Minister, we have been put in a straitjacket, as the psychiatrists say. When you want to restrict somebody, don't want him to move very much, you fix them so that he cannot move the arm or the leg. So in terms of expansion, we have big dreams. And if you had time to sit and listen to the pitches, the ideas that these young brains have thought of, you would agree with me that the dreams are big, the ideas are big. The implementation is a challenge. The PRO mentioned some of the innovations which are lying on their deathbed because of lack of funding for them. And we would wish that after these young men and women have presented what their ideas for innovation, this could be taken up by government. This could be taken up. And these dreams don't die with them leaving the university. It continues until it is a product owned by the government of Uganda. And it is possible. So, Honorable Minister, thank you so much for coming. We are grateful that you are not only coming in your capacity as the Minister of ICT, but also as a representative of government in this setup, for which I know there will be a time for us to thank and appreciate the coming of the Honorable Minister. But I would want us to give a thunderous applause just for the fact that the Honorable Minister has made a presence here. Particularly the innovators at the back. I know you are thinking of the pitching. I know right now they're thinking of what they're going to say. Is it in 3 minutes? 3 minutes. You can still clap now. The rest there, because this one's did. Thank you. So, Honorable Minister, it is now my pleasure and an honor to welcome you, give your remarks to these young men and women, and I wish you had time to see. I don't know whether it would be putting the cart before the horse. So the saying goes, if there was at least one presentation, but that would be preempting the others. But even if you will not be able to see what the young men have prepared, there is a lot of brains. How many teams are here? Data? 29 teams. 29 ideas. So the ones in dark blue, or is that dark blue or black? Is it black or dark blue? Dark blue. So the ones who are wearing the dark blue t-shirts, these are the ones who are forming the 29 groups with bright ideas. And the judges, I'm told they're judges. There were mentors introduced, but you didn't introduce judges. Were they here? Oh, they'll be selected from the mentor. Okay. We'll have some job to do and then select the best. How many? Best 4. So the competition is stiff, and I wouldn't want to be one of them right now. I met one of them who said she's very anxious. And I said, anxiety is a normal thing. Whenever you are going to prepare to present something, anxiety is a normal thing. Only thing you need to do is to know to control the amount of adrenaline that you're going to be. Adrenaline is an hormone which is responsible for flight, fright, or fight. It comes in all those. You can either, it comes to help you run away, or it comes to help you fight. But I hope in this case, it is going to help you to fight, not to run away. So, Honorable Minister, may I now invite you to address these young innovators who are gathered in front of you. Thank you.
Thank you very much. Thank you, Angela. Thank you very much. Our beloved Vice Chancellor of Mbarara University of Science and Technology, the Program Director, Camtech Uganda, all university staff and distinguished dignitaries present, the organizers of the Hack-A-Thon. Is it this one? Participants of the medical technology Hack-A-Thon, students of MASC, the press, ladies and gentlemen, good afternoon to you all. It is my pleasure to be here representing my college, the Senior Minister, Honorable Dr. Chris Barriomons, who was invited to officiate at the closure of the, you said 8th, but it's supposed to be 10th. It is 10th, but you are, okay, it's 10th anniversary, but the 8th National Medical Hack-A-Thon organized by Camtech. He is out of the country on official duties, and I bring warm regards from him and the ministry staff to all guests and duties and participants as we welcome the age of technology products and service delivery. It is important to note that technology is revolutionizing the way people obtain information, communicate, do business, work, study, and utilize services. It is bringing the distance to enable us connect to the world seamlessly. At this very moment, I want to appreciate the effort of all innovators of applications, devices, and systems that are geared towards making life easy and enjoyable. When a child is born, health is given priority to ensure that it is alive. Then other factors like food, shelter, clothing, education, to mention but a few, come on board to justify the importance attached to health, which is in our theme today. Government of Uganda recognized the potential of ICT to transform the economy and people's lives through job creation, accelerated economic growth, and significantly increased productivity as enshrined in the Uganda Vision 2040. ICT plays catalytic role in providing solutions and creating opportunities for thousands of unemployed youth. Government has invested tremendously in ICT in order to support and tap into the ICT as it is a new frontier that will propel our growing economy to the next level. Central to ICT is innovation. That powerful tool that revolutionized how businesses are conducted, ICT innovation has led to the emergence of the largest tech companies in the world, including Amazon, Facebook, Tesla, and others. These companies were also supported by their respective governments. The large companies which shall emerge from Uganda will be a product of these innovations. These companies shall create jobs and earn the country foreign exchange. In support to ICT innovation, the government of Uganda set up various initiatives like the National ICT Initiative Support Program to develop the entire innovation ecosystem. This program, which has run for years now, has already registered a lot of progress in the sectors of education, health, agriculture, and others. Some of the success projects that have been supported include the Academic Information Management System, which is currently implemented in all public universities, e-government procurement system, which is currently being implemented in government to take government procurement online. The electronic documents and records management system, which shall ensure that all government documents and records are digitized and achieved electronically. We have supported the Prisma's technology from Camtech Uganda that is helping save newborn lives in more than 40 health facilities and hospitals in Uganda. This technology is export ready in both English and French. Investment in this ICT innovation investigates achieving these major outcomes. One, to increase employment opportunities for the youth. And two, increase ICT innovation products in their use locally and exported. And three, empowered youth for increased participation in the ICT industry. Government is also creating a critical mass of skilled scientists and engineers to drive economic growth and transformation, and is increasing funding for research, scientific innovation, and product development. As we continue to engage, allow me to congratulate all those innovators who are participating in this Hack-A-Thon. This is a launch pad to show the world Uganda's potential in ICT innovation. I wish the best to the winners of this Hack-A-Thon. I once again thank you for organizing this awesome event to showcase our achievements and the potential to the world. I thank participants for blessing this occasion with your presence, and on behalf of the Minister of ICT and National Guidance, I appreciate your contributions in your different capacities. We are committed to working with the Camtech Uganda. Camtech Uganda Innovation Incubations Hub at Mbalala University. We will support you in the ways you identify to continue supporting innovators and their innovations. I thank you very much for this day, and thank you very much for welcoming us the way you have done. And I thank the Vice Chancellor and all your staff for the work well done, and we wish you all the best. Our offices are all open. In our offices, we don't have doors. We just come and enter. So you are welcome anytime. Thank you so much, and God bless you all. Thank you.
Another round of applause for our OHT. Yes, ladies and gentlemen, apologies from our minister. Tomorrow she's attending the cabinet and she'll be required to do a COVID test. And you know that Mbarara to Kampala, if you're not using the flight, it's about 5 to 4 hours, something like that. Yes, some of us who use Global, but if you fly, I think you know the right. Please don't fly our minister. We're releasing the minister quickly, but I would request, Honorable Minister, to have a group photo in the categories below. These students will need a souvenir of a photo, and I'll invite them in just groups. So the people seated with the minister, just freshen up your makeup a little bit, and then we go for the photo. Let's have the orange t-shirts, according to Dr. Jones, the yellow t-shirts. The yellow t-shirts, please come forward. I don't know why he said yellow. He expected the minister to come, so yellow t-shirts. Can I have the ushers to help me here? Yeah, those are the mentors. Let's remove this. Let's remove this. Yes, we all have to fit. Now, if the mentors can't fit, will the students fit? You can sit. Please don't chop anyone. It's not every day that the minister comes here. Ladies and gentlemen, we see you're not smiling, yet the minister is smiling. People with masks. Professor Bua, closer to the minister, please. I know you're safe. You did a COVID test. You've just traveled. Thank you. Okay, we are smiling, mentors. The hackers are not even coming for the photo. They are scared. Okay, sorry, I'll remove the sanitizer. It's covering the minister. Yes, let's take the photo in 3, 2, thank you. Now let's have a group of about 10 hackers to avoid congestion with the minister. And those who didn't, time, guys, time. UBL, go and remove your parking lights. The minister needs to move quickly. Hackers, please. Hackers, please. Who is exactly behind the minister? Will you sleep? Okay, let's focus in the camera. Why? Someone sit, please. Sit. Okay. In 3, 2, 1. Yay! Okay, do that selfie pose. You're with the minister. Yes, that's what I needed. Next. Ethan, those fingers. Okay. Ethan, stay there and do the right finger. Ethan, it's this. Ethan, yes. Okay, another team. Another team, please. Organizers, you just have 1 minute. Another team, please.
This is blocking.
UBL, please. UBL 610E. I'm sorry, I'm announcing that. UBL, please. Okay, please. No, those are enough. Those are enough. I'll get another round. There's one other round. Okay, pause like students. 3, 2, yay! You're not, why? Okay, thank you. The last team. The person who was behind the minister will not sleep today. Even if the team doesn't win, it's enough. The last team, please. Let's move forward. Now you see the person who has gone first is just behind the minister, nothing else. Please, guys, time. The minister needs to travel like now. Thank you. Give way. Organizers. Organizers, please. Sankara, get me the organizers, please. Yenga yo many banangi. In 3, 2, get me the organizers. 1, 0. Boy, why aren't you taking? Okay, organizers. Organizers. Organizers, please. Please give them space. UBL, please unpack. Organizers, please go. We all have to fit. Organizers, these colors, I don't understand. Okay? Okay, we are smiling. Thank you. Please move away. And the last one, Angela alone. When the MC, this is what happens. You have to pose behind the bosses. Please, camera guys, munonya basasula. Thank you so much. Please, I invite the high table to see the minister out. Thank you so much. OHT, it's unfair to leave Mbarara without tasting our milk and honey. So we are giving you some milk and honey. Give us that moment. Thank you. And we are serving food in alphabetical order. If you're Angela, you go first. And if you're Zainab, you go last. I'm advised that you're using these minutes to finalize, then we go for lunch, and we do the final pitching. The ushers will be inviting you in groups. Thank you. DJ, roll it. Play that music that doesn't scare hackers.
deactivated and would lift the medicine, which was already pre-measured, and auto-inject it into the water. And then for this system, you can actually deliver maybe 2 doses within some duration. Let's say we are giving one at 2 p.m., another maybe at 3 p.m. It's very possible. You just put, depending on the time calibration that has been put here, like your main holes here, where we're going to fix the screen. So let's say it's reaching here, after maybe a particular time, you know after reaching there, it's going to be fixed and then injected automatically into the water. So that is going to save a lot. And medicine will be delivered in time, and so many advantages, especially in this era of the pandemic, the COVID-19 and the Ebola. Let's get into the business perspective of this project.
Thank you again, my mentors. Why do we think that this medicine auto-injector will be effective in solving this problem that I've been stated? Financially, medicine auto-injector is very viable. It can be manufactured using locally available materials.
Yes, time up.
It's nice. Okay, thank you very much. But generally, it's affordable.
Time
and
up.
it's work for the common person.
Time up.
All right, thank you. Let's go. Yeah, thank you. Thank you so much.
So to be guided, we're just going to have 2 minutes.
Yeah, Tim, thank you so much. Yeah, what I want to know is this auto, what you say?
Auto injector.
Yeah, has it worked anywhere in the African city or it is your first time?
Actually, we have not got a very similar idea when we made our research also. But then we know of a certain technology that we learned is existing, where you put like maybe 1 dose at a time, and then it's delivered into the water at a specific time. But according to the investigations we tried manually, we realized that that thing can actually cost us about $260, which is actually a lot of money, and then it's delivering just a single dose. So that's why we decided to come up with something that can deliver more than a dose. What makes it also because you're fixing it into the system, it is delivering it automatically, let's say at midnight. As a doctor, maybe you are asleep, the workload for that day is really too much. It's a pandemic, and then maybe say the government has said we don't involve so many medical personnel.
What technology actually makes the deliver at midnight? It is
programmed.
This ambient programs. There is a light sensor.
Color sensor.
It will directly send a signal. Operated somewhere here.
The moment the straight reads the color sensor, it's going to activate a system of motors, which works like these excavators used on road to lift up and then take it there and then it's there.
So the current situation is because you can't get up what they do.
Yes.
Our syringe, it's not incorporated with some color here. It can be a line of patients having different medicine.
Thank you so much.
Welcome.
That's why you're walking away. The system, the water is not always there.
national regulator for ionization energy. We've got also biomedical engineers, very partnership. Then for the consumer segment, we are looking at the Ministry of Health, because this is a healthy equipment and it should be in all the healthy facilities. That requires the Ministry of Health to be amongst our consumers. We are also looking at private healthy facilities. These ones, they also own and use ionizing radiation generators, CT scan, X-rays. We are also looking at all the facilities that use radiation generators in Africa, because it is a global challenge. Each and every country, each and every healthy facility uses these imaging techniques, uses radiotherapy. Then for the cost of the cost structure, we are looking at a staff that we shall build, because of course we shall provide employment opportunity to the people in the biomedical, business, medical, even in the computer sectors. So we shall need the team.
Time up.
Thank you. What I want to know is where this one is going to be stationed.
This gadget is supposed to be, we are going to connect it to radiation generator through power. Because most of the companies that supply these equipment and say don't tamper with this equipment for the period of time. So because of that reason, we are supposed to install this device inside the motherboard, the communication motherboard. But since there's that challenge, we decided to make it external device that connects through power to the generator so that it can be supported.
Which are your partners?
We have atomic energy answer. These are responsible for operation. If you want to buy a ionizing radiation generator from abroad that you want to install the internet and supervise generators in this country as far as radiation is concerned. And we have particular engineers. These are the engineers that are dealing with biomedical all equipment.
And how to calibrate it? Because you need a radiation source, the different types of radiation that go for calibration.
Yes, we have a man-made radiation, which is more standard 500. Then we have man-made calibration, natural radiation, and man-made radiation. So man-made calibration is the one we're dealing with. Imagine going for radiotherapy, for cancer, we are doing overdose, radiation or X. That will happen. Because we know that if you receive a lot of radiation, it affects your DNA cells. And when the DNA cells are affected, one, it can be damaged, and when it is damaged, it causes cancer, and when it dies, it collapses the whole system of that family.
Think about the worker's safety. The patient gets one dose, but what about the radiologist who you have sensors also where the radiologist wants? Sign up. Thank you, sir. Kulala, for your presentation. Thank you, judges.
we currently know that there are products on the market, but these products are quite expensive.
What's the name of your team? Sorry.
Number. So we've come up with two products, that is the reusable pad and the non-reusable, that are actually cheaper and more convenient.
Yes, so the first one, depending on your preference, is for the disposable pad. We come up with something called the pill pad. In my P5, I was going through my period, and then my pad was full. But unfortunately, as I was getting the other pad out, it fell down and all the children laughed at me, and I was really embarrassed. So what have we brought you today? We brought you a 2-in-1 package. It's a pad with 2 compartments. When your top pad is full, you can just go to the toilet. No one has to know you're going through your period. You just fill it off, discard it, and then voila, you have a whole new fresh pad down that you can just put on. Yeah, so no one has to know that you're going through your period, and you don't have to be laughed about it. You don't have to be laughed at about it. Also, are you a woman working with men, and you're looking for the opportune time to put out, to like, pick out your pad so that you can go and change, but the men aren't budging. This is a pad for you. Yeah, thank you.
The other product we have is the quantified women with irregular menstrual periods. For example, the premenopausal women and girls who have just started their menstrual periods, and also most schoolgirls don't know when their periods are coming exactly. So this pad is a quantified. It has a pad embedded in the panty. So the girl just has to wear the panty, and she's never safe. She doesn't scared of staining because she has a pad inside the panty.
So as it says below, the construction mainly is the machining items, the purchase of the soil to make the pads, and the transportation and acquisition of the banana fibers. Because these pads, we're making them for eco-friendly, readily available banana fibers. And also, for the reusable pads, they dry really fast, which is a better advantage to the ones on the market. So ours are going to be going for a cheaper price. The current ones, the reusable ones, are going for 25,000, but ours will be going for 7,500, and the disposable ones are 3,000, having 7 in a pack. Ours will be going for 2,500, with our production cost at 2,000, and our estimated profit of 500. These are my team members. I'm very interested in Nigeria. I'm the trainer, Nata Shanita, and it's Guruji, Mulunji Jonathan, and Asha Chiruji.
Thank you very much. 2:44 minutes.
Yes, in a second, tell us what exactly is existing that in the past, one innovation of the question. Yes, in that way.
So for this one,
what exactly is there right now? What innovation are we working?
yeah, for the disposable ones, you have only one card. This one is a 2-in-1 package. No one has to know that you're going to change. You just peel off the top one, and you remain with the second one that you can use and change.
The current ones that are existing, you actually need 2 pads. If you're changing, you need another pad. But for us, we're giving you 1 pad with 2 compartments.
Thank you. So now how is the safety of this pad? Because you know our private pads are very sensitive. So how safe do you think this pad is? Touching, changing?
So this pad is made in natural products. We say banana fiber. The pads in the market, most times they use chlorine to bleach and all that, but these pads are going to be natural, and that's going to save the normal flora down there.
Thank you so much, Metro Poverty. Thank you for your presentation. you bring to interpreter?
Thank you very much. We are the inmates, and this is Aisha. Okay, this is Aisha.
Where's the name of it?
It's inmate. Inmate. So, this is Aisha, the team head, and these are my group members with different disciplines. We are coming up to solve the problem of expiry of medical supplies and stockouts. With over the 6,000 medical facilities that we have in Uganda, we have experienced stockouts and expiries even when the supplies are at the main warehouse. 43% of these facilities face stockouts of essential drugs, and even when these supplies are available at the main warehouse. There have been existing solutions to this, like Medtech and Medidrug, but they have not given a full solution to the problem. They have only given us the tracking, but not the monitoring and planning to forecast the upcoming. A lot of money has been spent on banning expired drugs, which is almost 1 billion, and they have banned a lot of drugs, which is over 1,000, and these drugs are still needed at the lower facilities. We, the inmates, have come up with a solution that will track all the medical supplies that will come in through. This is our layout of our application. The application will show the storage, the ordering, expiry dates, and show a notification of the drugs that are yet to expire in 3 months' time. We have our model in business. Our very proposition is to offer a platform for the medical personnel to interact and help in the effective inventory management. How? In our application, we have a section of chat where they will be communicating, and they can even talk straight to the Ministry of Health, which is the provider. We have also targeted the key partners like Uganda. As we know, it is the main technology organization that we have. We are going to work with NBA, National Medical Stores, and Ministry of Health. Our source of income will be through the annual subscriptions from these bodies that we are going to work with. I'm going to show a print of our system, how it's going to be flowing. The first phase, you will log in and show that maybe I've joined it as the medical personnel, or I have joined it as National Medical Store, who would be the chief people. If I'm the personnel, I will type my name, the username, then I have a personal password that is strong so that no one can hack into it. I log in. This time I want to order. I'll come to the case of orders. I write that those are the drugs I've ordered. Maybe I've placed in and wrote the names, then I order. If I want to order directly from NMS, I'll click there on the drop down. I put there. Then it will be moving from NMS to referral. I'll come here from NMS to referral. Then I submit my order. I put the quantity, how much do I want of the drugs. I put it the other side. I describe. Thank you very much.
Thank you so much. The way you are presenting it seems you are only going to look at, I need to mind about the only public institutions, about the private institutions. What are you thinking there?
They are also going to subscribe to us through the annual subscriptions. If they are willing to take up the system, they will come and register to us. The fact that it is online, they will come up and register and pay a reduced amount of the annual subscription.
Well, so who is the target? This target is by who?
By the different medical facilities, the main warehouse, the National Medical Stores, even the big body Ministry of Health, and even the lower facilities like the district health officers
And the medical workers within, they will have that system on their phones and like a mobile app.
Yes, there's something about mobile app and information system. It's not very clear there. It's on the desk, it's in a hospital, about mobile app. So mobile app is being used by the patients.
This is a progressive web app. Progressive web apps run both on the desktop and the computer with the computer phones. So if someone accesses the site and is on a phone, it has to install an app within, because this system can change from the desktop to the mobile app.
So why do you think this is a serious problem in the community at the moment? Why do you think so? What's there at the moment?
Thank you so much, sir. A lot of money is being wasted in expenditure.
Comment over 2 minutes.
Thank you. Thank you, Team Ime. Thank you for the
Your team number.
You are five. Can start.
Good afternoon, everyone. My name is Victoria Nachito. We are Team Shua Health, and we are here to simplify healthcare payments. Last year, a story ran in the papers that TMR Hospital and the National Hospital in Kampala were detailing a portion of a business cycle over an unpaid bill of 430 million Uganda shillings. Now, this took the President of Uganda to have this bill cleared. Now, any of us at any one moment can fall sick and get a huge bill that we cannot cover. So we have two options. Either to leave the hospital with a huge unpaid bill, or we are going to be held by the particular hospital in order to recover their bills. The available options of paying for healthcare costs, for example, insurance, have their own limitations and exclusions. So, with Shua Health, you don't even need to know the president because we have got everyone covered. Our solution allows for hospitals to be paid upfront for patient bills, and then we offer instant care. And they offer instant care to patients who then pay later at zero interest. This allows hospitals to reduce the burden of unpaid healthcare bills. However, also allows them to grow their revenue so that they can run their facilities better. Patients can pay their bills with flexibility, and also they are fully covered for any healthcare issue. Now, our product is a digital health financing platform. Here, anyone can go and sign up. And then after signing up, when they go, they just go to any of our partner hospitals, get the care that they need, and then organize a payment plan for them to pay over time. So, how do we then raise the money that we used to pay the hospitals upfront? We partner with people, get financial partners, individuals and institutions. This make contributions towards the fund that we use to pay for the patient bills. And we have a profit sharing model
the future we are looking at using data and artificial intelligence to be able to come up with personalized or individualized payment plans that each and every family can afford. Our target market are healthcare facilities.
Yeah, for me, this system, how it helps you from the shock. If you get so sick that you have a bill of 400,000 and you are a wheelbarrow pusher, you never pay that bill, even with any plan. So there is no pooling together like insurance. It's just simply a payment plan. So the people who are very poor and have little cash may not benefit from this system because it's still the shock is not absorbed by the mass, but by yourself. The payment plan, you just avoid to be imprisoned in a hotel, but not hospitalized.
And also, to add on what she said, it seems you're only targeting the rich and those who can afford even these smartphones and all that. Not everybody is able to put that up. So, what is your plan for those ones who cannot even do anything regarding technology?
Thank you so much for your comments and for questions. So I have to say, our target, our earlier we are looking first at teachers and border men. These people earn a certain amount of money. So we work directly with their employers or the people work directly with their supports. Now, there are healthcare facilities. We don't know right now. People don't know that different healthcare costs are different hospitals. So you can find a hospital that is charging really expensively, but another that is charging cheaply, but they're offering the same services. So if we can have our clients directed to the healthcare facilities that can cover the healthcare costs that they can afford, we've already seen those hospitals are partnered with them. So we are able to direct them to those healthcare facilities.
Okay, thank you.
Is it China? No?
I thought
I'm curious as to how AI is used in this country.
Thank you so much.
How it's used.
Team Sure. Thank you so much.
okay, let me not be timekeeping because we are not
You started with it. Just talking.
I get it first. You do the timekeeping. I don't want to hear in front of you.
Stop making me laugh.
No, don't just. But we have no papers.
Give me 5.
Sure. All right.
It's like a marathon.
If you have them as Excel sheet, you must do it. What is your name? Team name?
Blood leak.
Blood?
Blood.
Blood.
Blood leak.
Oh, blood link.
Yes.
Link.
Team what?
Team number?
59.
59.
Sample.
Okay, ready?
In 2019, we lost a classmate here at Mara General Referral Hospital who required a specific blood product that wasn't available at the hospital. His mother had to carry it from Bali Regional Referral Hospital. Unfortunately, by the time she got here, it was a bit too late. And we hear this plea time and time again, doctors warning of a crisis of blood levels, referral hospitals running out of blood, and also people time and time again having painful experiences watching people die because of lack of blood. Blood transfusion services are an integral part of a resilient healthcare system. However, the Uganda blood transfusion services do not meet the national demand for blood. We require 450,000 units as a country, but only 300,000 units are collected. Quick access to these blood products can drive down maternal and under 5 mortality that is really high in the country. This problem exists because we do not have a central coordinating system to follow up the donors who give us blood. We do not have donor registration and tracing to send them reminders to get blood, and we have limited avenues to donate, which brings us to our solution.
Our solution is a digital platform that will ensure timely access and increased availability of blood products through advanced donation and enabling fast location of needed blood products, especially during emergency. The platform will have a feature to track donors and remind them when they are due to donate, and also enable them schedule appointments for donating, and have a feature of advertising blood drives and also locating wherever blood drives are. Donors shall sign up and have the feature of locating blood drives, and health facilities will have the possibility of locating donors whenever they need them, and also of locating specific blood products around the nearest blood banks. There will be a feature of gamification to drive up donation by giving incentives to donors, like points, which will drive up their levels on the application, and also the priority list. These services shall be available in USSD also.
So how commercially viable is this venture? One, our customer segments, we are going to deal with health facilities, and also with patients that are in dire need of blood products. Our key partners are looking at Uganda Blood Transfusion Services, Red Cross Uganda, Ministry of Health, Rotary Uganda, and Lions Club, since they usually deal in blood donation drives. The cost structure means we're going to spend money on the software development, as you've already seen the prototype, then also operational and logistical costs in terms of setting up human resources, and also the infrastructure of setting up physical location and hardware. Revenue streams we to get money from hospital subscriptions, could be annual or biannually. Also, emergency situations whereby a customer may pay a one-off fee for blood product, and also charity funding and donations. Our team comprises of biomedical engineers, software engineers, business administration students, medical doctors, and nurses. Thank you very much.
That was 255 judges of the chief.
Thank you so much. In Uganda, I know we depend on just children who are donating blood. By the way, you talk as if we have specific people who donate. Now, how are you going to inform? Are you going to inform the schools to give blood, or you have specific people that information?
So specifically, whenever a person goes to donate blood, they can donate blood up to 4 times in 1 year. The current problem is that there is no follow-up after a person gives blood once, no one follows up after no period. So we want to have this done in a centralized database. Every after 3 months, we send you a reminder. If you're open to donating blood, you come and join us at a drive, or you can schedule an appointment at a Red Cross facility, at a Uganda Blood Transfusion Services facility to come and donate blood. This ensures follow-up of all the donors and make sure we have supply of the blood.
For information, for male, it's 4 times, and for female, 3 times in a year.
Yeah. Thank you very much.
Yeah, so I'm wondering, because instead of we plan to reuse
So we want to grow the database, but also there are a limited number of people who would want to donate, but we want to increase that number, and also we want to use the few who are willing to donate to the best way that they can be used, by reminding them and also ensuring that when there is an emergency, when people need their blood, it can be located, because most times they are willing to donate this blood when there is an emergency.
Additionally, the application has the platform for the blood drives. Therefore, if you're hosting a blood drive, you have this on your behalf, and all that have the platform can also have access to these drives to make sure that we have a bigger reach, and we depend on schools and hospitals and Rotary clubs and Lions Club, as mentioned.
You have to have a sign in and a sign and opt-in and opt-out function.
Time out for Q&A. Thank you, Team Blackman, for your presentation.
There is one software available. But it's very lame. I'm not talking.
That's the next
Don't worry, as long as you're stingy in the same strength, there's no problem. Yeah, there's no problem.
Hello everyone. My name is Chapter Shanisha.
Hold on. Team what?
Team
Safe number. Team number 5, number 6. You are team number? Before we really have.
Let's have the safe number.
Let's register safe number.
Okay.
Yeah.
My name is Chapter Shanisha. I'm a team member in Hack-A-Thon.
Speak up, please.
We have Ballet, we have Dennis, and then we have Josh. So we are team safe. So currently in Uganda we have over 375 per 100,000 maternal mortality rates, and over 136 of these deaths are due to poor transportation issues. So unlike in urban areas like here in Barara, where we have like ambulances, faster cars, and usually pregnant mothers, it would be easier to access this, even the health facilities are big nearer. In rural areas, there is an issue whereby the only means they have are borders, bicycles, and at times this is very unsafe because they are exposed to like accidents, they are exposed to unsafety, the risks they might face. So we're concentrating on the southwestern Uganda, the rural areas this side. So that is our problem, and our solution is safe.
So here we come up with a solution to this problem that we are covering. So as we are creatively and innovatively thinking, we come up with this idea which we call the safe arm. So going to safe arm. Safe arm is a carrier which doesn't use fuel that can be attached to a border. How safe and how special is this innovation? This innovation has a capacity of 2 people, as you can see from this 3D innovation, where the patient can lie and then can be able to accommodate a PhD who moves with this. It also has a component of first aid. It has a comfortable place, a comfortable bed where this person can lie. So this solution is maternal transportation, serves to transport both prenatal and postnatal mothers. So this is how the solution is. It's able to pick up for safety, and there is a seat, as you can see, it's four-wheeled and can be, it's a craft that can be attached to a border, and hence you can get also the safe transportation of these mothers.
Looking at its sustainability, we reserve complete ownership of the carrier. We're not selling the the item, we are only offering the service. And that we are partnering with stakeholders. We have among them include the local government through the village health team. We also have the boda circles. So we want to train a section of the boda circles so that they can know the speed limits and safety precautions to take while transporting mothers. Not anybody will be able to use this carrier if they're not taught the precautions.
Thank you very much. This technology, there are many safe ambulance technologies already in the market. Some look like small tech, some. There are different types of motorcycle-driven or bicycle-driven ambulances. What makes you different from the one existing?
So, the ones existing, currently what we have, when we try to compare ranging from the highest to lowest, starting from the highest, which are the modern ambulances, there are some of very rare and expensive.
No, like that, they are rare.
Yeah, so comparing to this comes in with the component of association with the VHT, which gives it safety and then also first aid on the way. So that's why we guarantee this for medical purposes. And we are designing this specific for medical purposes and in cooperation with the VHTs, be able to accommodate that and the comfort of this of the mother with this well-cushioned bed with the rails for protection and be able to travel safely for the health services.
Just pardon. One of the problems that are most likely to face is delay. So we need maybe a health practitioner, say a village health team member, who will move with the mother and offer any first aid during the transit time.
Okay, thank you. This is very good. But my concern, where are you going to keep it so that it's accessible?
So we are partnering with the village health team.
So to the people,
the village health team will keep it, any member will keep it at their place of business, but the maintenance cost is upon us. We just need to communicate with them and inform us in case of any maintenance, and then the boda partners can pick it from the village health members. Yes.
Importantly, porta may need to be trained because having an extra load behind needs another behavior.
Time out, Q&A.
Thank you.
Thank you so much.
Thank you, Tim. Said
Name of your team? The name of your team?
M. Presley.
M?
E.M. Presley.
A-N?
Presley.
You can start.
Okay, very good evening to everyone here. So apparently, 2 out of the 5 people that are presented in emergency departments die within 72 hours when they're presented there. And this is because their vital signs deteriorate when the medical workers cannot actually tell if they're deteriorating or not. Take a scenario where someone is bleeding, has been presented in the emergency department, another person is actually lying on their bed, the health worker does not know who to see or who to actually give care first. So most of the people actually die because first, when you see the Ugandan setting, the vital signs actually taken using the handheld portable devices, which is a case in this COVID and pandemic era where we do not want physical contact.
So the whole problem is the emergency departments, there is a deficiency of safety, equipment, and staff. So now we are proposing a solution. And our innovation is the Embrace Life wristband. So basically, what this is supposed to do, so we propose to develop and test wireless vital signs wristband coupled with a cross-platform monitoring screen, LCD, that's going to be installed in a hospital setting. So imagine a person enters, then you attach the wristband to their hand. After getting the wristband to their hand, then it is continuously monitoring the vital signs of the patient. So now, the health worker knows who to prioritize the treatment or not.
And the advantage of this solution that we have is that the information from the device is transferred to a big screen where the nurse can monitor from the distance and know that this patient on a certain bed is doing critically ill from the results from this. So we have about 3 people, the ones that are normal, the ones that are moderate, and the ones that are severe. We could be able to blink maybe a red light for someone to go and attend to them in case there is an emergency to be attended to.
Well, so apart from the solution, well, you can't make a solution without the money. So what is our commercial viability? Our commercial viability is the initial cost of this device when it is completely done at the production rate. It's going to be 25,000 Ugandan shillings. What we are going to do is we are going to put these devices in the hospitals. So if it is in a hospital, we are going to use price differentiation for the private and the government hospitals. First, if it is in a government hospital, then we shall be charging 1,000 per day per device for every other person that uses it. For the private hospitals, we shall go and hike to 4,000 per day per device every other day. We shall also make money through the maintenance of these LCD screens and the maintenance of the devices in these respective hospitals.
We have done a competitive advantage and looked at other innovations that are of that kind, and we use different parameters to see that we can make a device that is better, depending on the internet, the hardware, sensors, and we think that using those parameters, we stand a chance to make an ideal solution that can save lives and transform medical health care system.
Time up. Thank you. Judges, over to you.
Okay, thank you so much. My concern is about the safety of these machines. How safe will it be?
So when we talk about safety, first of all, this is actually very safe. In that, this is taking the vital signs of the patient. So the safety is, it has a geolocation. So you know if it is on this bed, you know that this device is actually on this bed. If the device is out of range, because in a hospital setting, it is connected on a RAN, which is a local area network. So you know if it is out, actually, whether this device is actually going up, it is in the hospital.
So is this solution improvement of what's existing or something?
Well, basically, we all know that there are actually wristbands out there. But then the application of this in a hospital setting is what is new about it. But we all know how our wristbands are put on the other day. But they're not being used to serve the healthcare system in Uganda.
The price is a little bit expensive when someone has 100 patients and 4,000 per day. Why not buying it so that we don't feel stuck? The hospital is not stuck paying 4,000 per day. It's quite expensive.
Why actually we give a differentiated kind of pricing was because it's actually even more expensive when someone is having that first purchase. People are quite hesitant. So first we're looking at adoption. When they get adopted and actually say this device can work, then maybe later they can do a whole batch of buying.
And then in addition to that, someone will not be ill all the time, but this is used only when they have condition.
Time out for Q&A. Thank you. Thank you, Team EM Press Life for your presentation. There are a lot. Because they are
Yes. They have a lot of that.
So apparently there's a system, and so this thing that is just right here has two presentations. But now this is also what I just noticed. We have system. Just
because I was just helping them, I didn't know that. As we were moving around. So now it's like I don't know that should be.
No, what's it? Is it an average of us? Which is average? Which is okay.
You think there was any bias?
Nothing. Because I didn't know that actually they put my name. Because I was I heard for them we were talking.
And your name was
presented a different one.
No, there's another one. So another team that were waiting, were looking for. I think one team has like 2%. Yeah.
Because for me, I had to deal with the one. I had to deal with the one, with the deal.
So we have 10 part.
No, mine has no part.
Not 10 part.
Because they were talking about the bills of pain management of what? Management strategy. From the back end and no, they're still like this one in my name.
But even if you recognize it,
no, I didn't know.
The bias
Anyway, it's okay, I didn't have any bias. But have you added? People are so fast.
Yes.
So one thing, you can stop it and get another team from one room.
Yes. This is the bias.
So I'm going to mention another team.
I'm going to different judging thing, and I'm going to pick another one. Bring them. Okay.
But don't bring 18. Don't bring 18. Not Spalibulu. Not Spalibulu.
So we'll do 9, we're doing only 9.
I don't know where. But
What Germany did that is to become so reliant, so dependent on the civil service. So someone just Germany. Stress. Now we no longer ask me when are you coming back. No. You have no reason to not stress there.
The same thing with superpowers.
And then what they are selling?
Hello. I'm told after pitching you have to register somewhere. After pitching you have to register somewhere. No, they mentioned it, but they made mention of it before.
Maybe the grains, remember we had the grains? When it would be indefinite and later it's free grains. This is not pitching, it's presentation. Which estimates and one part is the new ones. One day of the walls, just one marker go back to the room. Then only two, one office, 1 million, 2 trees, 5 million. Because we are this idea. Yeah, so you go back to the children. The priests are blessing them. No, they're now demoralized.
25 and
Yeah,
35 or something.
they're running away now from Russia. They're not in Finland, they're going out of the country. And they're not normalized.
You
see, remember the Vietnam War? You know this Vietnamese before? You know what's the thing? They are very mobilized and very motivated. The Russians or the Americans before Vietnam, they got tired because you find no sense. I don't know. Actually, they don't go to one of the how can this work in the country? Because it's so
Yeah, those guys do human machines.
Yeah,
to come like to kill and fail to stop killing. And then,
we have human machines. It's also called canon fodder. Canon fodder. What's the real word? Canon fodder. Canon fodder. Canon fodder. This is human beings who are wasted in war.
Can we give you one?
Yeah.
So I think the translation this room is customs because of
No, but its design was not according to my concept. I only created the funds, but its implementation. You got?
Yes.
I was no longer needed when
Whoa, the white one.
that's all what prepared with all the gadgets.
Hey, you didn't have enough toys there.
Which toys?
This chips.
Oh no.
Yeah, this is Lego for adults.
Yes. I like it.
Put there. Put something in here. It has babies. I think it will reach there. But I need more time. I no longer
Where? There.
Thief detection. Crime detection.
So the last one
That's the last one. You can set your prototype. Here in that way you can see.
suffer from neonatal hypothermia, and in Uganda alone, up to 50% of our children get cold fell in their homes. This increases their morbidity and mortality by up to 80%. The current interventions trying to tackle this problem are plugging in, so they can't work without power. They are immobile and they are not dependent, but therefore during power and stability. So we are suggesting a solution which we have named Mobile Warm, and this will be a warm baby blanket, which is battery powered. We are planning to have a battery of up to 10 hours. It will be hybrid powered, so you can use electricity and solar. Flexible, portable, can be used at home, in hospital and in transit, and to be also easy to clean and reusable. So we are targeting customers who include health facilities and ambulance services, parents and also caretakers of newborns. We are estimating our cost of production to be about 150,000. So our price may be about 250,000, which is almost a quarter of the current price of the product on the market. And we are looking forward to partnering with organizations like Camtech, MAST, GEMES, NMS, Ministry of Health, Association of Pediatricians, and also our competitors. And yes, this is the device.
Yes, our device is an automated warmer device that warms the baby while also monitoring the baby's body temperature. It has an alarm and a graphical user interface to alert the mother in case the body's temperature goes high or below the normal temperature. And while doing that, it's intervening for the baby. Then this device that we have here will be built into our baby blanket here. Our device is going to be built into our baby blanket, and then this is our team.
Thank you.
Thank you.
Over to Jeffers.
Yeah, you know, a battery source, yeah? You want to use rechargeable batteries?
Yes.
Lithium-ion. You know how much kilowatt or how much milliwatt you need? Like power pump of what size?
Yeah, so we want power to just supply up to an increment in temperature for...
No, the battery itself.
Yeah, the battery itself is going to be 7.4 volts, and it's going to be a 2.2 ampere hour battery.
Because a power bank can cost up to 100,000 already, so I think the price looks a bit low.
Yeah, the price looks a bit low, but we're hoping that when we start mass production, then we'll be able to cut down our price. Thank you.
So who are the target users? Who are potential users of that innovation?
Yeah, the potential users of our innovation are mothers of community-born babies, the healthcare hospitals, and then the ambulances, because we are looking at it also being used during the transit. If you're transporting a baby from one hospital to another hospital, or even from one ward to another ward, or even at home, because the current devices are already stationed in hospitals.
So in essence, those are working class mothers who have some fair income.
That's why we hope, but we're also trying to look at the current costs, and so we're looking at it being a subsidized price compared to the current costs. If they can afford these other bills, it comes at like a struggle after struggle. We hope that this one will be relatively cheap.
But I'm also hoping, since it's a reusable thing, a mother can buy it at once and can use it for all the
children. So how about the people going to use? Are you going to train them?
Yeah, so what we did here, we have like a simple user interface. It's more like a graphical user interface. So the mother or the pediatrician does not need any special training to be able to operate this device.
Some kind of
time out for Q&A. Thank you. Thank you, Mommy One, Tim, for your presentation.
Thank you.
I tried to see how long to all people sometimes feel cold.
Yeah, you also do?
Yeah, when your knee is paining, it's good to
60. Oh, they're first
I'm fine.
You want to be like that?
I was just imagining the risk.
in 2 days you can't produce. Just in 2 days you can't make a real working model.
This is just the prototype.
Yeah.
I mean, once they are approved, they'll have to take them to the calculation lab.
Even the heating coil, you know, there's a lot of things that you have to embed it. It has to be washable, or you have an element you put it in, then you close it. Before washing, you remove the element and close.
So it's like a non-existing warm brackets. Because
yeah, but you put the liquid element is a small sheet. It's flexible. See, it has to be flexible because of the hand sheet.
So there was something that you asked me before. No, maybe.
Yes, the issue is when you have less people to judge and have to have three winners, then they can advantage. When our sample size is smaller, we are having the same output. That means we are preparing.
Yeah, each room is going to have
but then we get less to charge.
I think maybe one team don't touch one because they can't find who has what idea.
You can't find more than
Yeah, along the way.
I think along the way someone put it.
It's intense.
I found students just talking to the wall.
Come on.
The pressure is too much. It's not 2 days. It's like one, because yesterday it was a whole day of talk. These kids started thinking about
You subject them to 4 weeks of that intensity. And we want to see how many people are still walking.
Blood pressure.
You want to go?
Yeah, it's together because you have to sign
And just
you're going back to the plane.
Otherwise, oh, they want it to their form for you to sign the forward.
Hard copy.
They are not yet migrated. Yeah, it's very mechanical.
and rich in public health and community experience, Dr. Birungi from Bwindi. No innovation will see business. Again from business, Dr. Sarah. Now the rules. So when you're called up, you will have strictly 3 minutes of presentation. When your 3 minutes are up, we will start appreciating your tireless efforts with a loud clap. Once Rena's team lead starts the clapping, all of us should join in appreciation and clap. Is that okay? So when we start clapping for you, it means that thank you, your 3 minutes are up. Just stop presenting. And then we will have 2 minutes for the judges to ask you questions. And after 2 minutes, we will also clap for the judges and thank them for spending their 2 minutes fruitfully. When I call you up, there's going to be 2 things. I'll either say you're on, which means you're on stage. So come straight on stage. And if you're on deck, please just go to the back and be ready. So once the team on is finished, they will go straight to sit down, and the team on deck will be on, and I'll announce the second team that will be on deck. So the team on deck should be waiting right outside. Are we ready? Okay. All right. So for the first team on deck, put your hands together for Team AI. Team AI, you are on deck. And the team that is on is Team Catheter Monitor. So Catheter Monitor, you're on, and Team AI, you're on deck. Team AI, you're on. Team AI, you're on deck, so go to the back. And Team Catheter Monitor, you're on. Team AI, please be on deck. All right. So Team Catheter Monitor, the floor is yours.
Good evening, ladies and gentlemen. We live in a world where we are seeing advancing technology, and one of the ways of working with this technology is improving our healthcare systems, their effectiveness and efficiency, and we are working on something in line with that. And our problem is that due to the high number of patients in hospitals, the nurses are few compared to the patients, and you find one nurse has to monitor a lot of patients, and in cases where you find infusion is required, maybe blood or medicine, you find these systems, once the infusion is done, it has to be gotten off, and due to the number of nurses being low, you find the monitoring is really not effective, and sometimes we face some complications which can actually be solved, and it may lead to backflow of blood or the medicine, most likely the blood, and also it can lead to death in case that system is not removed, the IV system. And this is our solution. It's a catheter monitor. So what it does is that it monitors the infusion, and once the infusion is done, it is going to alert the medical personnel in charge. It is in two parts. There is the monitoring part, which is attached on the catheter itself, and the communication part, which is it uses a radio model. And what it does is that once the infusion is complete, it sends an alert signal to the nurse, wherever she is in the nursing room, and she can come and take care of that patient. And what makes our project special is that we haven't had such a kind of project in Uganda. The cases which are there, it's just physical monitoring, and that's how we hope to capture the attention of the medicine department with our system. And our target will be the nurses, because they're the ones who are monitoring patients, and we hope to implement our system in hospitals in Western Uganda, like 30% in our first year of implementation. And we hope our project too, we estimated the cost of 30,000 cost production, and the project itself, if implemented, you have to purchase it at 38,000, and we look at a profit of 8,000. We are partnering with Camtech, like it's already doing. It's helping us with mentorship and training, nasdan.org, marketing and implementation, and Mbara University and the Referral Hospital for research, development, and implementation. And the next slide is for our team members, and we can demonstrate how our project works. So when the system is turned on, and
thank you very much. Team catheter monitor. What parameters does the system monitor? Volume or flow?
It monitors the flow.
Thank you so much for the presentation. The presentation was well laid out, but I feel that on the last part of presenting how the flow will work should actually be demonstrated when you're looking at the solution. So do not demonstrate it when you're ending the presentation, but during the solution part of it, you should be able to demonstrate that. And thank you. You took my advice.
Thank you for your good presentation. Now, can you tell us briefly how this would work, let's say at the lowest level of care, like Care Center 3, or in areas where there is no stable power source? What would be the source of energy of your system?
First of all, our target market is hospitals which have a large number of patients. In cases usually with these hospitals at a lower level where you find even there is no electricity or what, it's really, sometimes it's hard to find a really high number of patients, and you find the nurse may be sufficient enough. We are looking at a situation whereby it's a setting with a lot of patients and few nurses.
No, I did have a question, and I think it's what Daktari has asked. It's on the powering of your device. How is it going to really impact hospitals in the rural settings? And I think you already addressed that.
Thank you, Team Catheter Monitor. So Team AI, you're on. And Team E-Pill Kit, you're on deck.
Protocol observed. Good evening, everyone. This is Team AI for auto-diagnostic software for pneumonia, chest X-ray, and AI-based model. Realize that apparently in Uganda, the radiologist to patient ratio is 1 to 1 million patients. This implies inadequacy of radiologists, therefore ineffective diagnosis of pneumonia using chest X-ray. You actually realize that out of the 40 radiologists you have in Uganda, around 11 of them are retired. So we have a deficit of 37, and still under the 37, some of them don't work within Uganda. So there's a much gap left there, and most of them are urbanized. You realize that Mulago has the highest number of radiologists, and still under being attached to Makerere University that has 5, so we have already 11 occupied in Makerere only. So we have a deficit of the radiologists, as you can see. Why pneumonia? Pneumonia is a leading cause of death and among children under the age of 5 years. We registered by year 2014 over 1.6 million deaths, and fortunately in 2019 it dropped to around 740. That's still a very big number, and it's very alarming for the health care system of Uganda. And you actually realize that this is all directly attributed to the inefficient diagnostic procedure. You realize the current solutions have drawbacks. One radiologist actually goes for around 24 million per month. That's in Ugandan shillings. So the rural areas can't afford these people full time. Therefore, you realize that they are very far away from the remote areas. They can't be afforded for full-time services. And in that case, you have fatal delays. People are in long queues waiting for these radiologists to come and do interpretation. And it's fatal. It's not good in health. With respect to the drawbacks of the current solution, our solution, we're looking forward to creating an auto-detection diagnostic software for pneumonia chest X-ray using an AI web-based model. Web-based, I mean it's cross-platform and can be shareable on any kind of operating system. It's aimed to improve and fasten healthcare provision and referrals through diagnosis, auto-diagnosis, classification of different pneumonia, enhanced judgment. Enhanced judgment with intervention of a radiologist who does the final conclusion of a diagnosis of a chest of pneumonia. If you look at those images, you have unclassified, classified. If you have radiologists here, no one would actually go with the unclassified image. The classified image gives you a starting point for you to start on and do the final conclusion in respect to your ground truth. Because our model gives an output that can actually be compared with the ground truth, then you actually draw a conclusion. Well, for proof of concept, we have actually applied this model for fundoscopy for detection of different eye complications in the fundus, where we actually incorporated a graphical user interface. It has 4 buttons: that's load, detect, zoom, and crop. The detect button is the most important button on that GUI because it does the classification that we're talking about. Thank you.
Hello. Hey.
Yeah, thank you.
Thank you so much. I'm still wondering, who is your customer here?
We're mostly targeting the rural areas because you realize...
How much are they buying this product?
Yeah, in our business model, which you never had a chance to present it, we're actually looking forward to selling our software at around 300 Ugandan shillings.
Hey.
So it's installed in the beginning, and it can actually be used for some period of time before they call in for maintenance and service delivery, something like that.
So who is buying? The rural who?
The rural health facilities and perhaps some urban areas, because we realize Mbarara Regional Referral Hospital has no radiologist. In the table among our slides, you actually saw that.
So, you didn't...
Yeah, it's the fact, by the way. Mbarara Regional Referral Hospital has no radiologist. And it's very alarming. Yes, a full-time radiologist.
So, cause of time, let me just go ahead. So, in your solution, you talk about measuring parameters. You didn't mention what those parameters are, because in the pneumonia, you can be talking about the birth rates, the breathing system. So, how would you measure the pneumonia or be able to do that using your AI?
Yeah, for AI, I believe the data already exists. We just need to actually borrow data sets from, we can use Keigo, we can use several platforms that actually have data about pneumonia. It could be characteristics of pneumonia patients, and that's the data we need to actually come up with a model training and actually further deploy it for our web-based application.
How is the problem connected to the solution? Because you still need the intervention of the radiologist. So I didn't see how you're linking the problem to the solution. Really.
Yeah, now, thank you so much. Thank you so much.
Thank you. Thank you. Thank you, Team AI. Please go and take your seats.
Thank you
Team
so much.
E-Pill Kit, you're on. And Team Bloodlink, you're on deck.
Good evening, ladies and gentlemen. My name is Musinguzi Ethan, and I have a problem of diabetes. When I'm at home, my mom usually buys for me pills that I take 3 times a day. And then, since I'm a primary child, I'm always rushing to school so I can get there early. And then, in most cases when I'm rushing, I forget my pills at home. So when I forget them, I'll get an attack at school, and then they'll have to rush me to the hospital. And even when I remember to take my pills with me to school, I'll forget the time when to take them, so I'll forget to take them on time. And then even when I remember to take them on time, I can forget the correct dosage to take. So our team has developed a solution for all of those problems. The e-pill kit. The e-pill kit, your med companion. So it consists of a wristband, a pill box, and a wristband. So it works like this. When I'm rushing to school, then I forget my pills at home. It will vibrate on my wrist, telling me that I forgot my pill box at home. So I'll take it, and then I'll go to school. Then when I'm at school, when the time comes to take my pills, it will vibrate again, telling me that I need to take my pills. And then when I'm taking my pills, it will dispense out the right dosage for me to take. And then the wristband is always monitoring my blood sugar levels. So if they are high or low, it will tell me to go to the doctor. And then it will also message the doctor to come. We are selling the e-pill kit to patients with diabetes and HIV. And guess what? We're only selling it for $10. Thank you for listening.
And this is the far we have come with our prototype. This represents our wristband with a LCD display and vibrator on the surface. So this can be powered up for now, but we are going to work on further refinement and also to customize it to make it sizable and convenient for the person to put on. So we are looking at people with non-communicable diseases.
Any questions?
Thank you. Yes, there are questions. Thank you so much, Team E-Pill. Very interesting innovation. I didn't get the first point. I understand when you are in school, it's a bit of time-based, so it will know it is 12 o'clock, it vibrates, you get your medicine. When you are leaving to go to school and you have forgotten it, how does it tell that you have left it behind?
It communicates through Bluetooth And so when the collection is lost, it will vibrate and then tell you that you have forgotten your pills.
Yeah, thank you. Now, please shed some more light on how the dosage would be calculated. I imagine some of these pills could be of different strengths. So the dispensing aspect, if you could clarify a little on that, please.
Okay. When the doctor gives you your pills, I can say like, let's say 1 times 2. So on the wristband, you enter 1 times 2 at this time, and then it will give you the correct dosage.
And then finally, your partners in this, I did not...
We have partners there that include Camtech Uganda, International Diabetes Federation, and our very own Uganda Diabetes Federation. We are looking at Mbara Regional Referral Hospital for testing our technology. And then we're also looking at the Ministry of Health, plus more funders that will come in play to support our innovation to go to the next level and hit the market.
Thank you so much, EPIL Kit. You can take your seats, please. Blood Link, you're on. And on deck is Team Safe Ambu. Please, if you're on deck, I recommend that you come this way and exit through this door where I am. Blood Link, the time is yours.
Thank you very much. So this story starts from 2 years ago when we lost a classmate who needed a specific blood product that wasn't available at Mbara Regional Referral Hospital. So his mother had to carry blood. She was a nurse from Mbale Regional Referral Hospital. Unfortunately, she didn't make it in time. And this is the plea we hear time and time again. Doctors in Uganda warning of a crisis. Patients at risk as referred hospitals run out of blood. And painful experiences from people who see patients go through this. Blood transfusion services are a very integral part of our health system, and therefore it is important that we take care of them. Uganda Blood Transfusion Services currently does not meet the national demand of blood. Ladies and gentlemen, we need 450,000 units of blood, but only 300,000 units are collected annually. Quick access to these blood products, mind you, has the ability to reduce maternal and under 5 mortality, but there is currently shortage. Lack of central coordinating system to follow up these donors who give out blood, and inadequate donor registration and tracing procedures following giving out of blood is one of the major problems, and this brings us to our solution.
Our solution is a digital platform that shall enable timely access and increase the availability of blood products through advancing blood donation and enabling fast location of blood products and blood donors. The features of this platform shall include a database of donors who shall be tracked and reminded of their schedules when they are ready to donate again. And it shall also have a feature of scheduling appointments for blood donation, in addition to people organized drives advertising these drives and donors having the ability to locate the drives. The other feature is for health facilities to locate where the exact blood product that they need is on the map near them, and also to locate donors that are ready to donate. In addition to that, blood drives shall be easily accessed nearby, and these services shall be available on USSD2.
One may ask themselves, how commercially viable is this venture? One, our target customers are going to be health facilities and individuals who are in dire need of blood. Our key partners are going to be Uganda Blood Transfusion Services, Red Cross Uganda, Ministry of Health, Rotary, and Lions Club Ugandas. These are going to help us to sensitize and give us more donors. Next. The cost structure is going to be, we're going to spend money on software development, as you have already seen the prototype, operation and logistic costs, Infrastructure, that means setting up a physical location as well as hardware. Our revenue streams will be hospital subscription fees, which could happen annually or biannually. And then we shall also have one-off payments for emergency situations, whereby someone can search for a product on our app, and then also charity funding and donations. Our team is made of biomedical engineers, and yeah, thank you.
Thank you so much for your presentation. Now, with regard to identification of blood donors and when they would like to donate, could you please explain how that would happen with your app? Because the current drives target, say, schools, and you know that is a mobile population. People every year, they are leaving. So are you dealing with institutions, individuals, and...
So we are moving beyond just schools. We are also moving to the individuals like you and I who need to donate blood. So when you come to donate blood, you have the option to opt into our program to follow you up. You know you can donate blood up to 3 times each year, but I'm sure people only donate once. So we want to move to individuals in offices. They can also schedule appointments and come and donate blood at their own will at the different Red Cross sites. Yes, that's the solution.
So, blood in itself, when someone donates it, it's illegal to sell it. It's actually unethical, right? You haven't really touched on how you're going to commercialize this. You said to hospitals, and I know they're not, I don't know about hospitals in Uganda, but I know it's going to be difficult to pay for them. Yeah.
This is a challenge, but the innovation around this is that we are selling the service. The product itself is free of charge, as you have mentioned, but what we are selling is the service to locate the donor. That is the service we are selling, to locate the donor or to locate specific blood product. Yeah. So that is the service that people shall pay for, and at a very small fee.
So do the donors also pay to be on the system?
No.
I think we are good.
Thank you, Team Bloodlink. So the floor is for Team Safe Ambu. And on deck is Team Pantipad.
Good afternoon, everyone. No, it's a good evening. It's a good evening, everyone. My name is Chaglain Shanisha, and this is my colleagues Josh, Dennis, and Lamek. So we are Team Safe Ambu. So currently in Uganda, we have over 375 to 100,000 maternal mortality rates, and over 136 of these deaths are due to transport issues. So unlike in urban areas like here where we are, Mbarara, we find that there are ambulances, there are cars, even the health centers are nearer for pregnant mothers to access, or in terms of emergencies when they're expecting. But in rural areas, it becomes difficult. Why? Because there are only borders, the bicycles that they can access, which is risky for them. So we come with a solution of a safe ambulance, that is Safe Ambu, which is our title.
This brings us to the solution, which is Safe Ambu. So we bring you Safe Ambu, which is a carrier which is non-fueling. You can see it has we have put into consideration of what a border can wheel, so which is maximum of 350. So this is together with the attendant and the patient, it's lower than 350. It has accommodation of the patient, which is comfortable, like you can see. It has a deck where a patient can lie. It also has a place where the VHT can sit. We are partnering with the VHTs to transport these patients to the health facilities safely.
Team, my name is Joshua, and this carrier will completely own it. So the target population, the pregnant mothers, will not incur any cost of buying it. We shall provide to the community, but how are we providing the service? So we are going to determine the price depending on the distance and the time taken to reach the hospital. So maintenance and services, the money coming, the carrier can still be used for advertisements. From the advertisements and the money generated from the transport income, we shall use it for the maintenance. We are partnering with the border borders, the local circles. Now we shall train a section of those border borders and design an algorithm that will keep tracking them to ensure that we can locate the nearest border to reach the VHT's place. The VHT will stay with the carrier so that it can be picked up anytime. So the border can be located and called upon to go to the VHT and pick the carrier and solve the mother as fast as possible. Thank you.
Okay, thank you, guys. Imitators, how are you dealing with them? Because I see something like that, I'm going to note that, mothers in my neighborhood need it. So I'll create something like that. How are you dealing with them?
Okay, thank you very much. So this carrier is unique in such a way that we know sometimes delay to reach hospital is the problem. The mother can easily have challenges because she's the only person in the carrier. This carrier comes with a capacity of 2 people. So there's a possibility of a trained team member from the village health team who will be monitoring the mother's condition inside the carrier as the cyclist focuses on helping the mother reach hospital. So when we include 2 people inside the carrier, one, we guarantee the mother's safety, and it will be a better option to the one that is currently in place that only offers a cage for a mother to stay in until they reach hospital. Thank you.
All right, so I have a few questions. One of them is, if you're going to connect this to the border, what is the mechanism that you're going to do that? And the other question will be on the comfort. I know there's the mattress and everything like that, but there's the infrastructure in the road in the rural area. How are you going to ensure that the pregnant mother is safe to move around? And the other question will be the connectivity, the communication between the pregnant mother, the border guy, and the health facility. Because I know you mentioned about you being able to control that. How are you going to do that?
So first of all, answering the first question of the how it's connected, we have what we deck onto the border. So it's a detachable carrier that can be able to attach onto the border using that, calculating the distance from the border and the carrier. So that it can be able to be hacked.
Fantastic. Thank you, Team Safe Ambu. Now, the time is for Team Pantipad. Team Pantipad, you're on. And on tech is Team Humura Belt.
So I restart. Good evening, everyone. Our team is tackling a problem of menstrual poverty, the inability to access menstrual products using your menstruation. So we know menstrual poverty comes along with stigma, UTIs, and also absenteeisms of both the girls and us, the women that are working. Thank you. These are our innovations.
So I'm Angel, and one of the innovations we've come up with is the pill pad. So I'm in my P5, my pad was full, and I'm going to the toilet to change. I get my pad out, and it falls down. And then everyone in class started laughing, so I was really embarrassed. So what we've produced is a pill pad. It's basically a 2-in-1. Just imagine your normal pad, but then a second one on top. But there is a safe material in between that prevents course infection. So with this one, when your pad is full, you just go to the toilet. No one has to know that you're going through a period, and you peel it off, and like also remove the middle pad that prevents the course infections, and voila, it's like you have a new pad for your menstruation. Yes.
So our second product is the panty pad. So the panty pad, it has a panty with a pad inside. So women with menstrual irregularities, like premenopausal women and girls who have just started the menstrual period, and sometimes 90% of schoolgirls don't know the exact date when the periods are starting. So this panty pad, you just wear it. You don't have to worry about putting a pad. And remember, when you put a pad and then you don't menstruate on that day, you're wasting a pad. But this is the panty pad, so it's part of you. You're just going to wash it. Yes, that's the innovation. And the other thing about our products, they contain no antimicrobials or chlorine, so they're safe for the vagina.
Thank you. Next slide. So our business model, we're looking at our cost structure, having the sewing items, the purchase of the cloth to make these panties, and also the acquisition of the banana fibers, because these pads are going to be made from banana fibers, which are eco-friendly. And then also the revenue streams are going to be from the sales and the trainings, and the customer segments. We're looking at schoolgirls in rural areas, refugees, premenopausal women whose periods are irregular. Yes. And currently, the reusable pads are at 25 a pack. Ours will be at 7.5. The disposable ones are at 3,000. Ours will be at 2.5. Yes, and these are our partners: Reproductive Health, Camtech, Ministry of Health, and Ministry of Gender Labor.
Yes. Thank you, ladies. Gentlemen, the gentleman in the back, I'm asking, why are you here?
Everything that affects a woman indirectly affects a man.
Thank you.
I believe everyone here has a mother or has been born by a mother. So this is something that affects everyone, and also many of us actually have siblings who are sisters. So this is something to make sure that everyone is safe and is encouraged amidst any challenges.
Thank you so much, Team Panty Pad. I think it's a very interesting innovation. My concern is that when you are packing up these pads, don't you think it will be too thick? If you wear it and you have your trouser, it might appear like you are not a woman or something.
Okay.
Okay, so we are using banana fibers, and you realize this material is actually lighter than the one on market. For example, the cotton, so it's not heavy at all. And also, by the mere fact that we are making for you 2-in-1, we are minimizing the cost. If there are 2 pads separate, you will need a separator here, but here we shall need only one. Thank you.
The separator. So it's used, and then it still stays on your body, and then you have the other one on top of the other one. Or didn't I not get that right?
Yes, so it is one pad, but has 2 compartments. Remember, as ladies, during our menses, we need to change the pad 6 to 8 hours. So this one has this compartment, and also this one. So when this one is full, it has a capacity of filling after 6 hours. You just peel it off. Okay. Then the strings are okay, and you just tear and it's on.
So one more thing, right? There is 2 products that you are talking about here. It's better off to have concentrated on one and then the other one presented at the same time, but not combine them.
Thank you, Team Panty Pad. All right. So on is Team Humura Belt. And coming up on deck is Team Rololi Tanda.
Yeah, so I'm going to be speaking for Shanita. She's a nurse, she's a health worker. But then every single time, every month when she goes through her periods, Yes, she has really intense abdominal and back pains. And sometimes she's not able to do all the work that she's supposed to do on the ward well, and she asks for a nurse, me, most times, to fill in for her. But then that also leaves us with a big burden, like already with a high patient to nurse ratio.
A significant number of healthcare workers is made up of females, and these people experience menstrual pains during their menstrual days. And this could affect the way they perform, the way they provide services to patients, and consequently be absent for work. And this would increase the ratio of patient to nurse ratio, which would be ideal of 1 to 5, thus making it wider, probably 1 to 30.
So we're actually having a solution. Our innovation, kindly back to the other slide, which is a belt, the Humura belt. Yes, so basically someone puts it on. Next slide. So basically this belt has the closed gate theory, and it helps the belt actually produce micropulses that actually keep the nervous system, the central nervous system occupied, and the brain cannot interpret the menstrual pain signals. So basically, let me give an example of when a kid falls down. What you do majorly, you just do this. But what you're trying to do is actually to tell the brain to interpret the vibrations, not concentrate on the what? On the pain. And the kid actually becomes okay. That is a little example of the closed gate theory. Is that okay?
We are giving a solution that is cost effective. The belt is going to cost 30,000 shillings. And cost of production is going to be 40,000, and the retail cost is going to be 60,000 shillings. This is going to be using solar, and you can put it around your waist, and then through the closed gate theory, you can get relief from the pain instantly.
Okay, so with our commercial viability, so we are not actually, in the long run, we are targeting schools. Basically, these are the people that are actually going to do the mass purchases of this particular device. The girls' school, someone told me about Nabingo. And our key partners, we have Camtech. Basically, it helps us with mentorship and guidance. The Ministry of Health for research and national guidance, and all other education institutions, so that we can actually scale it. So that is our team, and we are made up of quite a number of people, and nurses, then software engineers, and our mentor, Mr. Beba Esther. So we could actually have a working prototype.
Okay, thank you so much for your very promising innovation. But regarding cost, at 40,000, you say, how many of the village girls who are the most disadvantaged do you think would afford this?
So basically, as part of our business model, yes, this is mainly targeted for the people that are actually in schools. But then we are putting an option of a mass purchase, where we're actually reducing this particular type of the costing. So I believe if it is in a setting of a rural, setting, and these people do not have the money to actually purchase this, we hope we can fundraise and people can purchase all the items at once, which literally reduces the price that would actually incur in the production and incur in the selling.
In your communication, you mentioned that you'll be selling at 30,000. Was that a miscommunication? Because I'm.
What does it use? I've just had you talk about
it. It's a closed gate theory. It's a closed gate theory.
Oh.
So.
Called closed gate theory. Okay.
Yeah.
Okay.
Maybe if I could do a demonstration for all of us in here to better understand what a closed gate theory is. So I'll kindly request everyone here to bite their lower lip or upper lip and do this. So if I say 1, you raise your finger and then you bite harder, right? So 1, 2, bite harder, 3, 4, 5. So now try shaking your hand. You could actually tell that the brain does not now interpret the brain. It's actually focusing on this. So that is.
So it means I can use any belt. Like I can take any belt out there and it would still work.
No, not really. So you see from this, there's actually gel on the belt. That is on the final product. There will be gel. Thank you.
All right. Let's welcome Team Roroli Tanda. And on deck is Team Sukari Care.
Yes. You have the pardon? They asked for it. You need it on a flash.
Oh, no
It's
presentation.
called Rolitanda. It's called Rolitanda.
We can have those on deck.
Bring a flash. Is it on your PC? We handed it in, but they say they can't see it.
Does it have video? We don't have it here. Or you can bring your PC, we connect the PC here. Or you can copy them if they are there. Put them on the class. If you're going to use your PC there. They want to use it on the other device. Give it to getting them from there. It's like this over transfer. Can another team come as this one's finding their presentation?
All right. Can I make a request? What I would like to request is Roroli Tanda, please you go on deck as you sort out the issues of your presentation. And Team Sukari Care, please come on. So Roroli Tanda, please go back on deck. As Team Sukari Care, come on.
For 12 years every day, I have to prick myself to take my glucose measurement, and I have to prick myself to give myself insulin. This is painful, it is inconvenient, and it is also relatively expensive. And this is the reason why myself and the others find it hard to adhere to this medication. I am not alone. 576 million people in the world live with diabetes. 200 million of them require insulin every day. This is why we have come up with the Sukari Care system. The Sukari Care system is a 3-component system with a non-invasive continuous glucose monitor, with an application, Sukari Care application, and an automated insulin pump. So what happens is that the non-invasive continuous glucose monitor takes your glucose levels, like you can see, and then it sends a message to the app so that the records are kept. When the glucose level is high, it now sends a message to the insulin pump so that the insulin pump will release insulin into your body. When your glucose level is low, it sends a message to the app so that the app tells you, hey, take a soda, else you could die. Also, this application can actually allow you to fit in the language that you're most appropriate with. So if you're Mnyankole like me, you can actually interact with your life in your local language. Ladies and gentlemen, if the glucose levels are abnormal for a long time, it sends an alarm so that you go to the hospital. We are looking at diabetic patients, and hospitals as our target market. We hope to give them this system at a higher purchase system, but also those who can pay all at a go. Really, we are okay with it. And the value we are bringing, if you're a diabetic in this room, you know what it means if we say non-invasive and painless. But also, have you thought of the fact that you're going to actually be looking at your glucose in your language, and when your doctor comes, they will just open the app and say, oh, your glucose has been doing good, or maybe let's do this. Ladies and gentlemen, with this, we believe that we are reducing the mortality and morbidity. We are making the life of a diabetic a little more affordable and, more convenient. This is the team that I have been working with, great minds, and allow my team get closer and show you that this is not fiction. It is real and it is working.
Yeah, data was carried away by the presentation. Thank you so much, Team Sukari Care. I want to know where you connect the insulin pump. Do you keep walking around with it also plugged into yourself?
Yes, okay, the insulin pump is very light. You can wear it around your belt. It has a tiny catheter that is inserted within your skin, subdermally. And it's actually waterproof. We put a patch, it's waterproof. So as compared to having to stick a needle in your thigh 4 times a day, prick your finger continuously, we feel it's much more convenient.
Okay, so there's the part whereby the needle is on that belt throughout your entire day. So there's the safety part of it, the comfort part of it, and then there's the security. How sure are you that the needle will not break, and the contamination during those intervals of injections during the entire day? And I'm imagining if that is the case for you, that will have to be the entire lifetime.
What is in your skin is not the needle. It is a catheter. It is either plastic or rubber. It's not the needle. It's just passing the insulin. So the insertion is what, if you have had a cannula insertion on you, what remains inside is not the needle. The needle comes out. And the catheter can be changed maybe like once in 7 days or...
Okay,
or
but
14.
the wound is still open, all right?
It's
the contamination, but maybe I could not be understanding.
Okay, thank you very much. I would love to clarify. You actually don't create a wound, just like a catheter. It is just a small incision or insertion where you can pull out the catheter when you're changing, and it will actually leave no one there. It is so small.
Okay, so thank you. One other thing you need to address is for those who may not be having smartphone. How does it apply, for the rural poor without a smartphone for that app? And also dealing with the issues of infection at the site. If you are going to maintain a catheter there, then the dosage, whether you keep refilling.
Be changed that the app can be connected to more than one phone.
It keeps refilling.
So in case the patient doesn't have a phone, the caretaker at least has a phone, or even one of the family members at least has a smartphone. Thank you.
Thank you, thank you, thank you, teams. So officially, that marks the end of the finalist judging. Oh! I'm so sorry. I just looked at Team Sukari Care And it was the last, and I forgot that I'd sent Team Roroli Tanda. Sounds very thunderous, right? Okay. So Team Roroli Tanda.
Good evening, ladies and gentlemen. My name is Bernard Kaziwe, and I'm a nursing student at Mbara University of Science and Technology. So, according to World Health Organization, it shows that 70% of clinicians in sub-Saharan Africa and 87.9% of midwives in Uganda suffer a problem of burnout. Burnout is whereby health workers suffer from spinal problems, and these are usually resulting from carrying of heavy patients. Imagine a man of my miniature size carrying a 200-kilogram woman from a bed into a wheelchair. I will not only break my back, but I will break the patient's back also. So in order to tackle such a problem, my team, the Rolly Tanda, we came up with a 2-in-1 transformable bed that can transform into a wheelchair. Our bed is automated, and it doesn't need the clinician to carry the patient from the bed onto the wheelchair. It just folds into a wheelchair. And other fringe benefits with a Rolly Tanda, it can not only move a patient, but we can also add a physically removable bedpan onto it for patients with what? Incontinence. Thank you. And we're looking at our business model. The Rolly Tanda is quite effective in a way that it is cost effective compared to what has been proposed on market. The Rolly Tanda will cost very little money, and all the resources we are using to make it are within our nation here. Looking at our value proposition, our medical bed, or the Rolly Tanda, is a transformable wheelchair, and it is using resources that are available to community. And among our key partners, we are planning on engaging in Camtech. You can have a look how it works. You see it can transform itself. That is the Rolly Tanda, a rollable chitanda. So, and according from, yes, and in our team, we've engaged biomedical engineers, IT students, nurses, and midwives who have skills, science, and technology about breeding something that is tangible and something that is good, like the Rolly Tanda. The Rolly Tanda is cheap. Funding, we only need around $400 because we are starting up fresh, so that we can make a physical and tangible Rolly Tanda that will solve back problems within our healthcare facility. Thank you so much. Since we still have some time, I can utilize our time. Yes, our bed, like you're seeing here, it even has space for adding vital sign monitors. You can put IV fluids onto the Rolly Tanda, and as the patient is moving, they are getting some medication. You can monitor their temperature. That we shall do it when we've gotten your funding, and now we are what? Perfecting our model, that it is being put into physical format. Thank you so much.
Thank you so much with the Rolly Tanda, very exciting indeed. Now, the power source, where will it derive its power source, for that kind of automation?
Thank you so much. The Rolly Tanda has 2 proposed power sources. It is electrical because it's automated. We can connect it into a switch, and if electricity is there, and it is able to automatically convert into a wheelchair. In case of power shutdown, like for an African economy, we can have batteries that we are going to put batteries under the bed that can still make it functional even when there is no electricity. A very good project indeed.
I like your energy. I'm wondering
thank
about,
you.
So the buyer is supposed to be the hospital, right?
The buyer, we are targeting mainly hospitals because they're the ones that have very critical ill patients, and maybe non-government organizations that are dealing within healthcare, community nursing, and have established simple health facilities within remote setting.
So a hospital like Mbara University, Mbara Referral Hospital, how many beds do you think they could be taking in 1 year?
Thank you. Depending
they already
on
have
the
beds.
The beds they have are ICU beds that can only position a patient into sitting position, but they do not move the patient. So you have to carry the patient from the bed and you put them onto that other bed. But this Rolly Tanda, give an example of a post-operative mother. From theater, you just press the switch, it turns into a wheelchair, then you drive the mother up to the medical ward. A very nice bed.
question. Wouldn't it be like this huge wheelchair just being moved around for it to be like comfortable as a bed and for it to actually function well as a wheelchair? Wouldn't it be huge and bulky and even add more space stress?
It would be so bulky because as you look at our prototype, when there are things that will squeeze in so that it reduces size. Thank you.
All right. So that is the power of a medical technology hackathon. It happens once a year in Mbarara University. And look out for the next one. We usually say this is just the spark. After here, Camtech Uganda is prepared to start fanning the fire. So all teams, please know that after here, our doors are open in Camtech Uganda. Come and sit with us. Let's continue thinking, let's continue developing, and in a few months or in a few years, we should call back the country director of NITA Uganda here to see some of the products that have come. Sir, you missed on Friday evening the many products that came out of Mbarara University that are already in the market. But we'll get the time to be able to showcase this to you. So at this point, I would like to thank our finalist judges. Please give them a thunderous round of applause. Please, we would like to excuse them to go and compile the marks, and when they come back, a lot of money and goodies is at stake. The first prize winners will receive 3.5 million shillings. The second prize winners will receive 2.5 million shillings. The third prize winners will receive 2 million shillings. Impact, technical feasibility, and commercial viability. But there is a fourth prize. And this fourth prize, before I tell you, I would like to thank our partners, Think Innovations, located in Mbarara. Think Innovations is your computer one-stop center in Mbarara. They have sponsored the fourth prize. The fourth prize is a brand new laptop from Think Innovations. And this brand new laptop is going to go to the team that has the best presentation skills. So if your team displayed the best presentation skills, you have yourself a brand new laptop. So I would like to introduce to you the director of Think Innovations. Sir, you're welcome. You have 2 minutes to address and tell them about this computer and your shop.
Thank you very much. Good evening to everyone. My name is Nsamba Isaac from Think Innovations Uganda, your leading shop in IT gadget scene in Mbarara. We are glad and honored to be here and to participate in this Camtech event. I think innovation, we deal in computer selling and laptops, computer gadgets and accessories and everything concerning computers. We also do computer repair, and we do hardware and software maintenance. Think Innovation, let me take this opportunity to thank students from Western Uganda, most especially MUST, for your support. You've been there for us. You started with us. So I think Innovation Uganda, we wanted to give back to the community. So we decided to award the best presenting, how can I call it? The team with the best presenting skills, a new laptop. It is a 3340. You will see it. I'm having it over here. I think I'm handing it to this gentleman, to hand it to the winner. So thank you very much. I would like to thank the organizers. I would like to thank a certain lady called Nuliat. She has been there for me the whole day. Since yesterday, she has been there for us. Thanks you very much. And that's all. And I would like to, lastly, I think Innovations, we have a promotion. That promotion is called Pay As You Use. It goes for only students from institutions around Mbarara and Western Uganda. You pay 50%, you take a laptop, you continue paying it. Let's call it a computer loan or a laptop loan. So you check on us. We are located at Timbuktu Street, Western Arcade, first floor, and BNK building, room B002. Thank you very much.
Thank you so much, Isaac. And if you didn't know, Isaac is an alumnus of Mbarara University. So from Mbarara University, we don't only build brains and hands, but also we cultivate hearts. And it's from a good heart that you will be able to think about giving back to community. Thank you so much, Isaac. May you prosper. So my role here is over. I would like now to invite our MC, Angela Nakato, to take over from here. Thank you so much.
Thank you so much, Dr. Data. He whispered to me that we need to keep the people who have just hacked comfortable so they don't bite off their nails as they're waiting for the results. So I'm saving your nails right now. And let's stand up and just do a little bit of exercise. Then we watch videos of our donors. Stand up like your champions. Okay. Someone has requested that we do the fishers of men again. Deal? We start with that one first. Everyone stands up. Now those ones who are talking, you're not going to win. Okay? I is everyone, okay? I is everyone. F is for female and M is for male. Okay? I will make. Where are the ladies standing? I will make you fishers of men, fishers. Teachers, it's hard to teach. Okay. When I say I, you all stand up. When I say a letter that has F, a word. Okay, let's all sit. Let's all sit. Yes, I, everyone stands up. I will make men, yes. Make, men are the ones standing. Men. Make you fishers of men, fishers of men, fishers of men. I will make you fishers of men. Of men. Doctor, you're a man. So we are taking it faster. 1, 2, 3, go. I will make you fishers of men, fishers. Bananga, you see what doctor is doing? He just goes, he's halfway. Okay, we are going, everybody up. I will make you fishers of men, fishers of men, fishers of men. I will make you fishers of men if you follow me. I think the ladies have won. Please clap for the ladies. And that is corruption. The men have won. Okay, let's have the first video. Are we ready, Ronald? Ronald, are we ready? Ronald, are we ready with the video of Wipo or something? Okay, Rama, where are you? As Ronald is getting ready, where's Rama? I just need a microphone with the audience. Help me out. Okay, just give the microphone to any team there. Any team, any team. Are we there? Just give at random. At random. Yes, please stand up. What was your experience at the Hack-A-Thon? And those who are talking behind, may your team not win. Yes. Let's listen to each other. Okay, may your team win if you apologize.
Oftentimes we have made prayers, but I don't know whether God answers good or bad prayers. Anyway, we leave it to Him. Clifton Irahuka, and I came from Fort Portal. I have a very positive experience. Hello?
Yeah, you want them quiet?
Yes.
Guys,
can we listen to each other, please?
Thank you. Your team is going to win.
Yes, it will.
Not you. Them who are quiet.
My team will as well win. So I've had a very positive experience being at this Medtech Hack-A-Thon organized by Camtech Uganda in partnership with the other agencies. Number one, that makes up that positive experience is the people I have met. There are quite a number of people whom I've spent a number of years with met before, but happy enough I found them here. So that is a very good thing. Number two, if there are brilliant minds with very wild but impactful thoughts in Uganda, I think they are gathered under the roof of this hall today. Everyone here, whether they've gone through or not, have very brilliant minds. They think very fast to solve very realistic problems, okay? So I feel personally that it has improved and challenged me to think even way better than how I came. Thank you.
Thank you so much. Yes, I'll borrow his words. Everyone in the room is a winner. With us, we have a team that used to hack about 5-6 years ago, and now they're enjoying the fruits. Ronald and Sankara, please, are we ready? Ronald will tell us his experience. He has presented it in Nairobi. From Nairobi, he participated in the Mandela Washington Innovation under the Mandela Scholarship. Far and wide, they're still going. So start small, build up big. just like the safety pin, like we were told. So may we listen just for like just like for a motivation. Please do not feel discouraged, even if you've not reached the finals. Ronald, the floor is yours.
Yes, thank you so much, Angela, my boss. Yes, good evening, everyone. So I'm just here shortly to make a presentation about Empower Youth in Technology. My name is Tushabe Ronald. One, I work with MUST. I studied at MUST, but I also run Empower Youth in Technology. Just about 3 to 4 years ago, I was seated behind hacking. Later, I am in front of you presenting the fruits of hacking. So Empower Youth in Technology came because of 3 realities. Just as you can see, I came with this. There are 3 realities in Uganda that confront us as young people. One reality is 400,000 youth graduate every year, but 90,000 actually find jobs. That's one reality, right? The second reality is 87% of graduates can't find jobs. That's another reality. The third one is 4,500,000 business start every year. Unfortunately, 75% of these can't celebrate their 3rd birthday. Those are 3 realities. And as a youth, we really had to do something. What are we doing? Just like Camtech, just like other innovation hubs, we started our own youth-led innovation hub. For us, we believe in 3 areas. Number 1 being capacity building. We know all of you guys have potential. We know all of you can make it. Why should you become unemployed after yet you're able to innovate such good ideas? Then we said, let's build your capacity. We do trainings, we do mentorship, we do such hackathons in order to build your capacity, to identify these ideas, not only ideas, but develop business capacity to actually make money out of them. And we know once you get the ideas, once you have the capacity, you actually need financing. So that's why we came with another focus area to do is financing. We run a saving and loan scheme at the YIT, so that when you guys have ideas like how you have them and you have ventured into the innovation world, you come to us, we give you micro loans. That's why we're even partnering with Think Innovations, for example, to actually introduce these loans. So the idea of financing is to actually help you build financing capacity so that you actually put your ideas on the market and make money out of them. Then the other one is marketing. All of you guys, once you go to market, you will need marketing services. We actually run an online media, a YIT media. It has a YIT TV, a YIT news, a YIT radio. The idea is to actually help you guys access marketing services for your ideas. So don't worry, once you go on market, we are available to actually help you push and make money out of these ideas by marketing them. So that's why we say we have an ecosystem approach. So our traction, because we have made sense ever since we started. So as you can see, just like Camtech that has contributed money, that has brought money in this economy, Empower Youth in Technology has also brought $70,000 actually in our economy through grants, through the services we make. So that's a contribution. So you can see we have also gone ahead to win some grants, some awards. Last year we won the Techpreneur of the Year Africa. We also won Startup of the Year in Technology in Uganda. So that's what we have so far done. I might not go through all that, but those are our numbers. So we have innovations on the market. You have seen a YIT TV, the brainchild behind the events coverage. We are live even right now because of a YIT TV. We have so many innovations that we have put on market papers, which is being implemented at Uganda District Local Government. Let's firm up all these. Here you can move. So, just good news of recent. Private Sector Foundation Uganda has actually accepted to fund this idea, the YIT TV, because we developed a YIT app, a YIT media app for you guys to access content. And what private sector is doing is to actually fund this so that it goes wide. Reason being, people need to access content, but the mainstream media is expensive for them. So Private Sector Foundation Uganda is saying, since a youth is trying to give us content, like this hackathon is live and people are watching, so why not invest money, why not scale this up so that people can access it fund-wide? So this is actually good news we received this week. So it's going to be funded and scaled all over Western Uganda, thanks to Private Sector Foundation Uganda. Yeah. So we've not been working alone. So I see the Executive Director of NITAU in the house. Thank you so much on behalf of these people. Maybe they haven't known you, but they will. NITAU has given us fastest internet for the last actually 1 year and a half. For all the young people that have been coming to EIT and you're enjoying fastest internet, your government, so many Private Sector Foundation Uganda, we have actually GIZ that actually has come on board to fund our work as well. They have actually built our capacity with technology at Empower Youth in Technology because of the good work we are doing. So this is just a summary of what Angela was actually telling you. Just briefly, 3 years ago, I was behind there innovating. 3 years later, I am here presenting that I've actually got some good things from NITAU, from Private Sector Foundation Uganda, simply because of platforms like Camtech Uganda. Guys, we are home. Let's make things happen. Let's make it, nothing can stop us. Thank you so much.
Do you feel winners? Do you feel like winners? Yes. Ronald, just a minute. Did you win when you were at the hackathon? He did not win. Yes, but now you are a winner. The point is, every idea counts. Deal or no deal? Yes. Can I have the video of WIPO? As they're preparing that,
Innovation, the uniquely human force that drives mankind's progress. Without innovation, your phone wouldn't be smart, there'd be no GPS, no music on the go, and no HD video. Stories without special effects. Innovation, the uniquely human force that drives mankind's progress. Without innovation, your phone wouldn't be smart, there'd be no GPS, no music on the go, and no HD video. Stories without special effects, no colour, no sound. And unable to look inside the human body, doctors would be in the dark. The intellectual property system exists to encourage the innovators and creators who make the world a better place. The World Intellectual Property Organization, a specialised agency of the United Nations, helps them do this every day across the globe. WIPO provides a forum where governments debate and shape intellectual property laws, such as copyright laws, to adapt them to the changing needs of our global digital society. WIPO's goal is to make intellectual property work for everyone. WIPO operates international filing systems that make it easier to protect and promote inventions, brands, and designs across borders. Everyone, from individual inventors and small businesses to the world's biggest companies, can file a single application through WIPO's PCT, Madrid, and Hague systems to apply for protection in countries across the world. This saves them time and money. In the last 50 years, WIPO has processed over 4.5 million international patent, trademark and design applications for everything, from machine tools to medicines to solar panels. And when disagreements arise over IP, WIPO provides arbitration and mediation as an alternative to costly court proceedings. WIPO gives people the tools to use IP effectively, helping people in developing countries to make a living from their ingenuity and creativity. That means more opportunity and more jobs. Innovation requires information. WIPO provides free access to IP information, including more than 55 million patent documents and more than 25 million records of trademarks and designs. And WIPO trains tens of thousands of people every year how to access, learn from, and use all this priceless information. Since its inception over 100 years ago, the global IP system overseen by WIPO has helped create an environment where innovation and creativity can flourish. That means more minds creating new technologies to conquer the world's problems, more music and more ways to listen to it, more art and culture, and more knowledge reaching us in ever-increasing ways. Every day, creative people all over the world are finding new ways to improve our future. WIPO and the intellectual property system help make that happen.
That's how it ended. Did we watch it? Did we watch it? Okay, ladies and gentlemen, our judges are coming back, and we have the results here. Whoa. But I don't want to scare you. Dr. Stephen is laughing. But allow me to thank you all for your patience, and I would like to thank you for your appetite. You've really eaten and taken the tea. Clap for yourselves. Yes. Yes. Thank you for finishing that tea. In fact, you can pack and go with it at home. Thank you so much. And allow me to recognize the people behind the scenes. Please stand up. Naomi, stand up and the people see where the cookies were coming from. Yes. Mary. Yes. But Mary, you'd give one cookie. Give the people cookies. Yeah. The judges are back. Allow me to recognize someone still in communication. We have public relations, that's me, but allow me to recognize the International Relations Officer. Please stand up for recognition. She's the one who speaks English in our department. She's the one who speaks to our donors. But me, I have the NITA, you guys, so we are sorted. Some people are too heavy for me for recognition. Dr. Dieter, Dr. Santorino. Please come and recognize your guests and appreciate them for coming. Yes.
All right. One day, if you decide to organize a medical technology hackathon or a hackathon of any sort, you will realize how many moving pieces you have to manage. It's a roller coaster that moves in so many directions at different speeds. So at this point, I would like to recognize so many people in no particular order. Before I start the recognitions, I have a very special announcement. And this special announcement is from Kododu Biomedical Engineers. And the CEO of Kododu Biomedical Engineers is here, Sir Koi Koi. So Sir Koi Koi has great connections and he's making a great offer. Come here. So that if you don't deliver on this, we see you. But I know he's a man of his word. So Sir Koi Koi is giving an offer through the Silicon Valley, USA, and he writes, we shall sponsor 2 representatives from 2 winning teams to Silicon Valley, USA. And these teams are going to meet other international hackers at Silicon Valley. Thank you so much, Sakoikoi. So, in no particular order, I really want to thank these people. They either funded their staff to come here as mentors, or they actually supported financially, morally, and socially. The country director, Nita Yu, thank you so much. Nita Yu is the grease behind all these innovation hubs. Without internet, there is no innovation. Without internet, there is no hackathon. Thank you so much, Nita Yu. We would like to thank the Uganda Institute of Communication and Technology, represented here by Mr. Gustavus. Thank you to the management for sending staff to this hackathon. Camtech Uganda started, and Camtech Uganda has a great and thriving baby. And this baby is called the Center for Innovation and Technology Transfer of Mbarara University. Our director for CITT is here. Thank you so much. I would like to thank the International Relations Officer for coordinating all our international guests. Thank you. Our Public Relations Officer with the entire media team of Mbarara University. Thank you so much. All the media houses represented here, thank you so much. Our beloved director of the Global Health Collaborative, Dr. Asimwe. We are so indebted to this gentleman. 2 years ago, Director, we lost all our funding, and we survived on funding through Ministry of ICT and through the Global Health Collaborative. So, thank you, GHC, and thank you, Ministry of ICT. Farm BioTrack. Farm BioTrack is heavily represented here by Engineer Anki. Thank you so much. Our partners from Philcro Africa, please stand up for recognition. Thank you. Uganda Registration Services Bureau, thank you so much. Uganda Industrial Research Institute, thank you for opening your doors to us, and thank you for being here. The Nursing Department of Mbarara University, Grace and your team, we are indebted to you. The Department of Community Health, we are so grateful. AIT Media, thank you for giving back to community, and thank you for being a big and resourceful team. All the media houses, we appreciate. We have been trending in this country for the entire weekend. Thank you so much. Now, I would like to call in the organizers. Please come over and let people see you. Now, these people have been working so tirelessly for more than 3 months to pull this together. They do this not from their brains, but from their hearts. Thank you, and thank you so much. May God bless you. Now, in a special way, I would like to recognize the Camtech Uganda core team. Please, if you are among the Camtech Uganda core team, please come over. Now, when things get bad and we have stepped on people's toes, we hold ourselves together and we cry together. She has been crying with us. Thank you, Angela. When things are good and we need to laugh together, we meet and we laugh together. If we have to rejoice, we work together and rejoice. This team, as I said before, believes on one thing. We believe that true happiness in ourselves, we will gain it by positioning ourselves to be useful to others. In whatever way, as long as we think we are being useful to others, we will do it. So, Sharon is our communications and marketing manager. Nurias Nambogo manages our grants and proposal ecosystem. Martin is the manager of the Innovation Lab. Thank you. Mackenzie is the deputy to Martin, so he's our deputy Innovations Lab manager. We have this strange culture. When we want something, even if we don't know where the money comes from, we will say, let's start doing it and let's figure it out together. So we have brought on board Ivan, and we've tasked Ivan with Mackenzie to build the Robotics for Children program of Camtech Uganda. With zero funding, we had our first graduates. And I would like to recognize one of those graduates who participated. Actually, there are a couple of them. Please welcome part of our graduates from the Camtech Robotics program. Ethan and your team, please come over. These two pupils joined our robotics program. It's the beginners program. They graduated from the beginners program. And there we teach them science, innovation, and technology in a fun way. In addition to that, we teach them soft skills, including presentation skills. So thank you so much. All right. Thank you. So I was talking about these two gentlemen. Without money, we started a program, and we have staff who are supposed to champion this program. We don't know where the money is going to come from, but we think that with all of your support, we will make this. Okay? So please, you know, there is a brilliant program called the Camtech Robotics for Children program. We need to grow that program together. And if we want to be the ICT hub of the world, let's start at a tender age. So, irrespective of who you are and where you come from, if you think there is a way you can be of help, reach out to us. Let's build this Robotics for Children program, and we will be so happy we all partnered and we did. Night is our administrator, and she has been with us for so many years. Thank you so much, Night. And Bosco joined us this year as our impact manager. Thank you so much. So, yesterday I said Camtech celebrated 10 years. And we want to meet here again to celebrate our 20-year anniversary. And to celebrate our 20-year anniversary, all of you here has a role to play. So if Camtech doesn't survive, you ask yourself, what did you do to enable Camtech survive? It's not all up to us. To raise a good program, we need the entire community. It doesn't matter how much. Your sacrifice to be here up to this time, 7:30, is the reason why Camtech is surviving. So thank you so much for your hard work. Yes. At this moment, I just want to give this opportunity for Director, Center for Innovation and Technology Transfer, to please welcome our Director of NITAU to give his remarks. And after he has given his remarks, I'm going to welcome the Director of the Global Health Collaborative to be here and please award the finalists together with the Director of NITAU. So my Director, CITT, you're most welcome.
Sorry, Dr. Data, just before he speaks, one of the innovators forgot their kit here. It's the e-pill. And his innovation was about forgetting, so I think we've classified that one.
Yeah, thank you so much, our country manager, Dr. Data Santorino, and the Camtech team. I would like to congratulate you upon this great milestone, the very first of its kind after COVID-19. Let's clap our hands to this great team for such organization. Thank you so much, and we thank the Almighty God for enabling us to take a step after COVID-19. The country director, NITAU, you're most welcome to MUST. At MUST, we want to talk, but also walk the science and technology. That's why we are proud of Camtech Uganda for the great strides over years, now the 8th time holding the Hack-A-Thon. I congratulate all the participants of the 8th Hack-A-Thon. I know it has not been easy. I know the hearts are pumping, waiting for the final judgment and the award. I know what it takes. These teams that were coming here, if you could now measure their pressure levels, it is very challenging. But we thank you because you're already winners. Having participated to this level, it means a lot to Camtech, but also it means a lot to the university. I would like in a special way to welcome our partners for the great support that you've given to this successful event of Hack-A-Thon 2022. Thank you so much. Let's clap for our partners and applaud them. I'll not repeat them because Dr. Santolino has already mentioned a number of them, but you've worked with Camtech over years, and we thank you for the great support that you've always given. And in a special way, I would like to thank NITAU that you opened gates for innovation by augmenting our innovation lab with a very high-level internet connection. Thank you so much, Mr. Director. Thank you. I would like to thank Dr. Santolino and particularly the Camtech core team. You've made MUST proud for the great innovation journey that you've walked over years that enabled a great ecosystem that has yielded many platforms for innovations in the university. I would be very unfair if I couldn't recognize that kind of impact that you've created over years. Actually, what the Center for Innovation is riding on is it is leveraging on the great foundation that Camtech has established in MUST over the last many years. So we thank Camtech in a special way, and we thank you, the innovators, for not sitting down on the God-given talent of thinking. I was recently with my friend in Spain who took me around, and they have started working on what they call war rooms. War rooms. There are no guns, but people sit there and think and co-create. And that has resulted to a number of innovations that are sprouting out in Spain. So let's have that model of not sitting down and dying on our talents, not scale them up to the level that we would want to see saving our nations. Because there are many societal problems that we must generate solutions for. And I was recently enticed to this particular saying that do not walk, do not go to where the path may lead, but instead go to where there is no path and leave a trail. How are we going to be known? Let's innovate something that is sounding, that will leave a trail in MUST, leave a trail in the country, but leave a trail at the global level. And we have the capacity to do that, and we are able to do that. As I conclude, I would like to empower all the innovators that have participated in the 8th Med Hack-A-Thon that the Center for Innovations and Technology Transfer has been blessed to receive some seed grant from government. And we are trying to justify that as MUST, we can move strides than even Makerere University. I'm sorry if there are some people from Makerere University here, but I have to speak well for my institution. Because we know the potential that we have as Mbarara University of Science and Technology. And we are going to walk that journey until we reach the promised land. So I call upon you to make use of what we get from here, but also the teams that have participated. In October, we are going to award 12 teams with seed grants. 4 are going to generate high-tech prototypes, and the other 8 teams are going to generate products. So the 4 teams are going to be awarded 6 million, each of these teams. And those generated products that have already a prototype, you're going to be given $4,500. That's about 16.5 million. And then we'll support in the 3rd quarter, which starts in January, we'll support 2 spin-off companies with 7 million, 2 of them. So when these calls are out, we are working out a modality with the already existing innovations. Because we don't want to reinvent the wheel. We need to start from what we have and support those that have already showed cause that they can make their potential go to another level. So I will discuss with the director of Camtech, and we see a way on how these teams can join the other mainstream, even if they are not successful here, but they can get supported to move to another level. So The same will apply. I was talking to Anke about the farm biotrack. We have incubators there. We need to see a system that can start from what we have already and then move higher. So we expect from this innovation hackathon, the 8th Med Hackathon, support. I am thinking, Dr. Santolino, that we can support at least 4 teams that already have a prototype that can move to another level. And probably 2 teams that already have, that are yearning to generate a prototype. So let's work together and see how best we can generate the potential that we have out of MAST. We don't want to begin with anyone else. You've already participated, you've already sweated. Why not move and support you to the journey that you've started? Finally, allow me to recognize in a special way the Ministry of ICT that has been here with us this morning, represented by the Minister. We have a very good working relationship with the Ministry of ICT, but also the Ministry of Science, Technology and Innovation. Let's keep this moving forward. Ladies and gentlemen, I congratulate the winner to be, because there are already good teams that have been here. I was actually wondering what is going to be the best team out of this. So I already see the potential that we are going to get the best out of the better that have been here. Like the motto at Ntare School, our great school here, that you need to better your best. So we need to see that we get the 3 out of this, but these other ones all qualify. And I know that at Camtech, there is no word failure. No, you are actually postponed to another level of funding. So please don't call yourself failure when you see yourself not getting the award. You know that the co-creation laboratory is there to support you move to another level. I recognize the presence of staff from Mbarara University of Science and Technology who have ably come to participate in one or the other. And I think it's a great milestone. From Friday where we started with our cocktail up to date, we have a reason to thank the Almighty God. Thank you so much, ladies and gentlemen. I would like at this moment to invite the country director of NITAU to come here and give your remarks, sir. Thank you so much, Dr. Mugasa. You're most welcome. Thank you. That's a little for me, please. And welcome the director, the country director. Thank you so much, sir.
Thank you. I am Dr. Mugasa Hatwib. Let me just clarify this. I'm the executive director of the National IT Authority of Uganda. And I have also been delegated to represent the Ministry of ICT and National Guidance. So I will play 2 roles, but in the interest of time, I will not give the full speech because I may put people to sleep. So the Ministry of ICT and National Guidance, that was represented by our Minister, Honorable Joyce Sebogwawo, asked me to deliver a speech because of other engagements. She was not able to continue with us, but she has delivered her speech, which I will forward to Camtech. And NITA, National IT Authority, is a government agency, an autonomous government agency under the means of ICT. I tell people we are like air. We are everywhere but nowhere. You don't see us, but we are there. We have provided internet to the whole of Uganda. We provide internet to government agencies, to institutional agencies, academic agencies, to the private sector, but specific organizations in the private sector. For government sector, public sector, we provide to all, but in the private sector, we mainly focus on academic institutes, tourism, and I think the health sector. So under this mandate, we have been able to provide internet to Camtech and Mbarara University, to the Innovation Hub. We are not stopping at that. We are, because with internet, this is just a channel. What will you use it for is the next step. What is the benefit of internet? So we are cognizant of the fact that there's a lot of information that's being shared on this channel. We need to harness this information. We need to store it, but also we need to share it. So we set up a new directorate, Directorate of Data Protection and Privacy. This information is very important. We have also set up a tool. We call it UG Hub. UG Hub now enables private and government agencies to efficiently and effectively collect and share information and securely, because there's also a risk of having all our data just out there in the public domain. I've been hearing a bit about innovators saying that they're going to collect data. You have not yet. You need to be very careful how we are going to collect that data. There's a lot of, especially health data, there's a lot of very sensitive data that needs to be protected. So I ask innovators who intend to share or to collect or to disseminate this health information to to be familiar with data to be educated on the data protection and privacy laws and regulation of Uganda. We will help you collect this data securely and to be compliant with the laws within Uganda, but also we will help you if you need to integrate with another government system. If you need to integrate, we have a platform that enables you to integrate with those other government systems at no cost. So come to NITA, or you can access that information. You can send us an email, info@nita.go.ug. They are very critical systems in government that can enable you even do much more. I've been hearing about costs. We are connected to URA. You are connected to payment gateways. We are connected to URSB. URSB is supporting you here. We have access into URSB's database. We also have access into the National Register. So come prepared, come with your proposal. We shall help you connect those data sources. Thank you. With my final remarks, I would like to thank the leadership at Camtech for this hackathon. It's a very good innovation. We should not stop at this. We should even build more onto this. We intend to support Camtech in the future. I can't make promises right now, but yes, you are in our plans for the innovation and for the business and innovation parks for Uganda. We're developing regional parks, and we have a target to develop 25 regional parks within the next 5 years, so 5 per year. So Camtech, we will be looking at you in being part of this innovation, or part of the initiative. We also intend to develop a high-performance computing center at our data center. We have a national data center, but want to separate high-performance computing just for education and innovation. So we will also request Camtech's leadership to get in touch with us when we're done with, or when we're going to begin speccing for that high-performance computing. We already have funding from the World Bank. Now we're going into implementation. So when we start the implementation, I ask the leadership to come and work with us to spec the best high-performance computing resources to be deployed at our data center. So allow me to take my leave on that, and to congratulate the soon-to-be winners. I believe all of us are winners. We should not feel bad that we have not won, but with this hackathon, we believe we are all winners, and we should not stop at this. Thank you very much.
Dr. Data, you need to come close here because this is really heavy. Good evening, ladies and gentlemen. The time is now. I don't know why DJ doesn't have drums to hit. So, the first awardee this evening is the second runner-up of the 8th Camtech Uganda Annual Medtech Hack-A-Thon, that is to build a resilient healthcare system in the era of emerging pandemics through innovation. And this is none other than Catheter Monitor. Than Bloodlink. Team Bloodlink. So we had many people who presented, we had many people who pitched. Now this award goes to the best pitcher in the entire hackathon, or today. The entire hackathon. This is an individual award, yes, and it goes to none other than Mercy Kobusinje. Everywhere. For security reasons, but this grand winner really 3.5 million Uganda shillings. You already had some trips to Silicon Valley. Which other things? So many things. The winner is Sukari Care.
Oli muwankusi muganda wange togo watogwa musuri.
Medical Technology Hack-A-Thon. We thank you. God bless you all. Music.
Olaba educator baku street natuza.
Thank you so much.
The director is telling.